deviation of that prakriti by dosha, and you evolve a medicine by it, the knowledge of what dosha it works on. So that's why through the same organizing principle, all these three are threaded. What is the very interesting thing is, how do Ayurveda doctors actually assign a prakriti? I was 30, maybe 50 kgs when I was in my PhD. I became 72 when I was after PhD. I had one set of problems before PhD, one set of problems after working. So can this be threaded? Is the question is there a way to thread and have a understanding about a person by looking at all the dimensions, or the prakriti keeps on changing? So Ayurveda has a very vivid description. I don't understand Sanskrit, but this is the one which I have worked with the last 20 years. It actually talks about a person is a product of not only the parents' gametes, it's called Shukra Shonit Sanyoge. Then it's also a product of epigenetics, which is Matur Ahar Vihar, and the age of conception, so Kal Garbhashay, right? But once a person is born, the individuality is governed by the ethnic population, by the geography from where the person is coming, in the age when you are examining, in the season when you are looking at the person, and then you ascribe individuality. So they actually have jati prasakta, kul prasakta, desh anupatini, apportionment to the desh, vay anupatini, apportionment to the age, kal anupatini, apportionment to the season, and then individuality, which is called as pratatmaniyata. These are all different subjects. In modern medicine, we talk about epigenetics differently, population genomics differently, but they have threaded it that if you're looking at an individual, that individual is a product of all these kinds of things. Question is then, how do you assess such kind of an individuality? So this is what I will not get into, but this is the area where I delved on. So we took individuals who are of predominant prakriti, classified them based on Ayurveda, looked at whether if we take the peripheral blood, do they show differences? If we look at the genomic signatures, do they show differences? If we look at their metagenome, do they show differences? So these are all the things we have done, and I'll just show you how we've developed a framework. But nevertheless, this is a review I just wrote in the beginning of this year as to how this science can tell about how you can have a description of phenotypic individuality, you can identify genetic individuality, you can identify from the genetic individuality the mechanism of why Ayurveda drugs work differently on different individual, why that would matter in a modern setting for stratification of individuals, how that can also be useful in pharmacogenomic setting, how that can help you identify biomarkers and actionable targets, could be used for repurposing. For example, COVID was the test time for us, whether genomics at all would be relevant, and how then we can start to think of building a framework for integrative medicine where one needs to coexist and crosstalk, not necessarily learn each other's practice. Okay, so this is where this was our first paper. It was way back in 2008, where we showed for the first time that there were differences with respect to genome-wide expression and meaning all the biochemical parameters where there is a range. Prakriti falls within different ranges. So, for example, if a hematocrit has a broader range, if some individuals are in one part of the range, then moving to the second part, even in the normal range, is actually a pre-disease state. We don't capture it because we take all the individuals to the last of the range and start treating them. So we found certain differences which differentiated Vat dosha from Pitta dosha from Kapha dosha, and we also found that in the peripheral blood, the cell proliferation signatures were higher expressed in Vat. And Ayurveda Bhavna, with whom I work for the last 2 decades, actually there is a shlok which is in Charak Sutrastan. It's called Parmanu Bhed Parisankhya Bhavanti, is the work of Vayu, meaning cell division, morphogenesis is governed by Vat, is also described in Sanskrit, God knows how. But this is what we talk about an iterative. So Ayurgenomics is a iterative science where we take hypothesis based on Ayurveda kind of knowledge, test it out with the state-of-art methods, Once we get the observation, we give it to the Ayurveda doctor to ask whether that makes Ayurveda sense, and then take the knowledge to the next level. So this is the framework we have built. So from the knowledge of differences in peripheral blood, we asked that whether those differences would matter at the genetic level. We discovered a gene for high altitude adaptation on the sea level people of different prakriti, whom we found that variation was relevant in high altitude adaptation and adaptability and maladaptation conditions of HAPE. And that axis of hypoxia responsiveness was taken by Anurag Agarwal, who is an Amazonian respiratory medicine person. He actually used a mouse model of asthma and modulated the same gene by a small molecule inhibitor, and he showed that in asthma, if you modulate hypoxia, then it leads to inflammation and even more steroid resistance. And we could also show that how this axis was relevant in bleeding and thrombotic outcome, and could protect high altitude people or Pith Prakriti people. Bleeding is a protective phenotype in Pith Prakriti. And then because asthma Pith Kapha axis came out in the model, so we took a drug which is called as Adatoda Vasika. It is actually used for treating asthma by an Ayurveda doctor. Bromhexane is one such medicine which has come from Adatoda Vasika. So we said that if this were true, then if we treat Adatoda Vasika to asthmatic mouse, would they actually have alleviation of symptoms, and would that also intersect the hypoxia axis? So when we did this, we treated the mouse with this medicine after giving hypoxia, and the mouse had all the inflammation, steroid resistance, airway hyperresponsiveness, collagen, all of it. When we treat with Ayurveda, with the Ayurveda medicine, all those features not only get alleviated, but we measured the mitochondrial shape, mitochondrial function, and lung transcriptome, and we could find that it intersects at the hypoxia axis. When that came up, then we said that if this medicine works in hypoxia, then other hypoxia model it should work. So sepsis model was taken, and the preclinical model of COVID were taken, and it was found that it alleviates the symptoms for all the hypoxia axis. During that time, COVID came, and they had a chance to do a clinical trial, and they found that a window of hypoxia and inflammation along with tinospora they used as a control, they found that Adatoda Vasika can actually alleviate. This paper has just come out in European Journal of Medical Research. So now you can understand that even by doing this, we could sort of say that, okay, people differ with respect to hypoxia, people differ with respect to cytokine storm, all those kinds of condition. Maybe there is something to do with the individuality of the person, and if we know that this knowledge might be actually useful for managing our health, or also understanding if an Ayurveda doctor is giving the medicine and you know the component of the medicine, and if that has a molecular readout, then you can also use it with an evidence-based usage. We also used another platform called Connectivity Map, where signatures of millions of perturbagens have gone through microarray, and you look at signatures of the drugs, and you use this platform for lots of repurposing. For example, two medicines, two perturbations, if they show the same same kind of readout, the thought is that if you know the function of one drug or the mechanism of one drug and another drug is showing the same pattern, could you actually use it for repurposing? So what we thought was that we can actually use this platform for also testing out whether we can understand mechanisms of action of Ayurveda drug. So for example, if an Ayurveda drug is used for two different conditions and it has got too many molecules, is it that the molecules separately go and target the other disease, or they work through a common unifying link? So I tested this out in a drug which is called a Sesam plus Parera. It is used for treating women in postpartum bleeding kind of problems, and it is also used for treating dengue. Now, for a modern medicine, it will be like one is going to a gynecologist, the other is going to a medicine. How can you treat the same doctor with the same medicine treats both these conditions? So this was a very ideal one to test. Now I'm cutting a very big story short. We could show that the drug molecules target the estrogen axis, and through that estrogen axis, it also regulates protein synthesis, whose inhibition is relevant in dengue. So we tested this out in dengue model. During that time, COVID came, and COVID is also recommended in Ayurveda as a yukti for treatment during COVID. So we tested it out in vitro models of SARS-CoV-2 infection, and we could actually see that the compound and the individual molecule can bring down the titer of SARS-CoV-2, but the whole molecule actually, meaning the whole formulation, brings back down the titer by 90%. So these are all published, but nevertheless, in these short span of time, when you have things like COVID, and if Ayurveda doctors are giving medicine, it also shows that this kind of a framework would work, right? Now, the other condition, the cell proliferation, we made lymphoblastoid cell lines of specific Prakriti types who were Vat, Pitta, and Kapha, and we actually showed that the baseline cell proliferation rates were different even in the LCL lines. And then we could show that the ones in which the cell proliferation is higher are the ones in which are more DNA damage responsive. So if you have more DNA damage proneness, then you would have to have a protective phenotype of maybe cell proliferation. So that actually becomes an inherent baseline of an individual and not an actionable baseline for that individual. Now we asked a question whether this could be relevant in a modern setting. So we found that NIMHANS has done a study for people who have bipolar disorder. They treat with lithium chloride and find that 45% of the people do not respond to lithium chloride. And they wanted to test that in lymphoblastoid cell lines, and they find that 50%, all the 45% of the people who respond actually have a cellular phenotype where inherent cell proliferation rates are higher. So this actually shows that if you could also have a core cellular phenotype differentiating amongst the people who have differences with respect to broader system level phenotype. So I moved to Jodhpur, and I had to start afresh. And here I actually delved into one thing, which is why Akshay may have invited me to this meeting. So I asked a question that if connectivity map can actually be used for probing the mechanism of action of drug by taking a transcript of a person, could we actually test whether practices like meditation and yoga, which have known clinical benefits, is there a possibility to probe them through such a kind of platform to see whether they have actionable targets? So there was a study of inner engineering retreat, which was done in Texas, Grainsville, where 100 people, 4 time points, they had taken time 0, 8 weeks of preparatory, 8 days of inner engineering, and 3 months of follow-up. They had collected 100 samples. It was a clinical study where they had done physiological, biochemical, questionnaire-based, mental test, all of it, metagenomics. And here in PNAs, they actually showed that they had done RNA-seq for all these individuals in 4 time points. And RNA-seq means you have an access to the data. So we reanalyzed the data from the perspective of connectivity map. The question was that if these work through some actionable points, would we be able to find what actionable points through matching with the drug targets? What was very interesting, and this paper, it's there out in the bioarchive. I'll just complete, yeah. So we could actually find that nearly 438 drugs connectivity was there, where the innermost circle is the connectivity with the drug when in the preparatory, the middle one is after 8 days of inner engineering, and after 3 months follow-up, those signatures are gone. And these have connectivity with positive connectivity with drugs and negative connectivity with drugs. And if we look at the targets through which, meaning to which these connectivity was there, it was all mapping to the neuroactive ligand receptor signaling pathway, which are more to do with parasympathetic and sympathetic axis. And there were inter-individual variability, which is there in this paper. So now we think that if such a kind of a thing is there, then one can start to think about making interoperable platform for connecting the two sciences. And that's where we could actually have an understanding that from all these aspects, I would understand I would be a Pitta-Vata kind of a Prakriti. And if I had that knowledge earlier in life, maybe my interventional strategies might have been different. So this is what we are now doing in IIT Jodhpur. What we are doing is we are taking the principles and practices using data sciences, engineering, multi-omics technologies to be able to see how we can actually build platforms where ontological crosstalk is enabled, and we could actually deploy it in a larger scale settings. We are leveraging science of Ayurveda and using it in all areas of diagnostic therapeutics and also doing capacity building. So we have a very interdisciplinary team of electrical engineering, computer science. I am from bioengineering. Our director, who is a mentor, is a computer vision person, and lots of collaborators. But we are looking for collaborators because this needs big data, this needs validation in different kinds of settings. So thank you.
Thank you, ma'am. We're totally mesmerized. The amount of the work and the data which you have shown, probably 60 minutes would be less for the kind of presentation. But I'm sure this talk is going to evoke several questions, because this is a beautiful amalgamation of the Ayurveda with the symptoms which we have, and we've not seen it. As a surgeon, I would be very happy if you look at the Prakriti of a patient and tell me how is this patient to behave post-operatively.
Yes.
Because we know for sure that patients who are operated for a similar surgery, the outcomes are different, right? But I do not know pre-operatively who are these patients who are going to do well and who are not going to do well. Looking at the your concept of cell proliferation, where you are using estrogen receptors and the components to affect those. So these are the very things which we are looking in cancer patients, where we are looking at estrogen receptors and how we can modify them to have better response after surgery.
Yes.
So I think there is a lot of more area which needs to be covered.
Yes.
I think probably for this reason, Akshay called me here to get mesmerized, and I am mesmerized.
Thank you so much. So the idea is that if I have been able to get Vat Pitt Kaph in your language, which is what you understood, this I called as Ayurgenomics. It's not a one-way talk that I tell you and you believe and you do it. Nobody will do it. Ayurveda doctor will also not do it. Modern medicine person will also not do it. But if you actually get to a platform which enables you to crosstalk in your language that you think estrogen is relevant and they think estrogen is a pith modulation, then they would treat it from a pith perspective and you would treat it from estrogen perspective. But then if if the patient is taking the medicine because doctors don't talk and they fear telling the modern doctor, I'm taking Ayurveda medicine, then they will not talk. Only when they have a side effect, the doctor asks and they say they are taking Ayurveda medicine, and the whole building up of side effects of Ayurveda medicine, the body of knowledge gets built like that. Because half of the time, till things are going all fine, nobody speaks up that you are taking Ayurveda medicine. So that's where the problem is. Patient is least educated and he takes the decision because doctors don't talk. So the idea is that whether you can actually get a platform where this talk is enabled so that everybody is comfortable and people have more options, more choices, and evidence based.
Very, very impressive talk. I think this is what we need in medicine these days. How do we have the same platform? I just have a very, very basic question. Getting a genetic, mapping of every individual to look at what is the type or what is
Is impossible. Impossible.
Is impossible. I have a very simple question for you. Do you have a kind of a working model or a functional grading where you could divide on the basis of clinical symptoms or a scoring system where you can divide or these people into various prakritis, which is more understandable to us?
So can you, if you give me a minute, then I can explain, or we could have it over tea time, because we are doing that. We have taken all the human phenotypes of diseases through ontology.
Yeah, maybe we can.
Because this is important.
Okay, I'll give you just 1 minute.
Okay. So this is the question I asked, that if a person comes to a modern medicine person or an Ayurveda doctor, how do they see them, and whether seeing that can be brought up into one kind of a platform. So there's a person called Peter Robinson who has developed this ontological framework called human phenotype ontology, where he's deconvoluted the syndromes into phenotype space. And there are 10,000 phenotypes for 8,000 rare diseases. So 1 million phenotypes if you put all of them together. So I got 7 or 8 Ayurveda doctors to annotate each of the 10,000 phenotypes into Vat, Pith and Kaph. And then I reanalyzed all the OMIM diseases on the context of what they see. As Vat or Pith or Kaph. So we used natural language processing, we use clustering algorithms, and which was very interesting that we found that a set of rare syndromic disorders which are seen by, so because I gave those clusters to modern doctors, pediatrician, nephrologist, to analyze as to what kind of doctors they will go to. Okay, because they are a bin, a pediatrician, endocrinologist, medicine, rheumatologist, they will go to all those kinds of doctors. But if you do by Ayurveda, you cluster a set of disease which inherently has a DNA damage response kind of genes, one set of groups which has an inflammatory kind of an immune T cell immune response kind of axis, and in the third there is the cilium organization structures, something which is a part of ciliopathies, which are again a kind of a mixed disorder. They actually come. So the idea is that sometimes we miss the meaning core phenotype. For example, in operation, if a person has a pro-inflammatory phenotype, according to Ayurveda, they would have more bleeding outcome. But if a person doesn't has a more adhesion kind of a phenotype, they might have a different wound healing kind of an outcome. So there is a difference, and this is what we are actually getting. So there is a possibility that we can merge this and make an app where you would be able to have a more systemic look at both the aspects.
Just one or two questions from the audience before we come to the conclusion. Yeah, please.
Yes.
Can you stand up and identify yourself?
Hello, very interesting lecture, and
Thank you.
inspired after seeing the word meditation signatures.
Yes.
And I'm more interested, can it be translated in terms of molecular signatures?
So this is just fresh out of oven, you can say. And what has scared me is that if there are 430 signatures of antipsychotic, antidepressant, and anti-all, so I had a question that meditation should also have side effects if not done properly. And that is what in the ancient times you were given a diksha, because it's a non-pharmacological thing, and if people just go and teach every else that what they have learned they teach, maybe they would have an adverse outcome in certain personality types, right? So I also went to the data that do people report that meditation can be practiced by everybody at all times. So there is actually a site called Cheetah House which takes people's experience after meditation. People have anhedonia, suicidal tendency, pain, anxiety, insomnia, and they treat the people by giving the right meditation. So this is where the signatures can come in useful, that not all meditation will work for everybody and any time of the day. Right? People have to think that this is also medicine, because it works through, if it has a medical outcome, then actually it is working through some medicine. So now supposing you drop one day meditation, no, and I'm taking medicine also anti-diabetic or antipsychotic with meditation, one day I'm doing meditation, the other day I'm not doing, then you might start having to calibrate your medicines also all the time. So this is where actually objectivity will really matter. And when you see that there is a difference in your expression signature in the peripheral blood, then you would always be alerted that you should not be practicing everything which is out there in the shop and you take it, because all of them will work through some metabolism axis in your body, right?
Thank you, ma'am. Thank you.
Can we think about
We can have a discussion later. I would not like to kill other people's
Any
time.
question? If there is none, then we
Thank
thank
you.
you for this
Thank you so
wonderful
much.
talk.
Thank you.
Thank you.
Thank you, ma'am, for sharing your idea on aerogenomics. I think it's an exciting concept for everybody present here. I would request the chairperson to join us on the stage to felicitate our speaker. ट्रे ले लो. I would request Dr. Akshay to please felicitate our chairpersons. Yes. Thank you, sir. Thank you for joining us. Now I would welcome our next chairperson for the session, Professor Sanjay Badada, Professor and Head in Department of Endocrinology. He's a founder secretary for Punjab and Chandigarh chapter of RSSDI, Indian Society of Bone and Mineral Research, have been awarded by Mentor Award US Endocrine Society or in Oration Award by ICMR Endocrine Society of India, Research Society for the Study of Diabetes in India, Young Investor Award by Indian Society of Bone and Mineral Research, India. He has been more than 350 publications. I welcome you, sir. I request you to please introduce our next speaker, Miss Molly.
Thank you, very good morning, and really pleased to see a conference which related to the yoga and meditation in this auditorium where every day we discuss the modern medicine. So, my pleasant duty to introduce the next speaker, Dr. Molly Beckins. She is IAYT certified yoga therapist, NAMA certified Ayurvedic health counselor, co-owner Yoga North International Soma Yoga Institute, co-founder the Soma Yoga Methodology, and honor of Yoga Therapist and Somatic Educator, Yoga North International Soma Yoga Institute. Her talk title is Certification of the Yoga. So while madam is coming to the dais, I have to make some comment that it is really very, very interesting because it will generate opportunity to practice the yoga, and that will also help to earn the livelihood through the yoga, not just doing the health. So with that brief comment, stage is yours, ma'am. Please go ahead.
Thank you, sir. Before that, I would request the chairperson to please note they are given 30 minutes. First bell to be ring at 20 and 10 minutes of question answer session. Thank you, everyone.
Thank you. First, I want to say thank you to Professor Mitali. It was a wonderful talk just now, really. I'm thinking much about that. I'd like to take a few minutes to express our gratitude for hosting us and introduce you to our organization, the International Association of Yoga Therapists. I'm not sure that everybody knows about our organization, and it could be nice to bring that forward. So we call ourselves IAYT. You might have heard that name a little bit, and I'll go into a little bit about that. But I also want to say thank you to Dr. Akshay for his gracious invitation and for the wonderful reception that myself and my colleagues, Alyssa Wustrel and Sue Tebb, have received. We are so honored to be here. I'm personally so grateful for the teachings of yoga. I'm so grateful for the teachers, the realized beings, and for all of us here that are continuing to take these deep, deep foundations forward into some incredible work that I think is going to serve humanity in ways that we know, but humanity doesn't quite know that, right? So that's the excitement that's happening here. You might notice that my voice is a little bit off, and I will do my best to keep it going, but I'll let you know. This is the wrong deck. Wrong deck. Wrong slide deck. Well, I can keep speaking a little bit to what's happening. We have a slide deck for tomorrow's work instead of today's work, and so I'll just speak a little bit to what I have. I'm going to be talking about accreditation and certification. Those are the two big things that we do at IAYT. We accredit yoga therapy programs at institutions, and we certify yoga therapy students once they've completed a course in yoga therapy, 800 to 1,000 hours, and they get a certification. They first graduate from their program, and then they come to us for registration and certification. And so that is two of the main things that we have done as an organization, but there's been a lot that's led up to that point. And what's led up to that point were, over 25 or so years ago, we started to look at bringing in some standards. We wanted to build yoga and yoga therapy in a safe, level playing field and bring forward the emergence of a yoga therapy profession. And that has been our job. And so what first happened is we started a standards committee. And with that standards committee, we had some really wonderful individuals from all over that were in the organization and outside the organization that could help us think about what would standards be for a yoga therapy teaching program to certify yoga therapists. And so it was quite extensive. These standards have areas of competency, have things that we think that every single yoga therapist who graduates should have to have. And so that was our first charge. And then once these standards and competencies were put into place, then we went on from there and started to move toward getting accreditation. How will we get schools to apply? We started to have an application process for schools to apply. And I don't have the numbers of the years in my head right now. I was going to use my slides for that. But we did that through a few different years. And then after about 2 years of, again, that work where we went back and forth with schools and then started to accredit, we accredited 12 schools the first time around. And then again, we continued our process, we refined our process, and we accredited 12 more schools. So I have a little bit of a list of some of our timelines and some things that I think would be maybe helpful. So what is accreditation is probably a helpful thing. So accreditation might mean many things to different people. At IAYT, accreditation is a process by which recognized authority assesses and officially recognizes the competence, credibility, and quality of an institution, program, or individual. We chose to go with programs right away because we felt that once we had a standard for programmatic accreditation, that then we would have that set of standards to then apply to individuals that wanted to be yoga therapists. At IAYT, accreditation is a process by which the authority recognizes them. IAYT is the self-regulating agency that officially recognizes two things: yoga therapy education through a programmatic accreditation process and individual yoga therapists through certification process. So what's the purpose of programmatic accreditation? I think that could be helpful to know. In the context of education, accreditation is commonly used to evaluate and ensure the quality of educational institutions and programs. Again, IAYT is focused on yoga therapy programs, not full institutions. There are many institutions that will have a 200-hour or a 500-hour yoga teaching program, which is really different from the competencies-based, standard-based program that we support with IAYT's credentials as being an accredited program. So we focus again on those programs, not the institutions. IAYT accreditation is a peer-reviewed process of yoga therapy programs, and I think that really ensures that they meet established standards of academic excellence, institutional integrity, and educational outcomes. The accreditation process involves self-assessment by the program. I can speak to this very clearly because I also have an accredited program. So I'm the president of the board right now for IOIT. But before I did that, I put my school through this accreditation process. And it was kind of a several year process, and it took a lot of blood, sweat, and tears in many ways to get our program to go through. And we learned a lot about ourselves and how to bring our program up to the standards that were required by IOIT. And so I think it was something that was not easy for us, but it was something so valuable because in the end, we came out with something that we felt was safe for the students, that we felt was safe for the people that they would be sitting with and serving in the community, and for the profession. And so that is part of what the peer review process and the self-assessment is about. So after our self-assessment, we were followed up by an external evaluation that is conducted by a team of experts that have been asked to come into our accreditation committee. And those folks read through all of our documents, plus all those other schools that I was talking about, and gave us an accreditation. I also sat on that accreditation board several years later after my school had been given that award. And I think that was because I felt like there was such a great integrity to the process that I wanted to keep helping there be this professional process and professional integrity growing. So I'm going to go on a little bit more. So the slides, the milestone slide that I wish you were seeing, it's a nice long line with dots on it and dates, but I'm just gonna have to read you some stuff here. So in 2008, the first meeting of schools was held, and we really discussed the rapid growth of IOIT and the field of yoga therapy and the need for standards. So it was really on purpose every step of the way as we started to build this process. In 2009 was when they were completed, and then it was those 2 years which then we went to the school, and then we started application windows. In 2012, educational standards for yoga therapy training were published, and the IOIT accredited committee was formed. So we have an accreditation committee, a certification committee, a diversity, equity, inclusion, and accessibility committee, and a member school committee at IAYT. So they really serve the whole population of an international community, trying to help this profession be taken seriously, help this profession move into healthcare places with safety and integrity, right? So I'll keep going forward here. The application process, of course, started in 2013. 2014 is when we accredited our first 12 yoga therapy programs. And then ever since then, we've been doing things to really keep that accreditation program getting smoother and clearer and cleaner. And also to start to say when do we need to increase the standards? So in any emerging profession, there are going to be some strengths and weaknesses that you have to deal with. So the strengths that I think we have at IOIT and in accreditation is that we are building credibility and recognition for not only IOIT, but more for yoga therapy internationally. There are some places in the world that they don't really know what yoga therapy is. And part of our mission is to say, this is what it is, this is what it can do for humanity. And so that's a big piece of it. The other is quality assurance. Accreditation of yoga therapy education ensures that professionals in the emerging field meet established standards, fostering a commitment to quality and excellence. I'm gonna grab a water. Thanks for your patience, everyone. So the next piece of our strengths, I would say, is marketability. Accredited yoga therapy programs may have a competitive advantage in the market, attracting more clients, employers, and collaborators. So yes, I think that's it. Pop us forward. Maybe. Go here. Okay. I'm gonna finish this SWOT analysis and Then I'll come back to a couple other things on here. So a couple other things to say is that the last one of our strengths is professional development. IOIT accreditation requires ongoing professional development, and those requirements are for faculty and for the integration of yoga therapy into contemporary healthcare. We want to keep learning. We want our staff, our teachers, our faculty, all to continue to grow their skill and their awareness, and that is part of our development as a company. So the weaknesses, I would say, for IOIT are resource intensiveness. If you know about accreditation, you know it takes a lot to get that done. It is very time consuming to read all of the documents, to go through every single thing in order to help to accredit a program. The other one is sometimes there's a resistance to change. Some professionals in an emerging field may resist accreditation, viewing it as additional bureaucracy. Perhaps you've felt that in your own lives, where there's something that's going along and you think it's going well, and all of a sudden there are more rules brought to it. Our idea is that these rules are, of course, in order to assure safety and comparability between programs. Now, our opportunities are standardization. Accreditation of yoga therapy education contribute to the standardized practices within emerging profession, promoting consistency and promoting comparability. We have the opportunity for networking and collaboration. This is, of course, one of the reasons we're here with you all, and that we've been doing a little tour here to actually help people know who we are and get to know who you are. So the accreditation of yoga therapy education process may encourage collaboration among professionals, organizations, and create opportunities for knowledge sharing and networking. I would say that's true. The next one is global recognition. Achieving international accreditation standards can open doors for global recognition, expanding opportunities for professional and emerging fields. Again, coming back to this idea of letting the world know what this is about and bringing groups together to help spread the word of this, so that yoga therapy doesn't stay isolated in just a few pockets around the world, because we know how wonderful this practice is and how it, we've even seen from this first presentation, Ayurveda and yoga therapy are what can really make some huge changes. So the threats, of course, we're going to face some threats here. Potential for exclusivity. If the accreditation process is too stringent or expensive, it may create barriers to entry for yoga therapy programs, limiting diversity and inclusivity. We're already trying to figure out ways to make sure that this is an accessible, something that could be accessible for more people than just live in certain countries. Regulatory challenges. There may be challenges in aligning accreditation standards with evolving regulatory frameworks, leading to conflicts or confusion in compliance. So we're constantly trying to see where those holes or gaps will be and bring about the answers for those gaps. And then the last thing I'm going to, I just have one more thing here on threats, and that's that public perception. If the accreditation process is not well understood, it could impact the perceived value of the emerging profession. We see that sometimes. Myself personally, I run a school, and I see that some of my graduates are like, well, now what? Because they don't know exactly how to speak about what yoga therapy is. And so at IOIT, we are really championing this idea of saying, how do we explain this more? How do we get people to understand what we're doing? How do we really get that buy-in from the healthcare, from wellness care, from lots of different places. So, next steps. So the next steps, and I'll just take a few moments for this because I also want to talk to you about certification, and I see that I have a little bit of time here. The Council for Higher Education, or CHIA, is a private nonprofit organization that advocates and promotes self-regulation of academic quality through accreditation. CHIA recognizes accrediting organizations that meet its standards for accrediting higher education institutions and programs. When you think third-party recognition of a programmatic accreditor like CHIA, it typically refers to whether other entities beyond the accreditor for the institution programs it accredits recognize and acknowledge the accreditor's standards and processes. So some of the ways we might find some third-party support or some third-party recognition is by public perception. Public perception is something we're wanting to increase as much as we can. Public awareness and the perception of accreditation can also be considered a form of third-party recognition. Employee recognition. The recognition of accreditation by employers is crucial. We have to be able to be graduating yoga therapists that are going to find places to find work, that this is a viable profession. So the recognition of accreditation by employers, of course, is they often value qualifications and degrees, right, from institutions accredited by reputable bodies. And awareness of CHIA recognition may actually even enhance this more. So finally on here, federal recognition in the U.S. Department of Education plays a role in accrediting agencies. I'd like to, learn more while we're here about what that role is here, so that we can start to consider that as we're building this. Last two on here. International recognition. Internationally, there may be organizations or entities that recognize CHIA programmatic accreditors, and this recognition can be important for institutions seeking to establish their global reputation. And professional associations and credentialing boards. So we want to make sure that we are staying in contact and working with other professional associations. We certainly had some of that opportunity. We were just at SVIASA for about a week and met lots of people in Bangalore that are with other organizations that we really feel we're going to be able to link arms with and create this path forward in a more profound way. All right. So we'll move on to certification. I'm going to have a little sip of water. So what is certification? And what is it at IOIT? It's the recognition of yoga therapists who meet or exceed an established set of standards. Quality control mechanism whereby a public stamp of approval is given to highly trained yoga therapists through a credible, objective peer review process. This is the IOIT certification milestone. We really started this process in 2016 with what we like to call our grandparenting process. Those were individuals who are yoga therapists. They may not have graduated from a specific program, or may have many, many years ago that were able to apply and receive the certification without going through a specific program at the time. So that started in 2016 and 2017. And then accredited program graduates from there. So in 2019, we started something called our Approved Professional Development. And that is a way for our certified graduates or our graduates that come through grandparenting can continue their learnings. Again, as we've said, this is so important in this field that we stay up on all of the changes within the healthcare field and in the different places that we want to bring yoga therapy. And we established also a recertification. So both at the accreditation level and the certification level, after a few years, you have to go back in, you have to reapply to have reaccreditation so that we can see that people are staying up on all of the things that need to do. So you'll see in 2020, we reinstated something similar to grandparenting, but it is called portfolio review and evaluation. And that is for, again, folks that have had significant experience and education in yoga therapy, but did not go through a specific program. They have the opportunity now to apply here. And at this time in 2023, they can apply, take our certification exam that everyone else now that's going through programs will also be taking. So that exam was a big piece of what we did to, further the field even more. So the certification exam, I'll take just a couple of seconds to talk about that. Sets standards for the profession of yoga therapy and protects the public by ensuring that certified individuals have met predetermined criteria for a safe practice. The exam had 3 phases. the first phase was the development phase, which took place between 2019 and 2021. Yoga therapy subject matters from all over, from different traditions, from all over different countries, wrote the questions with the assistance of a professional exam firm. So we hired a very big exam firm in the U.S. and had them help us make this. It was quite an extensive process. The second phase was beta testing the questions, and that took place in 2021 and 2022. And we are currently in the implementation phase, working closely with the program directors of the IOIT accredited programs. So that would be me. I'm one of those programs. And so they've asked me, can you help us get this forward? Can we actually help the perceived value of this be strong for the students? I will tell you that up until this point, my students didn't have to take an exam like that. They had internal exams. So at first there was a little fear around an external proctored exam, right? I can see some heads shaking out there. And now I'm starting to feel like they're understanding how important it is to the field and how it will help us be more credible and more credible internationally, that they could be a yoga therapist right here, or in Canada, or in the US, or go to Australia, and they would all be passing that same place. So that's what we hope for the field. So let's see. The last thing I wanted to say about this is that I hope you can see that the process, while it might sound a little dry, especially with my dry throat today, that's probably not helping at all. But it's been there's been thoroughness and a lot of confidence put into this so that it would be the best that it could be for the people that we are serving, our communities that we're serving. And we hope that is yoga in general and humanity as well. So we showed you those phases. So IOA certification, this is just a little bit of a chart of how it happens. Complete an IOIT accredited yoga therapy training program, or qualify for what we call PR&E, that portfolio review and evaluation. So do know that at this time, our minimum hours of our accredited yoga therapy training programs are 800. Mine personally is over 1,000. Many of our entry-level programs are over 1,000 because we really believe there needs to be that extra layer of learning and education and standards. And we need time. We need time to learn this. It isn't something you can do in a year. It's something that you need to take many years and have lots of practicum and practice to do. So after that, after you graduate or you get your PR&E done, you can apply for CIYT. You get an IOIT membership. You go through an application process. You pass a certification exam. You pass an ethics and scope of practice quiz. These things, again, I want to just talk about the importance. We feel that there is a scope of practice for yoga therapists, and we want to know what's ours to do and what's not ours to do. And so we really look at that. And we also think that the ethics exam that we ask people to do every year or so is important because we want to make sure that we're all saying, yes, we believe in these ethical principles of yoga and yoga therapy. So those are our main things. You can see that, there's a vision that IOIT has. And I'm going to go back real quick to that mission and vision because I think it's important for you all to see that. Sorry, don't get dizzy. Look down. All right, so to close, IOIT's mission is to advance yoga therapy as a recognized health profession. And not only that, in a world envisioned by IOIT, yoga is routinely considered in settings around the world as a therapeutic option for physical health, emotional well-being, mental balance, and spiritual consciousness. I'll let you take a picture of that one. And just to tell you about our members, we have 5,300 plus yoga and qualified healthcare professionals who are members. We have 170 member schools worldwide. We have 70 IOIT accredited yoga therapy training programs. And these are all from a range of lineages and backgrounds. And to me, that's a very important thing to say because maybe in this room, there are a range of lineages and backgrounds that we all come from and that we wanted to be sure that IOIT as an organization honored that. So.
Thank you, ma'am.
Thank you.
So thank you very much for introducing the new field, that certification course in the yoga therapy. So now the talk is open for the question and comments. To set the ball roll, that how will you ensure that 800 hours is completed? It is online, offline. You have to share the video that you have practiced that much. Is there any exit exam for that?
Yes, well, we don't have most schools are not all online. We have a hybrid situation, specifically after COVID, right? We had to pivot. We had to learn how to help schools continue to work. We do believe in a model that has, on-site work, but we do know now with what COVID has done that it has asked us to re-examine and allow for some distance learning. So that's all still happening in our standards. But we do also ask for, extensively ask, how are you making sure they meet these qualifications? And then we're hoping that our certification exam at the end now is really going to help us make sure people meet the qualifications that we've asked them to do.
Any question from the house? Yes, ma'am, please.
The examination for certification, is it only in English or are there culture-free versions also available?
Right now, it's only in English, and it is definitely something we are considering how to make more accessible. Yeah. It's a very expensive process, and it's a very hard process to do. So we knew that we had to do it in one baseline first, and then we'll see what we can do from there. Yeah.
You believe in which medical condition yoga is most effective?
Me?
Since you,
What do I believe it's most effective for?
which disease, which condition?
Oh,
Because
gosh. I think so many. Pain, depression, anxiety.
10, 2, 3, not so many. That is diluting your everything. So many means you tell 2 or 3 important things that is really very, very effective.
Yeah, I would say the things that I work a lot with are trauma.
Trauma.
Anxiety and depression. That is something I work with a lot.
Okay.
Yeah.
Yes, sir.
Quite interesting. And after seeing this, it came in my mind. Number one, does it allow certification equivalence in grad school or undergrad school, like associate degree program, maybe like third year, second year, or first year? Equivalence for credit hours, number one. Why I'm asking, because like Regina University, they run the full-fledged postgraduate program and graduate program in yoga therapy, where it fits with. Number two, federal recognition. Like FDA, what is the situation and status for this therapy program? Does it allow HIPAA or HMS for reimbursement?
Reimbursement at this time is not for every program. Like I have a very small program, and yet there are some programs that are built out of universities. So there's the answer to that. That some programs are certainly getting funding or scholarships or things like that through if they're involved in the university system, where mine is not.
So what is the status of like FDA, federal recognition?
Of federal recognition? What would you say to that, guys? Yeah, we're working on it. We're working on it, of course.
Thank you.
Yeah.
My last question is, does it allow a person after this certification enter in yoga program in education at community school, community college?
Yeah, yes, it does. Yeah, I think so.
Thank you.
Yes, sir, please.
Hi, it's good to see standardization and certification being addressed. Quick question, from a public perception point of view in the US, for example, how do you distinguish yoga therapy from the thousands of yoga studios that offer kind of programs for health and fitness? That seems tough.
Educate. Yeah, we are constantly trying to help people understand. We've got some great marketing tools that we have online. We have something we make available to all of our schools and all of our certified graduates so that they can speak to it. But it really is educating people about what this is.
very good question. I think it can be started in a school itself, from in a graded manner, like this standard this much, this standard this much. That will be really very well, because now environment science is one of the subject for the most of the schools. So this can be one of the area can be introduced. Yes, ma'am, please.
Hello, ma'am.
Hello.
So nice concept. I had a query first. What would be the main criteria for the evaluators of this particular examination? Like, for example, if any student wants to apply for the examination, even what should be the eligibility criteria for even applying for this course? Like, if a PhD in yoga who is having his 8 years of experience in yoga, why would he go for this course if he or she has learned this knowledge from the original source, from where it comes from?
Right, yeah.
Like yoga hailing from Bharat,
Yeah.
certainly the teachers who are well trained in Bharat would be more trained. So, ma'am, shouldn't there be one particular corner for Indian language, or probably the yogic language also taken into consideration? Because yoga is not just about the postures and asanas
Absolutely.
and even pranayam also. It's
Absolutely.
more about the mantra yoga
Absolutely.
and the Devanagari lipi. Yes, thank you.
Yeah. Yeah. I think, I mean, that's a great question. A couple of things I want to say about that. I would think that person that you're, this figure that we're talking about, I think that person would have all of the information, would have all these great things. Why would they come over to IYT to join and support the profession of yoga therapy itself? We want more of those folks coming in. We want more people with higher educations coming in, but we also want to make it available to someone that decides they want to make it their life's work at a younger age and begins there and starts. So the certification exam, or even becoming just a member of IYT, also works to start to be part of this that's trying to have a global reach and really keep the profession safe and keep the profession moving forward well. So I hope that answers.
Of course, it's international, so it should be available for everyone.
Yeah.
Yes, ma'am. Last question. Anybody? Yes, ma'am, please. Last question.
Thank you, ma'am, for being
Yes.
patient with us.
No problem.
That
It's
your
great.
tech was not working, still you were talking to us continuously. Ma'am, my question is, your mission is to advance yoga therapy as a recognized healthcare profession. In healthcare profession, if somebody is not following ethic or does something wrong, then their license gets cancelled.
Yeah.
So, do we have something for that? Like,
Yeah.
if some yoga professionals, he keeps on giving treatment when the patient required some medical care, but he keeps on telling that with yoga you will get well. So, in that condition, is there anything from your side, from your IAYT, to cancel their license
Sure.
or to decredit them?
I can speak to this a little bit, and then it might be even worth having another discussion. What I can say is we do have a code of ethics, and we do ask people to stand by that code of ethics. We know in many fields, and yoga being one of them, that there are many things that have happened that have gone against code of ethics. And so we definitely want to look at that when we take complaints coming into our organization very seriously. We have an ethics and review committee that all complaints come to, and they don't even come to the board. They go to that review committee, and they start to look at it and figure out what we need to do with the individual that might be infringing on that code of ethics. And yes, we've asked people to step down as yoga therapists and things in the past. So yeah, we're trying to protect students, we're trying to protect the public, and we're really trying to protect the field so that it doesn't have the bumps and the hiccups and sort of the bad press it can get if there isn't someone saying, let's hold ourselves accountable. That work? Okay.
Thank you, Madam Molly, for the nice talk and taking all the questions, tough to easy. So give a big round of applause.
Thank you, ma'am. I would request the chairperson and the speaker to join us on the stage. I would request the chairperson to please felicitate our speaker. I would request Dr. Akshay to please felicitate our chairperson.
Very nice, keep reminding us to do the yoga and meditation.
Thank you, sir. Thank you for joining us. Now I would request our next chairperson, Professor Vipin Kaushal. He is a head of hospital administration. He has been affiliated with more than 10 national and international organizations. He has been providing his services in a planned, commissioned and managed way during the COVID, as well as he's been leading the Roto Institute organ donation in collaboration with 12 hospitals. He has been awarded, and under his guidance, PGI has been awarded with First Prize Kayakalp Award in 2015, Cleanest Hospital Award in 2016, Best Hospital 4 times in a row since 2016, Best Roto 2019, and Best Administrator in the Tri-City Award by PTC News. He has more than 50 publications. I welcome you, sir, and I request you to kindly introduce our next speaker for the session.
Thank you. At the outset, I congratulate Dr. Akshay for organizing this very significant workshop or conference where the mind and body are being integrated, which is very important. And as in our first year of MBBS, we are taught Vayu, Pitta and Cough. And after that, we just forget. But now it is being promoted like anything. So I welcome Dr. Rich Fletcher, PhD. He is assistant professor and a research scientist in MIT. He has many awards to his credit. NH Melinda Gates Foundation, he is with Vodafone and Tata Trust. He is a mobile technologist and wearable sensors, wireless sensors, and so many other things. And I request that Mr. Fletcher to come on the dais and deliver his talk on technologies for yoga practice and teaching. Welcome, Dr. Fletcher.
Okay, hello everyone. Good morning. I guess I'll go ahead and start. I should mention last year I changed my affiliation from University of Massachusetts to Harvard University, and I work in the department that does de-addiction, otherwise known as substance use and recovery, at Massachusetts General Hospital under Harvard University. So to start, I'll give you a broad overview of what our group does. So I am a technologist, but the past 20 years after my PhD, I've been primarily working in the field of medicine, and I apply technology to the field of behavior medicine. And I have been working in India for more than 15 years, primarily in doing diagnosis and community health. So I work a lot with community health workers, ashas, anganwadis, and other rural clinics. But in the area of behavior medicine, that includes things like substance use, for example, and some of the topic areas where we use psychophysiology, basically sensors, wearables, phones. We use that in treating, as part of the treatment for stress and anxiety, or as well as recovery from addiction and sleep, and also other sort of exercises in integrative medicine. And when you put this system together, we have technology that's used to measure properties of the human in terms of sensors and also psychological states. And then we also use the technology to deliver some sort of intervention back to the person. So it's basically a feedback loop. And we use both Internet of Things, which we call IoT, and AI, which is artificial intelligence. And this sort of feedback loop happens in real time, and we call that just-in-time interventions. And that's something that
we were one of the first people to work in that area back in 2010. We filed one of the first patents in that space. So the question we're asking here is, what is the possible role of technology in the context of yoga and yoga research? And I feel, one of the main areas where technology has been used or is starting to be used, of course, a lot of it is starting to emerge in the area of academic research, but now we're also starting to see some technology being applied in the area of training. And then hopefully in the future, technology will be much more common in the area of just individual yoga practice. So that will be more like in the future. So now I'm going to talk about just a few specific technology areas so you can see some of the types of technology that we develop at MIT. So I will start with an area that's many groups around the world have been working on. Some of this has even been done by commercial companies. But one is using computer vision to monitor and do training for asanas. So here's just some examples. This has been used by some universities to teach and train yoga asanas, but also exercises in Tai Chi, sort of the Chinese traditional medicine. Another area which has been quite common has been in the area of brain waves. So as you know, there's been a lot of research the past 20 years looking at brain waves of people who are doing meditation, for example. And where I used to work at University of Massachusetts was the home of Jon Kabat-Zinn. So some of you may know Jon Kabat-Zinn in the 1970s was one of the main people who brought mindfulness to the US and started the sort of field of mindfulness meditation practice in the US. And that took many years to start, but now the Center of Mindfulness at University of Massachusetts Medical School is one of the leading places that does training and certification for instructors as well in the area of mindfulness. So in the area of brain waves, the technology, as you know, as many of you know, it usually involves a lot of electrodes on your brain. However, this is not really practical for everyday practice. But we know that it is very useful, not only for research, but also for certain types of biofeedback to be able to classify and measure brainwaves in a more portable environment. So there's been work by companies such as Microsoft who developed these glasses that you can wear that measure brainwaves. And of course, now we have companies such as Muse, which make these headbands that you can wear and they connect to your mobile phone. So you can, in a very comfortable and portable way, you can now integrate brainwaves into your mobile apps and have various sorts of applications and training that you can do. So this is now it's coming out of the lab and it's coming to the home, so it could be more accessible to everyone. And hopefully the cost has also come down, so it's getting to be more accessible. Of course, the other large area that has been changing the past 5 to 10 years has been the area of artificial intelligence and machine learning. So one of the areas where I work on is we apply these algorithms to try to take the data from the physiological signals such as brain waves or wearables, and we try to use that to predict specific psychological states. As I mentioned, one of the areas where I work on is substance use, and I know there will be other talks later today from other experts in this field, so I will not say too much about this. But substance use is a very serious issue in the U.S., but it's also an important issue around the world. And one of my collaborators at Harvard MGH is Dr. David Eddy, and we're using this technology, these algorithms, as part of the therapy. So we have a mobile app that patients use in their recovery. The mobile app gives you cognitive behavioral therapy and other exercises, but the mobile app needs some guidance, right? The mobile app needs to know how the person is feeling. So to know that, the person wears a sensor band that measures a heart rate and heart rate variability, and that with the algorithm informs the mobile app when the person is feeling stressed, for example. So we use various sorts of features from heart rate variability, and we build a model, and we have nearly 90% accuracy in being able to detect stress incidences of stress. The other request, what people want from technology is, people don't like wires, right? So especially something like yoga, you want it to be comfortable. You want to be able to do it in your home in a comfortable place. So for that, we've been developing non-contact measurement techniques to measure physiological signals in a way that's not obtrusive. So I'm going to give you some examples of that. So we would like some sort of device that can remotely measure some of these physiological signals, and specifically we're interested in different ways to measure respiration or heart rate waveforms. So for example, for respiration monitoring, there are many traditional methods, but they generally require wires, this is used in hospitals, for example, to monitor the sleep of patients. You could use different gas sensors that's used in like capnography. You could use the heat produced by the breathing thermistors. Then there's also a belt that you can wear. But the technology that we use is a thermal camera. So you can connect that to your phone or your tablet. And the thermal camera measures the heat of your face and of your breathing. And we've done, a few years back, we did a project in collaboration with SVIASA, Professor Raghavendra Bhatt. And if you look at your nose, of course, you know that when you exhale, the area right under your nose, it warms up. So there's an increase in temperature, and then when you inhale, the temperature usually goes down. And using this technique, if you could precisely measure the temperature under your nose, you could measure breathing, and you can even do single nostril monitoring. So you can have a yoga protocol, or maybe you're breathing from just one nostril. You can monitor this if you have this technology. So this was one of my students from that time, several years back, where we used a tablet and measuring breathing using the thermal camera. So we have a model of the face, and we automatically detect the nostrils, and then we're just measuring the change in temperature of those spots under the nostrils. And on the right, you can see here the blue curve is a respiration measured by the belt, a traditional pneumography belt. And then the red line is the breathing measured by the change in temperature of the nostrils. So this is just an example. We also do a lot with heart monitoring. So as you know, the space between your heartbeats is not constant. We are not machines, right? We have a feedback system. So our heart rate is constantly speeding up and slowing down. And this allows us to also see our respiration from this heart rate pattern. And in general, we look at heart rate variability, and when the space between heartbeats jumps up and down, that's actually a good sign. When you're more relaxed, your heart rate variability is increased. And when you're stressed, it decreases, it becomes more regular. So that's one of the biomarkers that we use to detect physiological stress. And there have been various published papers looking at how heart rate variability changes when you do different types of pranayama. Like, for example, here's the normal respiration, or rapid, fire breathing, or slow paced breathing. So heart rate is an important property that we measure, and to measure it in a non-contact way, there's several sensors that we use. One is a Doppler device, so it's a microwave Doppler that it's like a little radar device that can be a few feet away, like one meter away from your body. And there's an example of the signal. So from this, we can measure both the motion of your chest and also the motion of your heart. That's one method. Another one is simply a camera. So the color in your skin changes. So as you breathe and as your heart beats, the color in your face is actually changing, but that color change is very small. If you use, so the human eye cannot detect this color change, but with the algorithm, you can detect this small color change. So just using a camera, you can use for doing heart rate monitoring. The negative aspect of this is that you cannot move too much, but it's good for doing like meditation where you're not moving too much, then you can do it. So it is a good match for that. And we were one of the first groups to implement this on an Android phone, and we did that back in 2015 when it was published. Some of our current work is we're trying to integrate a lot of these sensors into a mirror. So as you know, a mirror is something that people stand in front of a mirror to examine themselves, but we feel that a mirror should be a place where you can examine not only your body, but your mind also, and examine your health. So we're putting a lot of sensors into this mirror and using that to screen for diseases, for infections. We have some algorithms that can detect, for example, coronavirus or other respiratory infections. There's a signature for diabetes. So there's a lot of things that you can detect from these sort of non-contact sensors. And the last technology I want to mention, which is part of our current work, is using AI and large language models. So some of you may have heard of ChatGPT. So ChatGPT has become very popular the past year as because it's a very advanced model that can understand and speak in a very natural way. And we're starting to use some technologies which include ChatGPT and other natural language processing models to integrate that into meditation. So we think there's a lot of different areas where this can be used. So besides guided meditation, there's also many people looking at neuromodulation, so the effect of sound. So sound has a physical effect on the brain, and it can stimulate certain frequencies of brain waves. And there's a lot of researchers looking at particular brain waves, such as gamma brain waves that can stimulate healthy functions in the brain. So we have set up a website which we're starting to prepare for a clinical study that will be used for students. And then on this website, we have loaded this website with different types of sound files. Some are simple, nature sounds, but we also have like chanting, we have ragas, and then we also have binaural beats, which is a more advanced kind of abstract type of neuromodulation. And then we also have psychological assessments, so that as the subjects in the study do the therapy, they also do weekly psychological assessments, so we can monitor their progress as they're doing this therapy. And we feel that this sound interface and voice interface, speech interface, is very appropriate for other populations that cannot use a phone or cannot use technology very well, such as seniors. So people like my mother, for example, so she has a smart speaker in her room, and it's very convenient for her because she has very poor eyesight, so she cannot see a phone. So she cannot use a smartphone, but she can use a smart speaker. She likes it a lot. It's very easy for her. She just needs to talk to it. So it's easy for this a device such as this to sort of guide an older person, a senior, to do certain breathing exercises, for example, or meditation. And we think in the future, this can also be used with children as well. There's a photo of my children from a few years back, and children learn technology very fast, and they really have become experts in using these smart speakers. And we think this is another market, another patient population that is very appropriate for this type of technology. And the last comment I'll say is, I like to think about how technology can be used to empower people. And I think technology can help ordinary people to do extraordinary things. So I think I will end there. And there's my contact information. Thank you.
Thank you, Dr. Fetcher, for this very comprehensive talk where you have talked about technology and it has made things very simple. Earlier, so many wires and everything, now it's very handy now. And we are able to make the thing evaluate basically. Now maybe used for therapeutic purposes. So good work is being done by you there. And as far as substance abuse is concerned, how helpful this technology is you have found while approaching such patients who are
Yeah, well, sure. So substance use and recovery treatment, currently, at least in the US, what I can speak for, a lot of that treatment happens in these treatment centers, right? Treatment centers are expensive and they're residential, so you have to live there for 6 weeks, a few months. And the problem is that we need treatment that is outside these centers, that is in your home. So outpatient substance use care. And that's really where the technology comes in. So having mobile apps, phones that people can use in the home outside of these treatment centers, there's really a need for that. And that's really a new market. So we don't know the efficacy yet, but we know that we need to have better treatment and we need to have better personalization. So we need technology to be able to monitor people, to know how they're doing physiologically and know how they're feeling, and be able to deliver cognitive behavioral therapy and other types of therapy in a remote way without having a doctor present. So it's an adjunct to treatment, and that's really the need that we're trying to address.
Thank you. Any questions from the audience, please? One by one, madam in the front first. Yeah, you must have.
So, hello, I wanted to ask a question that when you give this technology to people, and many of these are also, even though they sound like non-pharmacological, but they are working on the physiology of the person, and there would be inter-individual variability in the response outcome of the person. So giving a recommendation which is totally machine driven, how do you ensure the safety, and do you require a standard like an FDA kind of standard to be implemented? Because as I kind of gave a lecture in the morning, we find that there is even at the transcriptome level, we see outcome responses are different. So, for example, a very excitable person meditation might work because you might need to work on the GABA receptor, but then there could be some person who is already not in a very excited state. And giving them meditation as a process to even make them more their parasympathetic modulation to go down might be counterproductive. So how do you deal with this inter-individual variability?
Yeah, that's. I'm glad you mentioned that. That's extremely important, and that is where the AI models are now. So when I started working on this space about 10 years ago, we had a general model, and then we realized that human beings are very different, and you really need highly customizable and personal models. So now we have the ability to create models that are for the individual, and that will allow it to be much more effective. Regarding what you say about sort of certification or FDA, for example, so if you use the technology just for monitoring, or for example, observing is the person, Vata Pitta Kapha, That you don't need certification. But if you use the technology to deliver some kind of intervention, which can be a sound or it could be some specific meditation, then you do need some FDA kind of approval for that if it's an intervention. So usually we take existing protocols that the doctors are already using, and we just use the technology to do the observation part, the monitoring part, and send that information to the doctor. And then the doctor can deliver what is evidence-based and he has already familiar with. Does that make sense? Yeah.
So that's where we, though you are just observing, but it is also getting into a decision-making space, which could be sometimes dependent on the knowledge of the doctor about that practice, right?
Yeah.
So, so there is no, there is limited objectivity in the interpretation, because if you give the same thing to 5 doctors, they might not come to consensus. So how do you build standards which ensure that there is a there is some kind of an outcome response measurement? Because the thing with all the traditional medicine practice and all the different kinds of meditation practice is the wealth of diversity, which is to be actually, it actually gives more options, right? But they are all working on a physiological readout like heart rate variability and the response of heart rate variability. So if we can actually build standards which ensure that minimal standard of HR or HRV is measured, then you know that this practice is being done appropriately and the decision is much more harmonized, is where I kind of was
Yeah. Yeah, no, I think that's a great point. Yeah, absolutely. We look at different biomarkers to sort of ensure and check that the whatever treatment there is that it's having a proper effect. But yeah, that's so.
Only one question will be allowed, keeping the time.
I'm Dr. Babita Chai. I'm a pain physician. My question is also just a bit related to Dr. Mitali's question is, how do you ensure, what is the reliability, validity and sensitivity and specificity of those monitoring devices, and what would be the gold standard against which those are being evaluated?
Sure. We always, let me back up. So when you develop an algorithm or use machine learning, artificial intelligence, it needs to be trained, right? So the algorithm is only as good as the training data that you have, right? So that opens up, as Ma'am says here, that opens up a whole new can of worms, which is, it is not always possible to have reliable training data. Because, as an example, one of my first areas that I worked in India was using a stethoscope to measure pulmonary sounds, right? And we built an algorithm that can automatically recognize, is this a wheeze, crackle, or maybe another sound. We were very surprised, and when we started getting many doctors to label our data, even the doctors themselves could not agree what the sounds were. And interestingly, we gave the same sounds to one doctor. The first time he labeled the sound a crackle, next time he labeled the sound a wheeze. So even the same doctor could not agree with himself what was the proper name of that sound. So that shows that is a very big problem in medicine. There is a lot of variability within the doctor's opinion. So we just need to be careful how we handle that. And as Ma'am says, also have other parts of your system that are checking for efficacy by looking at other biomarkers to see if your therapy is having the... You want to know, even if we will never have a perfect technology, but we want to know, is the technology doing good or is it doing harm? As long as you have some way of checking that, then things are okay and you can move forward. Yeah. Sure.
Wonderful talk, I must say.
I think one last question that side, then you can discuss in the detail. That side first.
Good morning. Very wonderful thought of improvising technology into yoga and breathing. My question is, as you were talking about the use of technology in the addiction program, like in the rehabilitation of those patients. So most of the people who are addicted to some kind of substance are also not psychologically stable. So do you think that this technology will help them in a isolated environment, or should they be present in the rehabilitation center where all the doctors are around to motivate them to actually leave that addiction?
Yeah. So addiction is a very complicated area, and there are many comorbidities, and many people in the U.S. who have addiction are also homeless. And researchers, as you know, most academic researchers want to publish papers and they have a limited time to get results. So most researchers do not want to work with homeless people or people who have a lot of comorbidities because it's a very difficult patient population. But that is the reality. There is a lot of work, good work being done using technology for these populations, but that technology is not sexy, I would say. It is not using fancy algorithms. The technology is being used simply to connect people to each other. So we do need and we do use technology for very important purposes, but it's simply to make sure the person goes to the appointments. How do you connect the person to a support group? Because a community is very important for recovery from addiction, right? So the technology is very useful to connect people to a community, peer support, community centers, and to make sure that they go to a doctor and have some oversight. That technology is very straightforward, and that is published not in engineering journals because it's not a sexy AI, but it's published in other journals like public health and social work sort of journals. But technology is there also, and it's having a big impact.
Thank you. With this, we close the session. Thank you, Dr. Richard. Thank you very much.
Okay.
Thank you, Dr. Rich. I would request the chairperson to join us to felicitate our speaker. Thank you, sir. I would request Dr. Pramod Avti to please kindly felicitate our chairperson. Thank you, sir. I would request everybody to please join us for the group photograph followed by high tea, and the tea time is for 10 minutes. I would request everybody to be back by 11:45 for the next session. A group photograph is here only, so everybody please join in the front. So next is, ma'am, after this, Miss Ali. I would like you to show your PPT. Is this right or no? Yeah.
Yeah, this is correct. So I have a lot of slides that are separate that build on each other. So is it just here that I'm clicking through?
Skip with this or skip with this.
Skip. Oh, okay. Which is easier, do you think?
Both is easy.
Both is good. Okay. All right.
However you feel comfortable.
Okay. Does this sometimes skip forward? I don't want to.
This is just to show on the screen. This is for front. You can just skip it. It goes on.
It's not on now.
Yeah, see.
Is that?
I can show you this.
Yeah, perfect. Okay. Yeah. Good job. Thank you.
Professor Babita Ghai. She's a professor in Department of Anesthesia and Pain Clinic. She's a co-chair developing country work group, member of IASAP Presentational Task Force for Interdisciplinary Pain. She's also a member of Treasures Pain Education SIG IASP. She has been awarded with ISA Presidential Award for Academic Excellence, Excellence in Pain Research, WIP India. She has been received with fellowship with National Academy of Medical Sciences. She has more than 120 publications, PubMed indexed. She has written so many book chapters as well as many books. She's alumni of many institutes, and I welcome you, ma'am, and I request you to introduce our next speaker, Ms. Wastrel, for the session.
Thank you very much for the kind introduction. So we begin here the post-tea session, and I call upon Ms. Elisa Wassler, who is an Executive Director of International Association of Yoga Therapists. She is also a diplomat of Classical Homeopathic and the British Institute of Homeopathy. She has been the former Executive Director of National Consortia Organization. She is academic collaborator of Integrated Health and the Integrated Health Policy Consortium. She is a founder of Integrated Medicine, Integrated Solutions. She has a huge experience for the National Health Policy advocacy and education supporting equitable access to integrated health care and medicine. She has also been the former Integrated Health Sector Coordinator of Alliances to Advance Comprehensive Integrated Pain Management. She is a former Executive Director and Academic Collaborator for Integrative Health, which is ACIH, Integrated Health Policy Consortium. And she holds lots of skills other than her extracurricular skills like public speaking, teaching, strategic planning, marketing, management, and entrepreneurship. She will be speaking on the importance of whole person health model for the emerging profession of yoga therapy. Over to you.
Okay. Welcome back from the tea break. Good to see you all. Thank you for the introduction, and thanks for the opportunity to be here. My name is Alyssa Wustrel. I'm the Executive Director with IOIT. You already heard from my colleague Molly McManus, and you'll be hearing a little bit later from my other colleague, Sue Tebb, speaking on different topics. We're very grateful for the opportunity to be here, and to Dr. Akshay Anand for his kind hospitality. So today I'll be sharing about the advent of the whole health model in the United States and the implications for yoga therapy. So I'm going to be providing context for a person-centered whole health model of care in the Veterans Health Administration in the United States. It's part of the U.S. Department of Veteran Affairs. And I'll define whole health as it pertains to this model, which includes yoga, yoga therapy, and other complementary integrative modalities and disciplines. And I'll provide insight into the interest in scaling and spreading this model of care further into the U.S. population. This concept actually has broad support from the Surgeon General of the U.S., Vivek Murthy, the National Institutes of Health, and the National Center for Complementary and Integrative Health, or NCCIH, along with many other stakeholders. The whole health model has been highlighted in this consensus study report from the National Academies of Sciences, Engineering, and Medicine, or NASEM. NASEM was created to provide independent, objective advice to inform U.S. policy with evidence. The goal is to help address challenging issues in innovative ways for the benefit of society And one of those challenging issues in the United States, for sure, is healthcare reform. What you see on the screen is an almost 500-page report written to advise policymakers about achieving whole health, which is for the US system very clearly a new approach. So the US has made significant national investments to address diseases and conditions, and that has resulted in tremendous medical advances and innovations. However, the nation has not been successful or made similar commitments to improving the effective, efficient, and equitable delivery of care. And this report provides a roadmap for improving health as well as social and community systems of care via the whole health model. So the Veterans Health Administration, or VHA, is the largest healthcare system in the United States. It's an integrated system specifically for veterans, citizens who electively served in the active military, naval, or air service and were honorably discharged. And access to health care via the Veterans Health Administration is a benefit of their military service. Of the nearly 20 million US veterans, about 9 million currently use the VHA system. And although each facility looks different, this system is quite well equipped to deliver whole health care. So what is the whole health approach? So NASM, that wrote the report, defines whole health as physical, behavioral, spiritual, and socioeconomic well-being, as defined by individuals, families, and communities. So when a veteran goes to see, in this model, their primary care doctor in the intake, a key question that's asked of the patient is, tell me what matters to you. So they start the intake with that question rather than, why are you here today? What's wrong? What's the matter with you? It's a shift in orientation to an inquiry and listening mode that gives the power to the patient to talk about their life's purpose. And that then drives the treatment plan. So if, for instance, a patient had lost a limb in their military service, and they were aspiring to return to a particular type of activity that they used to do prior to this life-changing injury, the aspiration to do so gets discussed and noted in the next steps of the plan of care. And to achieve this, whole health care is, out of necessity, an interprofessional, team-based approach. It's anchored in trusted long-term relationships to promote resilience, prevent disease, and restore health. So again, a whole health approach aligns with a person's life mission, aspirations, and purpose. What matters to you, or discovering what matters to you so it can be articulated, rather than what is the matter with you. And this graphic represents the whole health model and also has a lot in common with the multifaceted yoga approach to well-being. I put this up here because NCCIH conducts and supports research in integrative medicine in the United States. And their public support of the whole health model is also articulated in their current strategic plan. You might have noticed a key element missing from the NCCIH graphic on the previous slide, and that would be spirituality. It's in the definition of whole health. How is it expressed in what NCCIH is doing in research domains? What they're actually doing is expanding their domain of research to be inclusive of spirituality in the future. And these are kind of questions that they're asking to figure out, how can that be researched? Dr. Langevin, who's director of the NCCIH, is the lead in this expansive approach to whole health care and to the research that will help define it. So this is an area of interest that connects the dots into the whole person health landscape. And it's a helpful shift, not only for whole health, but also for integrative medicine and healthcare. And although most of my talk here today is about reporting to you about the whole person health model, it's important to note that the whole person health model incorporates yoga and yoga therapy at a foundational level. And this image here on the screen is one that IOIT certified yoga therapists use with clients and stakeholders to help explain how yoga therapy includes all of the practices of yoga: asana, pranayama, meditation, spiritual practice, yoga philosophy, and so on. And it's also worth noting, and you may have already spotted this for those of you who have yoga training, that the whole health model looks familiar. So although the VA labels things a little differently in this graphic here, the whole health model has a lot in common with the Panchakosha model. For example, here are some of the model's Annamaya-related suggestions. So just stepping back and looking through the lens of healthcare in the United States and the crossroads that we seem to be facing. Unfortunately, life expectancy in the United States has been decreasing for nearly a decade. Complications from multiple chronic conditions continue to rise. Mental health needs are at an all-time high, and unhealthy behaviors are prevalent. And despite remarkable breakthroughs in treating disease, the US has worse health outcomes than most other developed countries, and yet we spend substantially more than other countries. US life expectancy differs by as much as 18 years depending on where you live and your ethnicity. Life expectancy is lower compared to other OECD countries, and it's getting worse. This data is from the Organization for Economic Cooperation and Development, a collaboration of the governments of 37 democratic countries to develop policy standards to provide sustainable economic growth. So just kind of looking back again at achieving whole health, a new approach for veterans in the nation, and this report from NASEM. So broadly speaking, we can acknowledge that healthcare in the United States is reactionary. We treat problems after they arise. It's also transactional. And therefore, services are fragmented, and health creation is not at the core of the approach for healthcare in the general population. So therefore, whole health, the model of whole health, is built on a completely different structure. So compared to private healthcare insurance systems in the United States, such as those provided by employers to employees, the VA healthcare system is different because it allows for more innovation and experimentation. It's a closed system. So the fact that the whole person health model has emerged from the VHA is an indicator of the importance of payment flexibility and an allowance for creativity and innovation rather than strict constraints on patient care models and approaches. And right now, the whole person health approach is being used in a relatively small cross-section of the VHA, this system, through 18 centers that are specifically designated to provide integrative care. More than half of veterans are not enrolled in VA care, even though they're eligible for it, and many who are enrolled get at least some care outside the VA. However, there is a commitment based on results of this whole healthcare model that have been realized within the veteran population to scale and spread the approach to the entire population of veterans, which in the US is 20 million. And major stakeholders are watching the success of this model and are proponents of spreading it to the larger US population, which will require many resources and a paradigm shift to achieve, but is sorely needed. So the NASEM committee identified 5 interdependent and foundational elements that would need to be addressed by whole health systems. And I'm just going to go through 5 slides that kind of tie that together. The top driver in a whole health approach is person-centered care. People and families and communities need to be empowered to direct the goals of their care, which has to be delivered in social and cultural context that aligns with their values. And it needs to be built on long-term relationships that help to foster, again, a sense of purpose and shared direction. And second, whole health approaches must be comprehensive and holistic. They have to attend to the entire person, family, and community's state of being and address all the domains that affect whole health. So that's acute care, chronic care, prevention, oral health, vision and hearing, mental health, promotion of healthy behaviors, social and spiritual care, and delivered with teams that are integrated and coordinated. And for people who work with yoga, that all makes sense. That's all in the Panchakosha model. Third, whole health systems have to direct attention not only to the problem in front of them, but also upstream to health behaviors and the social determinants of health. This supports a prevention approach to health, and to do so, this system needs to be multi-sectoral, integrated, and coordinated so they can identify causes of poor health. Coordination is needed to address the structures and conditions of daily life that make them conducive to whole health. So it requires collaboration across sectors for sure. And of course, whole health has to be accountable for the health and well-being of the people, families, and communities served. It involves and requires community engagement and full participation in system governance, and in that instance, ensuring accountability. The system needs to be accessible and high quality for all. And finally, the health and well-being of the care delivery team is critical and must be fully supported. And this means encouraging positive work environments that mitigate burnout and foster a healthy workforce. So the NASEM committee looked at 12 whole health-like models in the report, in that 500-page report, in both domestic and international systems, including the VA. And although no single model saw all of these outcomes, they were generally the following: improved patient experience, increased access, improved quality metrics, improved outcomes for certain conditions, improved equity, promotion of team well-being, reduced ER, fewer hospitalizations, reduced maternal and infant mortality, and some cost reductions. And the themes suggest that implementation needs to be tailored. I'm not going to read the slide, but certainly this is an interesting checkpoint. The second one, based on high quality primary care, engaging communities, which I've mentioned quite a bit of, financing mechanisms to pool the risk. It's clear in their assessments on the committee level that the upstream factors are difficult to integrate. Team well-being not always included in a helpful way, and then systematic evaluations need to be more specific. So this slide here summarizes the NASEM committee's vision for scale and spread. The inner circle shows the 5 foundational elements of whole health. On the top are key contextual conditions needed to help make whole health happen and that directly enable whole health. And they include systems change and social movement to facilitate whole health transformation, structures and processes which are required for the scale and spread and the integration of silos, such as health and social services, and traditional and integrative approaches to achieve whole health. And then at the bottom are a set of foundational infrastructure needed, for example, to establish information flows for workforce training, along with measurement systems, and again, the innovative financing. And these 4 contextual conditions are supportive of and indirectly facilitate whole health, and all are depicted as puzzle pieces to indicate they mutually reinforce each other. And it's clear that with regard to scale and spread, whether into the VA system and then eventually into the US population, that it requires a radically different mindset, from thinking downstream to thinking upstream, from thinking in terms of silos to thinking systemically. And then plus a commitment to the 5 foundational elements you heard before. So scale and spread will require new structures at the micro, meso, and macro levels. For example, interprofessional teams, we noted that, vertically integrated delivery systems, whole health ecosystems, meaning systems of systems that encompass and interconnect the capabilities and services needed to provide this care. Now, new processes will be required, and ultimately to shift the power to individuals, families, and communities, and of course, infrastructure. So the committee considered, and in the report, unfolds what the process of scale and spread will entail. First, to anticipate innovation, and early adopters will lead, and we can learn from those early adopters. Oops, what happened? Okay. Right, and outside the VA, that scale and spread processes can follow a variety of evidence-based models drawn from examples of implementing other innovative health delivery models. And in order to be most successful, it is suggested that individual systems and organizations select and adapt the processes that best fit their organization and culture, because those will be different. So the whole health model won't necessarily look exactly the same as it moves from organization or system to system, but the core pieces will need to be there. And then, of course, we can expect barriers. Sorry for skipping that around. Any number of barriers, and probably more that aren't even listed there. But again, over and over in the report, the suggestion and the recommendation to lean towards flexibility and creativity comes through very clear. Okay, and then we will need all of these inputs and types of providers working together. All of this with the person and family at the center, and integrating new professionals, such as yoga therapists into whole health teams. And that assures that every veteran and every person has the support needed. And so in the report, the NASEM committee developed a number of goals and recommendations, and we don't have time to go through them. Is that right? The timer up there? I don't think so. It was only 9 minutes? Oh, I must be talking twice as fast as I normally do, because when I timed it, it was 20 minutes. So, thank you. Okay, good. All right. So each goal includes, these are 6 recommendations here that I'm going to list on the screen. And in the report itself, each goal has a number of recommendations, and I'm not going to speak to any of the recommendations that come up under these goals, but it's really interesting in the United States to note that goal number 6, or recommendation number 6, to design public and private sector policies and payment, is leaning toward the development of a national center for whole health innovation in the states to design and advance the policies and payments for whole health care, which would be a huge breakthrough for our healthcare system writ large. And so if you're interested, you can download the full NASEM report that we've been discussing. And this link here takes you to the first chapter, and you can enter your email address and you get the whole thing for free. It's a really good read. And in conclusion, the whole health model of care coming out of the Veterans Administration is possibly the best chance the US healthcare system has to shift gears and move toward a model that will have prevention and health creation at its core, and which honors the individual at the center of care. So this is really an exciting development in healthcare in the US. And with the many stakeholders who are interested in seeing this expansion occur, it's a real opportunity to take hold in multiple sectors. And all of this is good news for those of us interested in yoga therapy, which inherently aligns with an individually centered approach. IOIT is involved with the Veterans Administration, and we're proud to report that there are key yoga and yoga therapy champions working for change within that system, as evidenced by new qualification standards coming forward for yoga professionals and yoga therapists this year and next. And that concludes my presentation. Thank you for listening. Thank you.
Thank you, Dr. Oster, for a wonderful elaborative emphasis of whole health and focusing on to the prevention rather than therapeutic management. Before I open the house for the question, just one question because I can ask you. Is yoga therapy as a preventive mode, therapeutic mode, has been covered by the insurance services in US?
So we're an emerging profession in the US. And so the infrastructure in order to have reimbursement in the United States requires certain types of entry into the infrastructure of US healthcare for insurance reimbursement. And we are working toward that. So certain things that we're working on now, for instance, is the acquisition of a taxonomy code. The taxonomy code allows us to enter the system in the EMRs and be coded as a yoga therapist, not as like a recreational therapist or, some sort of coach or, but specifically as a yoga therapist. And what follows that will be an application for a CPT code, level 1. And that's quite an involved application. We're hoping that the taxonomy code is acquired first. We actually we're in a process right now where we'll know probably in the next month about the prospects of that. And then we'll proceed with the CPT level 1 application. And that's a utilization code. So it will start to, not only would yoga therapy show up in the system per se through EMRs, but would also, it's a counting mechanism. So we'd start to see how often it's utilized in the VA, in closed systems and in other systems of insurance in the United States. Thank you.
Sorry.
One second.
I asked because I'm a chronic pain physician, and in our system, multimodal or multidisciplinary therapeutic approach is definitely required. It is must. So most of the yoga therapy as a plan of multimodal management is usually not covered in India, and most of my US colleagues also say that, as you mentioned, that CBT is a part of the insurance coverage but may not be the yoga therapy, and which is what we probably need to work in future as well.
Yes, that would make sense.
House is open for the questions. Yeah.
I have a small experience. I was away 2 years. The same thing was raised. Whether yoga therapy is permitted by HIPAA. So my police told, if yoga practice is done, changing of and improved behavior, then it is covered in behavioral therapy in muscle.
Can you repeat the question? I couldn't hear it that well.
You're talking about Indian insurance system?
Yeah, that is there. It is called HIPAA and HNS.
Yes. Well, right.
They are the leaders who are governing this thing, like all hospitals, their reimbursement is under their rules regulations. They are classifying which diseases cure is reimbursed, not reimbursed. So it is behavioral therapy in that slot. Yoga motivation.
Exactly. This is
Lighting yoga practices. That is covered.
Under behavioral therapy in HIPAA, yoga practices are covered.
Yes.
This is what you.
And for that license is given for 5 years.
Yeah, I mean, in certain, right.
License.
Yeah, no, thank you for that. In certain sectors or systems, like for instance, Dean Ornish's cardiovascular heart health program, yoga and yoga therapy is incorporated. It's a modality that is already part of the holistic program of care for each patient. And so yoga therapists who work under that umbrella they bill through the doctor. So they bill the doc, the MD that's supervising, is how the reimbursement occurs. So there's a lot of that because yoga and yoga therapy that is part of a holistic system is allowed in some cases only if it's been previously approved. So when Dean Ornish, who is a very famous cardiovascular physician, got his program approved through CMS, which is our Medicare program for people 65 and over. It's like socialized medicine for people 65 and over. That was a big breakthrough. So including for yoga and yoga therapy, but it was a breakthrough in general that there was an integrative cardiovascular program for people who, obviously at 65 and older, many people who need that type of care. So, there's other examples of that, doctor, but the point is that in terms of in terms of oversight and what we're hoping for yoga and yoga therapy to be more kind of synchronized with the system, whether it's private insurance or insurance from employers to employees, or through the VA, that it's incorporated and covered.
Thank you. Last question.
Thank you, Elisa.
Oh, Hemant.
For a very clear presentation.
Good.
One question that a basic question regarding the definition of yoga therapy, because especially in the West we see that yoga has been separated from meditation, and even there is a reluctance to use the word yoga. They prefer more like mindfulness.
Yeah.
So when you define yoga therapy in IAYT, does it cover the yoga in its comprehensiveness, or what is your take on that?
Good question. Thank you for asking that. Yeah, yoga therapy includes the 8 limbs of yoga. Yes, so it's a very expansive program or system that we utilize for the application of yogic principles. And so it's very different than in the United States. So many people think yoga is specific to asana only, right? And so what we're attempting to do, and in this emerging profession called yoga therapy, is to help people understand, from an East meets West kind of perspective, that you're just talking about one limb here. Well, there's a lot of other limbs in yoga, right? Thank you.
Thank you.
So, all right.
Thank you, Elisa.
My pleasure.
For wonderful talk.
Thank you, ma'am. Thank you for sharing your knowledge with us. I would request the chairperson to join us in the front to felicitate our speaker. I would request Miss Eliza to join. I would request Dr. Aruna to please felicitate our chairperson. With this, we move to the next session. We have our next chairperson, Professor J.S. Thakur. He's a professor in community medicine and School of Public Health. He's a founder president in World NCD Federation. He has played role in establishing 3 Center of Excellence World NCD Federations. He comes in the top 2% of scientists globally under the Stanford University ranking. He's a lead author in World NCD Federation Guideline, expert member in Mission Steering Group of National Health Mission, Ministry of Health, Government of India. He's a member of India Expert Group on COVID-19 by Ministry of Health and Family Welfare, Government of India. Central Team Leader for Punjab. He's a principal investigator for 4 population-based cancer registries in Chandigarh and Punjab. Have more than 210 publications and 2 books. I welcome you, sir, and I request you to kindly introduce our next speaker for the session.
So, thank you very much for the liberal introduction, and at the outset, I'm really thankful to Dr. Akshay Anand for inviting me to this very important meeting, which is very dear to me. I'm an advocate of integrated medicine, and it is really a pleasure to be part of this meeting. And it is also indeed a pleasure for me to introduce the next speaker, Susan Stiger. She's the Vice President, International Association of Yoga Therapists. Her area of interest is aging, family caregiving, yoga and mental health, integrated mental health interventions, yoga therapy, and she's Professor Emeritus at the School of Social Work, St. Louis University, USA. More than 50 years of experience as a social worker, and she has more than 50 publications, 2 books, and National VA Manual to her credit. She's the alumni of Wayne State University in US and also University of Kansas in US. So over to Susan.
I have to decide whether I wear my coat or take it off. So we're going It's much warmer here than it is at home for me, but today it's chilly. So let me make sure that I get this and this there. Okay. Before I start, though, it is really a great honor to be here today and just to be part of the thinking and the sharing that's occurring today and that's going to be occurring tomorrow. But it's a real joy for me to be able to see people that are involved in this area of yoga in the medical area, that because I don't see this at home, and so it's just a real joy for me. But my biggest joy is as I begin my soon to be my 80th year on this earth, I am privileged to see yoga beginning to take root. And we're beginning to accept and acknowledge the best that the East, you, can offer us in the United States and in the West. And that is a real joy to me. So I just thank you all. It's just a privilege to be here. So I put this here because this slide, because in the past few decades, there's been a lot of studies done on yoga. And many feel we pretty much know what it does, but do we really know it well enough to recommend it for cancer care? So that's the thing that we're really going to be looking at here. And I'm looking at it from cancer care in the United States. That's my lens. And so as noted in 1992, mere just accumulation of research is not enough. We've accumulated it, but what do we really know how and what and when and where to use yoga in cancer care? So that's the real question that we keep asking ourselves. So currently in the United States, there's no best practices that can be recommended. We know from evidence and anecdotally that yoga can help across the cancer continuum, but nobody agrees how or why or when. in that cancer continuum of care. What we need and wish for are working and are working on is medically and scientifically vetted and nationally agreed upon best practices. So that's what we're really looking for, is what can we use when and where with people. So in the United States, there's a Society for Integrative Oncology, and it's beginning to work on best practices so recommendations can be made and teaching curriculum and competencies can be developed, and information will be available to all who are really concerned, such as patients, doctors, family members, anyone in the healthcare field. And in 2024, the Society on Integrative Oncology is convening an international, multi-institutional, multidisciplinary working group on subject matters of experts to investigate best practices. So they're taking all the research that they can find and sitting together with experts to decide what best practices can be used in cancer care. So the SIO, which is the Society for Integrative Oncology, and the American Society of Clinical Oncology, they're working together doing extensive meta-analysis on integrative studies with cancer. They started with pain management, and they have moved also now into anxiety and depression, and believe in regard to yoga in these areas that they can begin to make recommendations that yoga does help moderately, only moderately, mostly with breast cancer. Some other cancers, but mostly moderately with breast cancer. So this was a very good article by Niven in 2022, notes that some of the common errors that occur and continue to plague randomized control trials looking at the use of yoga. For me, one of the most important ones is the details of the yoga intervention. And they're not there. We can't agree upon what it might be, and that's really a big problem. Or it's very scarce, and we're developing it by trial and error. But we're not able to replicate, and we've got to be able to replicate, and that's an important piece. So we're learning, and all that we can learn from all the trials that we do, even though they're randomized, is we're learning that we could just generalize at that point in regard to that local trial that we probably had. So I was had in the honor of being part of a breast cancer study, and I so wish that I had been able to have better knowledge of where and when and how. And so I'm hoping in the future that we'll be able to do this. So this slide addresses how we might resolve some of the errors that we begin to, so that we can begin to look at best practices that we have and that are really based on evidence. And it's a checklist that, that all who do yoga studies with cancer should use. And I wish that we had had this checklist when I did my study back in 2017 and 2018, and we would have had a much better sound study. This is so hard to read, and I understand that, but it's noted at the end in the presentation as a resource and reference, so you'll see it there. So let's look at why we think yoga can really help support cancer care. As you know, it's a lifestyle choice, and I like to think that it addresses the mental, the social, the physical, and the spiritual parts of our being, a holistic approach, as Alyssa said just recently about it. This offers just another view of looking at a holistic approach with the mind, body, and spirit, but it leaves out for me that very important part, which is the social part. So it's the community, and it's the family. It's those that give us that social support. So why does yoga help? I like these simple ways, but research is showing us also that it helps with cancer in the following ways: by promoting somatic self-awareness. The meditative component of yoga increases blood flow and releases dopamine and reduces respiratory rate. It also elicits the relaxation response that's so important, especially like with someone with diabetes, with their insulin function. So we need to think of those many ways that it does help. So now let's look at using yoga in cancer care. We can put a professional yoga person on every health team, and we should. And we need to be sure that yogic interventions are safe, and we believe that the yoga lifestyle can affect one's quality of life. But we also have to remember that we have to refer out if we are not the right professional person, and that can be. So here are some things to consider about if you're going to be doing yoga, and deciding if you are the right professional person to work with that patient that has cancer. First and foremost, for me, what stage is that person in? What stage is the patient in? And then the next important thing to me is, what is my own personal experience in cancer care? And then, am I practicing what I'm preaching? Because I really certainly don't believe that one can one can help a person in a medical setting unless they're practicing themselves. And so lots of times I refer out because I am not the person that should be working with those. And so it's a really important thing to be able to let your ego go and to refer out. So this slide shows why we need to refer out, because we can cause harm, and each time we work with a person, we have to assess. And that's a very important piece, to always assess. And I think that's what makes one of the things that makes a yoga teacher different than a yoga therapist, at least in the United States. We assess the whole person, where they are, what's happening, and we assess them each time that we see them. So this slide is again a reminder of what we need to ask ourselves as we work with people with cancer, remembering that we don't have to be the expert, and then looking at the patient's readiness, when and where the patient might be ready for the introduction of yoga, and often starting gradually and introducing yogic techniques like breathing, sitting and just noticing, and also meditating. And a little bit of body movement. But the more important piece is just to be able to get people to sit and notice and be able to talk about what's going on in their bodies. I think for myself, that's what yoga has really helped me understand. And by that, I'm then able to help other people understand that. But we also have to be able to say and ask, what's the purpose of our involvement? And how will we be able to engage that person? Are we going to be able to engage them individually? Or are they best served in a group? Are they going to be best served in person? Are they going to be served best online? Or will a hybrid? Are they going to be okay to be part of a research study? Or is this only in a healthcare intervention is where we can best engage them? So in looking at the type of involvement, the stage of cancer is so important in determining what we might do. My colleague, Lee Leibel at Columbia University has developed this slide and the view of looking at yoga across the cancer curriculum. This slide's easier to read, and it shows that yoga has utility at every stage of the cancer care. and what is happening to the person at each stage, or what might happen to the person in each stage. So yoga has been shown to help the side effects of cancer care, and here we note that what side effects one might have in their body, their mind, or their spirit. They may be systemic, or they could be local, as may the presentation be acute, or it might be lingering or late, and it could also include what is noted here on this slide. So we know that by growing evidence and anecdotally that yoga helps. So why don't we see more people using it? These are some of the barriers that can be at the institutional or the individual level that cause people not to use yoga. So there's availability. Is it there? Are they able to? Do we have the research that provides people with what they need to do? Is absence of evidence, there is absence of evidence-based practices in yoga. What's the yogic dose? We don't know that necessarily. Long-term, is there follow-up? Awareness. There's really low, as we've talked about, there's really low public awareness of the benefits of yoga, both during and after cancer treatment. Most people don't understand, and best in the United States, most doctors don't understand, or most people in healthcare profession don't understand what those benefits might be. There's also access, if we talked about it, to what's safe for them at different stages that they're in. And is it affordable? Are they able to afford it? That's one of the things that we struggle with in the United States is our health care is not always affordable for the people that do need it and that could really benefit from it. And how do we make that possible for them? And is it also affordable, as we just talked about, for the person that's presenting it? Because if that yoga therapist, what type of model are they able in the United States to be paid? Oftentimes, as we said earlier in the recent presentation, they have to go through their healthcare provider, such as a physician, or in certain cases, a physical therapist can be, if it's a registered or licensed physical therapist or occupational therapist or nurse, they can use yoga, but a yoga therapist at this point, only the Dean Ornish program is the only one that is accepted in the United States where someone can be reimbursed for that. So the Society on Integrative Oncology, as I said, their mission is to advance evidence-based, comprehensive, integrative healthcare to improve the lives of people with cancer. So IAYT, the organization that I'm working with at the International Association of Yoga Therapists, and SIO, we're working together within a special interest group, helping to acknowledge that there's different scopes of practice in practices and in competencies between yoga therapy and a yoga teacher. And so we're working also with another organization of Yoga Alliance in the United States to help define that scope of practice. The group that is with SIO and IAYT, we're also looking at how to raise the voice. As I mentioned, those who are underserved in the healthcare, how can we better serve them? How can we hear their voices and make sure that they receive the yoga therapy that they deserve? And also recognize, as we mentioned earlier today with some of the people speaking, the diversity of yoga lineages, which is so important, and have that recognized. And then to be able to provide an overview of evidence-based yoga interventions that support pharmacological and behavioral interventions, and also to become a resource. So that's what this group is doing, as we're IAYT and SIO is we're really looking at how can we together provide resources both for researchers, patients, families, and caregivers and other yoga people. So we're making collaborative efforts, and one of the ones that I really enjoyed and took full benefit of during COVID was we called them Wellness Wednesdays. So online, the Society on Integrative Oncology had different speakers from around the country and the world speak about different aspects of using yoga with cancer care. And it was the first time that we had anything like that. And they've continued to offer things in various ways. We don't have Wellness Wednesdays every Wednesday now, because now we're realizing also it's important to bring people together in person. But they have developed an app. It's ONCIO. I don't even think they have an acronym for it, but they just call it that. And this app also provides free information and resources and free yoga sessions for people, both for family members and for those that are undergoing cancer, and also for the caregivers and for the health caregivers. They're providing that also. So we look forward very much to having this collaboration with the Society on Integrative Oncology as an organization, because we feel that, you know, now that they have been able to moderately say that it helps breast cancer with anxiety and depression and some pain, we want to be able to help and support them finding other cancers, and that also they can begin to recommend at the same level. So the next two slides provide my references, and they're available for you online, and also some resources. This one is filled with resources, and let's see, the second to the bottom is that free app that's there for people to be able to use. I'm also very grateful to my colleague, especially Lee Leibel, who's working on her doctorate at SVIASA in yoga therapy, and also to Dr. Stephanie Munez, and then my other colleagues at IAYT that have helped me put this together. So I appreciate that.
So thank you, Susan, for very nicely covering the topic of role of yoga in cancer care. And in your presentation, you have brought what is the evidence which is available, and also yoga across the continuum of care, because that is a very important aspect. You have definitely mentioned the role in the pain management and also in the outcomes as well as quality of life, and some of the issues which are related to mental health, especially depression and anxiety. Also, you know, what are the barriers to yoga? In fact, I'm just returning from our Southeast Asia regional meeting on non-communicable diseases, and we were discussing about cancer care and cancer control also, and this aspect was also discussed there. And we also run the largest cancer history program in India. As was mentioned, we run 4 population-based cancer histories in Punjab and Chandigarh, covering 5.1 million population. This is the largest cancer history program, and our data registries are also included in cancer incident in 5 continents, which is considered to be a gold standard for registries. One of the peculiar things of cancer in Southeast Asia and in India is that our cancers are reported at a very late stage, that is in the stage 3 and stage 4, and almost to the extent of 60 to 70%. And secondly, despite having screening program at the national level, our screening rates are very low. You take the example of Punjab and Haryana, say only 4% of the women they have undergone breast cancer screening, one time lifetime screening. Right, which is very, very low as compared to what you
Where I've
see
had
in
one for years.
Yes.
Yes.
So that is there. So it was a very good presentation, and I'm sure that there might be some questions, so we can take a few questions.
And I just would like to say that if I get cancer, I'm also, after the acute piece, I'm coming here for the other, for the follow-up.
And I'm also, in this city, Chandigarh, we have a very high incidence of breast cancer. We rank fourth in the overall cancer rates for breast incidence in the country.
And you, as you know, we do in the U.S. too have a very high incidence for it. Right. Yes. Yeah.
Yes. So mean the time when the people are thinking, I should ask you, in a country like India or Southeast Asia, when you are getting, large number of the patient in the advanced care, and you have definitely mentioned that. So what do you visualize the role of yoga in such a situation?
What do I visualize it?
Yeah.
I would love to be able to see a yoga therapist involved with everyone in any healthcare field. So I would love to be able to see every physician and healthcare provider in the United States accept yoga as one of the necessary interventions that one should have. But again, our biggest fight in the United States is helping people realize that it's not asanas. Because when you're undergoing chemotherapy, let's say with breast cancer, you cannot do asanas every day or vigorous ones. And so it's helping physicians. That was one of the biggest things that when I did my study with, I was very honored to be able to work with some oncologists at Washington University in St. Louis. We did a breast cancer study on women who were just starting and who were just diagnosed with breast cancer, and they were starting the chemotherapy. And it was helping those doctors, those 5 oncologists that I was involved with, understanding that sometimes they're doing yoga if the person wakes up and they just kind of scan their body and they begin to think about, how do I feel today? And, that was so hard for them to understand that, because they thought we were going to get these people to get up and move and all of this. And that's not it. Just for me, it was to help them be able to realize that some breathing techniques that might have been able to get them to just to relax with their treatments, and to be able to live through those treatments, or to be able to live through the fact that they now have this diagnosis and what's going to happen to them, what's going to happen in their family. If we're talking about a woman, it's also oftentimes with her family. Many women are responsible still with children who have breast cancer, or or as a grandmother who are helping take care of, and it's helping them think about, okay, let's get through these treatments, and then what's going to happen to me. So it's not, it's working with doctors, especially in the US, to realize that it's not the asana part that's the most important. It's those other limbs that are so important that we have to be able to help people with, so that they can survive. So.
Right. The other critical aspect is that, once we are talking about integrated teams, with the modern system of medicine and the yoga. In our country, we have 2 ministries. One is the Ministry of Health and Family Welfare, and another is the Ministry of Ayush, which also cover yoga. But when you see the routine healthcare delivery system in this country, there is, a lot lot of scope for synergy between these two systems. And while, having yoga as an intervention for your cancer care, you need to have integrated teams where, the yoga expert also become part of the overall team. It is happening in some of the institutions and to some extent maybe in PGI also, but not everywhere. So this is an issue. What is your experience in US? Do you have these integrated teams and do you find that they are working?
We have in several, like MD Anderson and Cleveland Clinic, one of the hospitals and University of Michigan Hospital also has that. We have yoga therapists on teams, and there are several others. Stanford has, but it depends upon the doctors that are in charge and how they see it. My hope is my profession is social work, and I'm a medical social worker and have been for many years. And I'm on a team when I work in a hospital. I want to be able to see yoga therapists on my team with me as a social worker, an OT, a PT, a dietitian, and my physician and my nurse. And that's what I would love to be able to see, as I am sure you'd like to see that here in India also. Yeah, yeah.
So any question? Yes, please.
Namaste, ma'am. It's so energizing to see your passion in 80s. Ma'am, my question is, so we all must have been knowing by this time that cancer cells do not thrive in an oxygenated space, and probably this is the reason why we promote to practice yoga. But no matter how much we know this, still at the ground root level, it is very difficult to convince somebody who is currently in the third stage or fourth stage. So, what is your experience of convincing patients and the family of that patient towards going for the yoga as a curative therapy or as a palliative care therapy? Thank you, ma'am.
And a very good question, and an important one, because for myself, the patient is the one that has to decide. So it's trying to help them see the benefits that they might experience themselves. So encouraging them to try, and I find personally, oftentimes breath work is a really good way to start. And they can begin to see some of the benefits from that, and then see if they're interested in something further than that. So does that answer what you're asking? I hope, sort of. I know it's hard, but again, we always have to allow the patient to be the one that decides. I can't decide for them and say, this is best for you. All I can do is say to them, I would suggest that you try this. People have found it helpful, and I'm here to help you try it.
And just to add to what Susan has said, when you talk about continuum of care in cancer, there are two extremes. One is cancer prevention, and another is disability limitation, rehabilitation, and palliative care. And both these components are very, we usually say 30 to 40% of the cancers are preventable. But in India, 70% of cancers are preventable because major chunk come from tobacco, in smoking and smokeless. They do not have the problem of smokeless tobacco, but it is equally important. And in terms of palliative care, I would say, during my tenure in WHO, we got the palliative care component evaluated in all the regional cancer centers in the country. We are very poor in terms of palliative care services. Some of the institutions are doing well, including PGI and PMC. So yoga has a very important role to play as a improving the quality of care. Everybody who is in the stage 3 or 4 has to die. But I have seen people crying with pain in this country and in many settings. Even some of my relatives also So this is a very urgent and a good therapy for improvement of quality. There was somebody else, yes. Maybe I think this will be the last question. I know that we are running behind the schedule.
I'm a 3 times suffered cancer patient from 2005, 2008 and 2015-16. And I am a survivor. But I have done all my treatment from TMC, Mumbai. And a very long experience, I never find any hospital person suggest that you go for yoga therapy. My case is TNBC and BRCA positive. My case is hereditary. So it's very difficult for a person or a female or a male who is suffering this problem. Because when I was going through the chemotherapy, doctors suggest me to guide other patients. I'm taking my chemotherapy, and in spite of that, I'm helping the other patients, those who are taking. So it's very difficult. Hospitals are not suggesting any patients to go to this yoga therapy because I was aware in my family there was a very chronic this disease was. So I was aware how to handle, but I don't think maximum of the people they don't know how to handle this disease. So how can you people, because you people stands on a very high position in this field. So how can you people help our ministry and other hospitals like this PGI, TMC? So they should recommend every patient to go through this yoga because it helps too much. I am a live example in front of you people that I'm a 3 time. My first was third stage, second was third stage, and third was also a third stage. And my case was very difficult. I gone through a 16 hours operation, and I'm here with you. So one should always go through yoga for the mental and health issues. It's only my word for you people. The cancer is not that dangerous. Anybody can compete this, but they should have a willpower and go through the mental. And their family also has the patience to handle it.
Thank you for sharing. And you know, you're the kind of person and the people like yourselves that we need to be able to hear from and better understand, and so we can help the medical field and the governments decide, both in both our countries and around the world, the importance of yoga therapy and look at what it did to you. You know, I look.
I'm just coming from Mumbai after going my follow-up.
Yesterday
night I land this Ambala station, and I stayed somewhere because I want to attend this, and especially for yours this session. And after that,
well, and so you know that how desperately we need it, because you've experienced not being able to have it, but because of your own personal experience, you did, and you knew the importance, and you integrated it into your own care. So kudos to you. That's why.
So thank you. You really mentioned some of the deficiencies in the system, and I would request Dr. Akshay Anand that when we are coming up as an outcome of this meeting,
That's why we're here, is it not? Yeah.
There should be some recommendation that there should be integrated teams which should be constituted. Right? In palliative care also we tell that it is not only end of life care, but they should be part and parcel of the team from the very beginning. And in fact, I work very closely with the International Alliance for Patient Organization. And for us, basically, we gainfully use the people suffering from non-communicable diseases in overall, academic engagement as well as other engagement.
Right.
In fact, the organizing secretary of the Southeast Asia meeting of non-communicable disease was a cancer survivor. Right? He was telling me, I am having some neuropathy, but we do encourage them to gainfully engage them so that they do not feel that they are less.
Right.
They can also contribute. So this is the sort of engagement which is required. I think this session was very informative. But we, as a country, originator of yoga, I think we are learning from your experience, but in this country we need to do a lot in terms of bringing this functional integration. And I have observed this. I am also a member of the expert group of the Ministry of Health, which is working on integration of yoga with the non-communicable diseases. There is a lot of resistance among the professionals. Right? So this type of barriers and the mindset needs improvement. And I think, thank you, Susan. This session was very informative and brought some evidence-based data from experience from US, and I'm sure it will be very useful to all of us sitting in this audience. And once again, thank you very much.
So we all need to be members of the choir. That means we believe this is helpful, so let's go out and sing it, right? To everybody.
So before closing, I'll say that please give her a big hand.
With your permission, can I add one important point?
Thank you, sir. I would request the chairperson to join us here and felicitate our speaker. I would request Dr. Krishan Kumar Soni to join and felicitate our chairperson. Thank you, sir. So we'll go towards the next talk, and I welcome our next chairperson, Professor D. Basu. He's a professor and head in Department of Psychiatry at PGI. He's a director in World Psychiatric Association Collaborating Center, PGI, former editor, Indian Journal of Social Psychiatry, founder, editor, World Social Psychiatry. He's a member of Indian Association of Child and Adolescents Mental Health, Society for the Study of Addiction in UK, Indian Psychiatric Society, Indian Association of Social Psychiatry. He has been awarded with NIDA International Research Fellowship, NHS International Fellowship, Honorary Fellow, World Association of Social Psychiatry, Tilak Vinobha Rao ICMR Award, and goes on. He has more than 400 publications. I welcome you, sir, for the session, and I request you to kindly introduce our next speaker for the session.
Thank you very much. Nice to hear nice words about oneself. It's just that we are running about 45 minutes late, but it's a pleasure to be here, and I have been here in the morning as well to hear. I think I was midway through Professor Mitali Mukherjee's talk. It's absolutely fascinating to be here and to hear so many differing but integrative kind of viewpoints coming up. I'm aware that we are standing in between this talk and the lunch, so without any further ado, we will start. This is a talk which is slightly different than the previous ones. It's on, I understand, on neurobiology of sleep and consciousness, and Professor Sanjeev Patra, PhD, is an associate professor and head of the Department of Yoga and Department of Education, Central University of Rajasthan. His field of interest includes high density EEG, polysomnography, and autonomic function tests. As you can see, rather than reading through this thing, we'd rather like to hear Dr. Patra. I think that would be more useful and will save some time as well. Dr. Patra, most welcome. Please start your talk. Thank you.
Namaste. So respected professors of PGI Chandigarh, the scholars, and the respected chairperson of the session. This talk will be little different. This talk will be amalgamation between the science and the philosophy. The mind is often used in the scientific literature, but till date, no suitable definition has been given to the mind. It is not so easy to define mind. But in a broader term, we can say mind is the software and brain is the hardware. But there are many questions that goes on at the back of our mind. Is mind a matter? Is mind an energy? Is mind a field? Is mind an energy field? Is mind an emotional state? The conventional psychology has an answer for the mind. And as per conventional psychology, the mind is the epiphenomenon of the body. Or in other words, epiphenomenon of the matter. A mass of matter, and which is nothing but our brain. So in other words, we can say the mind is the mind is the seat of the brain, and brain is definitely important to synthesize the mind. And mind is the byproduct of many electrophysiological reactions that go on and on within the mind, involving billions and millions of neurons within the human brain. Consciousness and mind are often considered synonymous. The neuroscientists, they have a different approach. They give a logical approach for elucidating the consciousness, and it has become a big question. Scientists used to define and quantify with certain parameter like level of awareness and the mechanism of the cerebral state with electrophysiological flow of certain group of neurons, such as the neurons of ascending reticular activating system, etc. But no appropriate definition has come till date for the mind. But when you look into an ancient text, popularly known as Patanjali Yoga Sutra, 3000 years ago, the Maharishi Patanjali had written this text. So, Maharishi Patanjali elaborates mind in its totality. And in many ancient texts, you will find not only the mind, the various facets of mind, like manas, buddhi, chitta, and ahankar. So, the mind that we are talking currently is nothing but the manas. But there are many more to say about chitta, to say about ahankar, to say about buddhi. So in Patanjali Yoga Sutra, not only mind, there are 5 modifications of mind which are well described, and the 5 modifications of mind are Praman, Viparya, Vikalpa, Smriti, and Nidra, and we will be discussing about these 5 modifications of mind in the subsequent slides. There are many other ancient texts like Mandukya Upanishad, Dhyan Bindu Upanishad, and Yoga Vasishtha. So these 3 ancient texts do talk about the 3 states of consciousness, and definitely the other one is called Turiya. And the 3 states of consciousness are Jagrat, Swapna, and Susupti. Jagrat is the wakeful state, Swapna is the dream state, and Susupti is the deep sleep. the state of deep sleep. So Jagrata can be correlated with the wakeful state or can be correlated with our physical body, because during Jagrat, all our five senses and five organs of actions remain active, and therefore we are awake. But yoga says this organ of action and these five senses needs to be under our control. Swapna is the dream state of the consciousness. This is correlated with the causal body or the Karana Sarira. Karana Sarira is nothing but our Atman, our spirit, our soul. So this is the state in which the individual gets connected with the cosmos. Susupti is the deep sleep state. So during wakefulness, the energy drained out. There should be some state of consciousness in which this energy needs to be restored. So this is the state in which the energy gets restored, and next day we are fresh for our regular work. So this is the state in which we get rejuvenated and we restore our efficiency. And that is Susupti. And Turiya is definitely not beyond our, it is definitely beyond our understanding, beyond our comprehension. This is neither sleep nor wakefulness. This is Avyakta, this is eternal. Modern science revolves around though only one process of consciousness, and that is sleep. Sleep is a dynamic process involving complex neural activation. And I would say in 1929, the psychiatrist Hans Berger, he established the brain activity, which was found to be different during wakefulness and sleep. So sleep is broadly classified into two. All of us know NREM sleep and REM sleep. And NREM sleep has three stages, N1, N2 and N3. And we spend more time in N2 sleep, and N2 sleep is otherwise called light sleep. And REM sleep is rapid eye movement sleep, is otherwise called paradoxical sleep or the dream sleep. And N3 is our deep sleep or slow wave sleep. There are many functions of sleep. So during sleep, the tissue gets repaired, the protein synthesis happens, because during slow wave sleep, the growth hormone gets synthesized. So sleep has a restorative function. During sleep, there is decreased metabolism to allocate limited energy resources. So we can say sleep has an energy conservation process. Sleep enhances our immunity. So we can say sleep has immune regulation. Because of sleep, there is maturation of the brain cell during infancy. So we can say it has an ontogenic effect. During sleep and during nap also, power nap, when we take power nap, there is memory consolidation. And all of us know this phenomenon is called long-term potentiation. And sleep facilitates brain plasticity. So we can say it is sleep regulates synaptic homeostasis. But it is not last but not least also glymphatic sleep system. So sleep is a phenomenon in which many neurotoxic substances is disposed of, and one of the neurotoxic substances is tau protein or the beta amyloid protein. So there are many structures in the brain are involved. That definitely there is physiology involved and many neurotransmitters involved during sleep. The structures involved during sleep are hypothalamus, brainstem, thalamus, pineal gland, and basal forebrain. So let me highlight, because it is of importance in yoga. In the hypothalamus, there is the nucleus called suprachiasmatic nucleus. So suprachiasmatic nucleus not only regulates the circadian rhythm, it also regulates our ultradian rhythm. And one of the classical example of ultradian rhythm is the nasal cycle. In yoga, we call it a swara. What to do when which nostril is dominant. For example, if your right nostril is found to be dominant, what are you supposed to do now? If your left nostril is dominant, what are you supposed to do? So this is regulated by one of the nucleus within the hypothalamus called, or popularly known as suprachiasmatic nucleus. So the light, during the daytime, the light falls on the retina, and on the retina we have the receptor, rods and cone, and these receptors are responsible for developing the action potential, and this action potential travels in the retino-hypothalamic tract, and the suprachiasmatic nucleus remains active during daytime, and during night time this activation slowly gets diminished, and therefore we fall into sleep. It is also the control center for affecting sleep and arousal, and within the hypothalamus there is definitely suprachiasmatic nucleus. And the brainstem communicates with the hypothalamus to control the transition between sleep and wakefulness. Thalamus, it is the gateway to the brain. Thalamus becomes quiet, letting you tune out of the external world. But during REM sleep or rapid eye movement sleep, the thalamus remains very active, sending the cortex images, sounds, and other sensations that fill our dreams. There is a close connection between the pineal gland and the suprachiasmatic nucleus. So therefore, the pineal gland located within the brain two hemispheres receives signal from the suprachiasmatic nucleus and increases the production of the neurohormone called melatonin. The basal forebrain promotes the sleep and wakefulness, while the part of the midbrain acts as an arousal system. Amygdala, this is concerned with our emotion, and this also remains active during dream sleep. Therefore, you do not have any control over your emotion during dream sleep because your amygdala is active. So there are many hallmarks during dream sleep, and the sleep researcher definitely gives a lot of emphasis on these hallmarks, and one of the hallmarks is the sharp vortex wave. This is occasionally found to be appearing in the EEG screen. This is a vortex wave which are bilateral phase reversing discharges over the central region, and this is found to be appearing along with the low voltage mixed frequency pattern during the N1 sleep or during the transition from wakefulness to sleep. During light sleep, we also find two hallmarks, and these two hallmarks are sleep spindles and the K complexes. Sleep spindles are nothing but the periodical oscillation of the neuron from the thalamus to the cortex, and the K complexes is a sharp, well-delineated high-voltage biphasic wave that lasts for more than 0.5 seconds. And the two hallmarks are theta and delta wave, which are definitely found during deep sleep. There is also neurochemistry involved. In NREM sleep, the following neurotransmitters are found to be synthesized, and they are GABA, gamma-aminobutyric acid, galanin, adenosine, and melatonin. And in rapid eye movement sleep, acetylcholine, glutamate, GABA, and glycine. Here, so let me highlight, adenosine plays a very wonderful role during slow wave sleep or the deep sleep, because adenosine promotes the slow wave sleep or deep sleep. Similarly, glycine also plays an important role. Because of the glycine, during dream sleep, all the muscle attains this state of atonia except three muscles, and they are diaphragm, the muscles of the middle ear, and the muscles of the eye. That that is purely contributed by the glycine. So here we can see the subcortical area involved in producing what neurotransmitter. For example, ventral tegmental area involved in producing dopamine, raphe nuclei involved in producing serotonin. Hypothalamus is involved in producing orexin, etc. So now, an individual is capable of sensing and responding to its world. And the normal human consciousness definitely requires the brainstem, the basal forebrain, and definitely the diencephalic areas to keep the general awakeness or wakefulness intact. Similarly, the thalamocortical area, thalamocortical network, to respond to the internal and external stimuli. There is also networking of the neurons with the association of the subcortical area by producing the following neurotransmitters. There is also bilateral higher order heterochemical association cortex with the subcortical components that control the level of our alertness, attention, and awareness. So in neuroscience, in the neurology, what is consciousness? What does a doctor say about consciousness? So from a perspective of the doctor, an injury to or disconnection of the interconnected system, typically from the cardiac arrest or traumatic brain injury, can result in disorders of consciousness, including coma. And doctor also believes that the gateway of the brain or the thalamus is also called the zone of consciousness. Let me highlight a couple of things what our ancient seers have spoken about. There are states of consciousness, states of mind, and each one of us falls under either of the state of mind called chitta bhumi. Mudha. Mudha is the dull state of the mind. So here the quality of an individual is lethargic quality and the undercurrent quality is rajas or the dynamism. Kshipta is the scattered state of the mind. And here the quality of an individual is the rajas or the dynamic activity, and the undercurrent is tamas or lethargy. Vikshipta is the distracted state of the mind. And here the quality of the mind is rajas, and the undercurrent is sattva or the pure state of the mind. Ekagra, it is the focused mind, one-pointed mind. And here the quality of an individual is sattva or the pure form of the mind, and the undercurrent is the rajas or the dynamism. Niruddha, it is beyond all the qualities, beyond all the attributes of an individual. And in Niruddha is the state where the mind is absolutely devoid of thoughts. Mind is absolutely devoid of fantasies. Mind is absolutely devoid of emotions. The aspect of mind, in the ancient text, the aspect of mind refers to I. And the objective of yoga is to attain nirvija samadhi, nirvija bija. Bija means as long as the I component is connected or associated with me, so bija is not lost. So yoga is all about sweeping out. Yoga is all about washing out this bija from the mind. So Patanjali has given a very sequential methodological process to attain samadhi. And the process is when we do anything, any attentive process with the help of an object, let the process be effortful. And when the process becomes effortless, called meditation or dhyan. And when the aspirant becomes one with the object, called samadhi. So samadhi is the state in which the observer or the subject becomes one with the object. So there are two types of samadhi, sabija samadhi and nirvija samadhi. Sabija samadhi is the samadhi in which there is seed or there is I component involved. But in nirvija samadhi there is no seed. And sabija samadhi is broadly classified into sampragnat samadhi and asampragnat samadhi. So sampragnat samadhi is the samadhi in which the knowledge of the whole reality will or surfaces out. And that is called ritambara prajna. So that is the state in which an aspirant or a yoga comes to know about the reality, the knowledge about the reality. And when the knowledge of the reality subsides, that leads to a samadhi called asampragnata samadhi. And gradually this asampragnata samadhi makes an aspirant to attain dharmamegha samadhi. Dharmamegha samadhi, the samadhi, or it is the transcendental state of the consciousness in which all the virtues of the world showered upon of an individual. And the next is Kaivalya. Kaivalya is called Nirvikalpa Samadhi. And in the subsequent slide, I will be telling what is Kaivalya. Here, these are the Chitta Vritti. I was talking about the Chitta Vritti in the previous slide. The Chitta Vritti are the right knowledge, wrong knowledge, imagination, sleep, and memory. And the process of the yoga is all about inhibiting these modification of the mind. So I think probably that gave the inspiration to the sleep scientists to carry out some of the research. So I am highlighting a couple of the research. Definitely I would say all these are very recent research in which the mindfulness was studied, heartful meditation was studied, a wide range of mind-body therapies were also studied, and all these meditation techniques are definitely found to be effective in improving the sleep quality in insomnia, psychological stress, anxiety, and the cancer patients. So my study in 2010, we are involved in carrying out a lot of research involving the different sect of meditators. So in one of the sect of the meditator was Brahma Kumari Raja Yoga meditation. So when we put them into sleep and recorded their sleep structure, we found the reduction of the dream sleep or the REM sleep and the enhancement or the increased amount of the slow wave sleep. So similarly, at SVASA, we have another type of meditation called cyclic meditation. Students, those who are practicing cyclic meditation, they also improved in the same direction. They also improved the slow wave sleep, reduced the rapid eye movement sleep, and the number of awakening per hours also reduced. In 1997, some of the neuroscientists and one of the scientists by name Mason and his associate, they compared the short-term meditator, long-term meditator, and intermediate practitioners. And one of the very surprising result was in long-term meditator, they could notice the interspersing of alpha and delta wave. And they could interpret this interspersing of the alpha and delta wave as Turyavastha. But unfortunately, this Turyavastha was never reported in the subsequent research. So therefore, I always say, we always get ourselves revolved around, we always get revolved around, the sleep research, understanding the architecture of the sleep, understanding the EEG signature, etc. So therefore, and also the scientists are interested to find a network or find a loop that can connect the subcortical structure. Like for example, one of the typical example is, default mode network. But here I want to draw your attention that meditation is not possible when you put the subject in, the fMRI. Meditation is not possible when you put the subject into MRI. But definitely, some of the invasive technique like positron emission tomography also is not possible because it's absolutely invasive technique. And using the EEG, there are very limited research. So meditation, the scope of the meditation is very, very high, and the scientists should come forward to do some research using the high density EEG and the other tool to understand the meditation, because meditation, the root word for the meditation and the medication is the same, and it is to heal. So whatever may be the meditation technique, always meditation heals an individual, and it keeps your consciousness elevated. Yes. Just 10 seconds. So another ancient text, and this ancient text there is highlight about the two avastha, unmani avastha and mananmani avastha. Unmani avastha is the state in which an aspirant attains to a state in which the mind will be devoid of thoughts. And mananmani avastha is a state where there will be no mind. When there is no mind, there will be no thoughts, there will be no imagination, there will be no nothing. So, then what is Kaivalya? What is Nirvikalpa Samadhi? What is Moksha? So this yogi used to believe that once you attain the Kaivalya, the prana, the consciousness, which is a driving force for your Atman, breaks open your cortex, pierces your cortex, breaks open your skull, and a beam of light moves out from your head. And this beam of light and your consciousness never takes part in birth and death cycle, never and ever. And that is called Kaivalya. But people like us, who will come onto the surface of this earth to take part in birth and death cycle. So, yoga gives us the path to attain Kaivalya, to attain moksha, to attain this elevated state of consciousness. Thank you.
Thank you very much, Dr. Patra. That was a heady mix of Eastern and modern scientific principles. It was very interesting. I do talk on sleep and also on consciousness in various forums, but this was particularly interesting because you blended the usual, the traditional, the Western, the EEG, the waves, and the type of sleep, etc., the well-known things with the Eastern concepts which are thousands of years old. You have talked about Mandukya Upanishads, the three states, and of course the fourth one which transcends all. You have talked about the various stages of consciousness which have been defined in these Eastern thoughts in great details. I wish we had more time, but we have grossly overstepped our time. So probably we can just have one or two quick questions. I can see one hand here. Yes, please.
Sir, some people. Good afternoon, sir. Some people report that they experience lucid dreaming or some kind of transcendental sleep where they have some kind of control over what they are seeing. Some people have out of body experiences
and some people even talk about astral projection. So, is there any neurobiological or yogic explanation for these experiences that people have? I mean, I actually believe in it because I've had lucid dreaming and out of body experiences, so I don't know how to understand that.
And so far, only one. And it is not a story; it is a fact, because our scientists were, involved in this process. So Mahabodhi meditator. So there was a Mahabodhi meditator, and the body was not decaying for months together. So our scientists went. Scientists went to find out, to explore out why the body is not decaying. Then ECG was coming flat, EEG was coming flat, there was no body temperature was not recorded, but only one parameter was intact, and that is the rectal temperature. And this state is called suspended animation. Suspended animation is absolutely different from hibernation. Got it? But seldom you would find any people remaining in suspended animation. So suspended animation is the state in which all the bodily parameter, you cannot record any bodily parameter. Only parameter you can record is rectal temperature.
Okay, thank you.
Yeah.
Anyone else?
Do we have examples of the suspended animation?
Yeah, that is on a Mahabodhi meditator we have.
Anyone else? Otherwise,
I think someone is raising.
Oh, right far the back, and then whatever order. There would be many questions, but we'll have to stop probably you and then yourself. Yes, please.
Yes, just a quick question. As you know, if we attend the sleep medicine conference, there's a lot of talk about sleep staging using EEG. What sort of sensors or biomarkers can you use to measure the different states of consciousness?
It is quite difficult. It is at this point of time. I'll not be able to give justice to your question. Measuring consciousness is next to impossible.
Hariom bhaiya. You said that suprachiasmatic nucleus is responsible for regulation of swara as well. So when its activity diminishes in the night time, does the swara not change?
No activity doesn't diminishes. It doesn't diminish. During night, the left swara, the left nostril is found to be dominant. The left one.
So even if I sleep with my right dominant is slowly...
You will not have sleep. Or you will not spend good time in deep sleep, I will tell you. Yeah. Yeah.
Okay, I think I'm sorry, but I guess we'll have to stop here now, because otherwise we'll be pushing the other speakers post lunch into. Thank you so much for this very interesting talk. You made it sound interesting. Talks on sleep can put people to sleep very easily. Usually, that's my experience. But somehow you managed to keep everybody. Thank you very much.
Thank you, sir. I would request the chairperson to please felicitate our speaker. I would request Dr. Akshay please kindly felicitate our chairperson. Thank you, sir. Thank you, everyone. I know we are already running late, so I request everybody to be back by 2:15 so that we can start our next session. Good afternoon, everyone. I request everybody to please settle down. We are starting with our post lunch session. So we have a first talk. I welcome our chairpersons for the first talk, Dr. Sanjay Munjal. He's a professor and in charge in Speech and Hearing Unit, Department of Otolaryngology, PGI. He's a senior professional in speech and hearing in Northern India. His experience is more than 30 years, more than of 20 years of research experience. He's a member of Indian Speech and Hearing Association, Indian Society of Cleft Lip, Palate and Craniofacial Anomalies. He has delivered more than 50 lectures across the globe. He has been awarded with the Dayalan's Manual SSV Award, Muktesh Award, N.R. Chaudhary Memorial Award, Young Scientist Award, and he has more than 80 publications. I welcome you, sir. Then we have a second chairperson, Dr. Rajni Sharma. She's a play therapist, child psychology department of pediatrics at PGI. She has a clinical experience more than of 24 years in allied mental health services. She's a member of Indian Psychiatric Association, Indian Association for the Study of Pain. She has expertise in the research and teaching, rehabilitation and management of children with the special need, clinical assessment, scale constructions, Hindi translation of research tools. She has more than 50 publication, back care booklets. I welcome you, ma'am, and I request Dr. Sanjay Munjal to introduce our next speaker for the session.
Hello.
Yes.
Good afternoon. At the outside, I would like to, along with my co-chairperson, Dr. Rajni, would like to thank Dr. Akshay Anand for inviting us to chair this session. And it's a post-lunch session, and which is supposed to be a little bit difficult session because all of us tend to fall asleep, and the topic is such that it's on drug abuse. Okay, so or the substance abuse. So let me first introduce the speaker. The speaker is Dr. Hemant Bhargav, who is Associate Professor at the Department of Integrative Medicine, NIMHANS, New Delhi. And his areas of interest include the yoga therapy, Ayurveda, and integrative medicine and its applications in the field of mental health and neurosciences. He is a visiting faculty of the Harvard Medical School, Boston, USA, and has clinical and research experience of more than 20 years in the integrative medicine. He has been entrusted with many awards and he has more than 90 publications. Over to Dr. Hemant.
Thank you so much, Professor Munjal and Sharma Madam. Thank you so much. I am especially thankful to Professor Akshay Anand for giving me this opportunity and getting all these stalwarts in the field on one platform together. So I would begin my presentation. I'm basically a modern medicine doctor, and when I was doing my medicine, I realized that there are several gaps, especially when it comes to lifestyle disorders, which can be filled by traditional knowledge. And that was the reason that after doing my MBBS, I ventured into the field of yoga therapy. And now at the Department of Integrative Medicine, we are trying to integrate yoga, Ayurveda, psychiatry, and neurology, all the four streams together. So I begin my presentation by offering my namaste to all of you. This is a mudra, a very ancient mudra that became very popular during COVID times. So what does this mean when we say namaste? So it essentially means that I bow to you. When I say I bow to you, I am bowing down to the divinity in you. And that is how yoga brings the phenomena of connection, connects. So this is the overview of my presentation. Initial 10 minutes I will just focus on giving a brief history about yoga, and then we will go on to effects of yoga on brain, and then there will be a focus on SUD. So I offer my greetings from the National Institute of Mental Health and Neurosciences. NIMHANS is a major tertiary care mental hospital in the South India. And as you can see, NIMHANS was founded in 1950s, and the first director then, when he designed the logo of NIMHANS, he had this vision to include Samatvam Yoga Uchyate in the emblem. So this was in 1950s, that yoga is a part of NIMHANS, which means equanimity of mind in success and failure is yoga. So it is a famous shloka from Bhagavad Gita, 2nd chapter, when Krishna is telling Arjuna that you go to the war with equanimity. So now the question comes, what is yoga? We see just two decades before, yoga was something which was understood as somebody, इनको तो छोड़ छाड़ के सब हिमालय जाना है तो ये योग करेंगे, So it was considered as a mystical kind of a thing which is only for few who want to renounce the world and go away. But then we see that in the new millennia, there have been a renaissance of this age-old science, and probably, there is no better time for this science to now come up and take the main platform, because the kind of problem that humanity is facing, the mental health issues have become a pandemic, and especially post-COVID now, these are major crises that humanity is facing. Now, when we ask this question to different geographical locations in the world, the definitions also differ, especially when you see that here in India, people understand yoga in its broader perspective. But even here, we see that people consider one limb of yoga, as Alisa was saying, yogasana as yoga, and even if you say yogasana, people consider that yoga is another kind of a workout or a exercise. But even then, if you consider one limb as exercise, they are not same, because the physiological effect that exercise does and what yoga does, they are actually different. At the end of a yoga session, you feel much more relaxed, the basal metabolic rate reduces, and most important thing is that yoga integrates the body with breath, breath with mind, and therefore the synchronization of the movements. And even when you are doing a cardio or you are in a gym, you put your headphone on and your mind is still running. The habit of the mind to always keep running continues. But in yoga, you have to remain mindful and be in the present moment. So therefore, it is not only about posture. There can be different circumstances which can bring you to a particular posture, and you can remain in that for a long time, but it does not mean that you are getting a asana siddhi. So here we have BKS Iyengar, who is doing this bridge pose here. And there is another person who is compulsively into that pose. Probably he would remain in that pose for a longer time even than BKS Iyengar. But the internal state of the person, that is what differentiates a bodily posture from a yogic posture. So yoga is an ancient lifestyle practice. It's originated in India, and it is associated with sense of connectedness, self-awareness, compassion. And first mention we see more than 3,000 years ago in Rig Veda. And this is what, there is a reference for that. And Patanjali, later on gave yoga a very systematic 8-limbed structure in his sutras. And you see the definition of yoga, yogaha chitta vritti nirodha. When you say chitta vritti, it means repetitive patterns of thoughts and images that keep coming in our mind. If we look at our own lives, there have been particular kind of emotions that have been repeating in our lives, particular kind of thinking patterns that govern our whole life. But yoga becomes a science of self-awareness. What are my vrittis? What are the chitta vrittis that are dominating my life? What are the things that are bringing same scenario in my life again and again? Why I land up in the same situation? Probably it is because of the vrittis which we are not aware of. So Patanjali, why this slide is important is that yoga was fundamentally directed towards mind. We think that yoga is more directed to the body or to lose weight, but Patanjali thought that it is to address the mind. So here we have Swami Vivekananda, in 1893, he is the first person who took yoga to the West. in his famous address, in Chicago in the Parliament of Religion, when he started by saying, "My brothers and sisters of America." When he just said that, he started a sense of connectedness, and just when he uttered this line, after that, for 10 minutes, there were sounds of claps that were reverberating in the whole hall. My brothers and sisters of America. This is how yoga was taken to the West for the first time in history. And then after Swami Vivekananda, Swami Paramhamsa Yogananda took Kriya Yoga there. Then Maharshi Mahesh Yogi, popularized the transcendental meditation. And it became a huge hit during that time. Even in Harvard, there were a lot of studies on yogis showing special kind of autonomic feats, where they were able to manipulate their heart rate, were able to reduce their EEG. Swami Rama went after that. And that is how yoga started becoming more and more popular. And then Swami B.K.S. Iyengar, Sri B.K.S. Iyengar popularized one limb of yoga, that is asana. And now because of that, people think that yoga is only asana. Swami Kuvalyananda deserves a special mention. He is the one who founded the oldest yoga institute in India, which is in Kaivalya Dhama in Lonavala, Pune. And in 1920s, he started a yoga scientific journal known as Yoga Mimamsa and conducted first scientific study in yoga in the world. Now, with this background, yoga represents connection. Yuj comes from the root word to unite. So in my trek to reach higher states of consciousness, which Professor Sanjeev Patra was telling, they appear far beyond, our reach, those states of Turiya or Samadhi. But in my attempt, would I connect to my neighbor in a better way? Will it enhance social connectedness? And in this way, yoga becomes a science of self-awareness. And with that awareness, I become more compassionate. So this is what the world needs. And when people do yoga, we have observed that even if they do not talk to each other, they feel connected. So that is, people say that I am not alone. So this is the psychophysiological, model, actually psychological model, where people who were practicing yoga regularly were asked about their subjective experience. When you undergo a session of yoga, what do you feel? So people reported 4 things. I feel calm. I feel more mindful about myself, what goes on within me, within my body, within my mind, and also about my surrounding. A sense of compassion, not only towards others, but towards myself. After yoga, I am able to forgive myself. This is a big thing. And then a sense of connectedness. So it enhances my relationship with myself, which then enhances my relationship with others. And that is how it enhances the well-being outcomes. Now this particular thing, during the COVID times when people were disconnected, people were suffering, we were actually able to observe that they were able to connect more. So these are the yoga halls at our institute. We have 10 yoga sessions that happen throughout the day. There is a separate yoga session for anxiety, for depression, for schizophrenia, for substance use disorder, for obsessive compulsive disorder, for metabolic syndrome. We have, for back pain, we have separate batches. Now, when a yoga session typically happens, what happens? How do you feel connected? I can go to gym also at the same time, but I don't feel that connection. Why does that happen with yoga? So here in a yoga session, you move your body together. Your awareness to that body part goes together, you breathe together, you chant together. So this phenomena, we call it as coupling of the consciousness. The consciousness get coupled, the atmosphere becomes electrifying, and you feel that you belong to something higher than you. So this is what we observed even during the COVID-19 pandemic. In fact, we conducted sessions not only for people in India, but over the world, even in US, with India Association of Greater Boston, we were able to offer stress management sessions, and people really, found them beneficial. So therefore, Patanjali, as Elisa was saying, that there are 8 limbs of yoga. And as I was pointing out, that dhyana or meditation is one of the limb of yoga, and it is not separate from yoga. So calling yoga and meditation is not correct, if you look at the history of yoga. So these are the 4 limbs. The initial 2 limbs, yama are satya, ahimsa, brahmacharya, aparigraha, asteya. These are the directions in which a human being tends to lose his energy. If you tell one lie, to cover that you have to tell hundreds of lies. You start a chain of violence, it will never end. It will always reciprocate. So Patanjali says that do not allow your energy to be wasted in those 5 directions, and niyamas are the directions in which you should channelize your energy. So where the energy should not go, where it should go. And once you follow yama niyama, you will get an ability to sit still for a long time. If you cannot sit still for a long time, you are breaking on yamas and niyamas. Okay. So then when you are able to sit sthiram sukham asaram, then you are ready to do pranayama. And there have been link between the breath and the emotion and the mind, the bodily posture and the mind. And then comes the higher dimensions of yoga, the antaranga yoga, where you are internalizing, closing down your sense organs, and then going into the focused and defocused state of concentration and transcendental states. So Telles et al. In their paper, nicely provided this graph where the biological effects of yoga were predominantly the down regulation of HPA axis, and Streeter et al. In US, in Harvard, were able to demonstrate increase in the level of GABA. GABA is a calming neurotransmitter immediately after 1 hour of yoga session as compared to a treadmill walk. And we also see several neurotransmitters getting affected by specific yoga practices. And ultimately, we find that the vagal dominance is one mechanism through which yoga work, and all this translates into clinical improvement. So if you see changes in the neuroplasticity, balancing in the autonomic nervous system, enhancement of PFC activity, deactivation of limbic cortex, and so there are fundamentally 2 mechanisms. One is the top-down approach, which is probably mainly due to enhancement of GABAergic tone, and there is a bottom-up approach, which is mainly because of the enhancement of vagal tone. So GABAergic tone and vagal tone, these are predominant mechanisms through which yoga is working apart from the HPA axis down regulation. This is a very interesting study which shows that as the age progresses, the gray matter in our brain shrinks. But when people who practiced yoga at least for a year, they were taken, then the slope was not that steep, and yoga indirectly offered protection against shrinking of the gray matter in the brain. Also, in another study, it is a prospective kind of a study where long-term yoga practitioner experience dependent plasticity of yoga, especially the regions that are associated with attention, emotion regulation, insula, PFC, ACC, were showed increase in the gray matter volume. So 34 neuroimaging studies, their review showed that those who practice yoga regularly have higher insula and hippocampus sizes. They show increased activation of PFCs and better functional connectivity in the default mode networks. This is a study that we did at Nimhans, where in old age homes, we asked the elderly people to practice yoga, and what we observed was that in 6 months, not only the natural shrinking of the brain reduced, but there was an increase in the size of the hippocampus. So here a journalist from UK came to Nimhans, and we applied this device known as FNIRS device. We call it as poor man's MRI, because it gives a lot of freedom to do different yogic techniques. So what we did here was we asked them to chant Om under a MRI scanner also and FNIRS also, and Om chanting caused limbic deactivation. So amygdala is the area of the brain which is associated with negative ruminations, and people reported calming down of this area by 5 minutes of Om chanting. Om, also has 3 domains, A, U and Ma. As Professor Patra, told, it is Mandukya Upanishad. One of the shortest Upanishad. It only has 12 verses. If you put Mandukya Upanishad PDF, you will read the Upanishad in 5 minutes. Okay? But this is considered as the topmost among all the Upanishads, the gem among all the Vedic literature. Yeah. So then this says A, U and Ma. A represents the wakeful state of consciousness. When I am talking to you, my consciousness is flowing through my senses and I am perceiving things as they are. U is when my consciousness is projected in a mental world, where I am imagining things, where I am processing information, when I am not connected. When I talk to you, suddenly you see, oh, what did he speak? Then you were in U before that, Then when your consciousness is withdrawn within you, when you are not projecting anything out, when it is a blank slate, you are inwards, then it is ma. And turiya is a state which transcends wakeful, dream, and sleep. So this Upanishad says that when the consciousness was created, it was created by these sounds. Like ah was the sound through which the wakeful state was created. Now in our day-to-day activity, have you ever observed when we, unconsciously, without our awareness, we produce the sound ah? When does that happen? Pain. If I take a pin and prick you, you say ah, ouch. Or if a wrestler has to lift a heavy weight, he says ah. He wants to gather all the energy in his arms, so he says ah. But on the other hand, when you want to withdraw inwards, when somebody is telling something and you want to absorb it, you say yes. Or if you are very hungry, and I bring a nice chocolate pastry, you put it in your mouth, and you say yum. You want to absorb it. The ma in yum is Brahmari. So you want to take things in, you produce Whereas, what about oo then? So the oo here is a nasal sound. It is like so when I forget your name, I say आपको कहीं देखा है So you are turning into your own mind and trying to find out some word or something. So this was very interesting for us. And what did we do is, if you look at the psychiatry, the whole domain of psychiatry, there are three dimensions, modes in which the psychiatric disorders are categorized. The wakeful domain is a externalizing domain where we see the symptoms of hyperactivity, impulsivity, ADHD in children are dominant. Whereas when people have more dominant kind of a personality, they are asocial, not motivated, they don't initiate any kind of activity, sleep is their favorite pastime, Whereas tend to get lost in their imaginary world. Best time for them is you leave them into their imagination, they will make their own castles and they are just fine there. So here we see the externalizing, the internalizing and psychotic. These are three fundamental classification of psychiatric disorders. And in the center lies Turiya, which is about the metacognitive awareness of sleep, wakefulness and dream. And this is what is yoga. So yoga is transcendence of all these three states which are vrittis. So Bhagavad Gita, Krishna says that if you want to transcend, it is very important that you bring balance in your lifestyle. Without balance in the lifestyle, there is no transcendence. So, na ati ashnan yogo asti na cha an ashnataha na cha ati swapna shilasya jagrato naiva arjuna. One who sleeps too much or remains too much awake, one who eats too much or eats too less, for him there is no yoga. Yukta hara viharasya yukta cheshtasya karmasu yukta swapna avabodhasya yogo bhavati dukkha. So you need a moderation in the lifestyle. And then what we did was we made subjects chant these three sounds and then uma together in a MRI scanner. And what we observed was that recruited more attentional networks, whereas with ma there was more DMN activity and U was in between. So we were actually able to find out that thousands of year old, what Mandukya Upanishad said, there is a neurobiological basis to it. And you can, apply it. So now I will go towards the clinical aspect of yoga. If you put yoga, in PubMed, you see 7,864 hits. And you can see after the year 2000, there is an exponential rise in the number of researches that have been published. And the same way with yoga as a therapy as well. So these are the major countries which are performing these yoga studies. And we have India and US, leading the whole world into yoga research. This particular review article published in British Journal of Psychiatry Advances summarizes the work that has been done in the field of yoga and mental health for the last 2 decades. So we have been able to get all the meta-analysis and review. So it is a updated review into this practice. In this paper, we also showed the referral pattern in our in Nimhan's Yoga Center, the Department of Integrative Medicine. As you can see, schizophrenia, depression. These are the two major populations which are getting referrals. So here there are many INIs, institutes are there. If you start a full-fledged yoga service for psychiatry, you can expect these two referrals. The third important is the caregivers of these patients. They also deserve that. Then bipolar affective disorder, anxiety, OCD, other psychotic conditions. And here, the substance use disorder is something that the researches have been done in the last 5 years, and now the number of referrals are increasing. Now, when we focus on managing the substance use disorders, it is also important to understand the disorder from the traditional perspective. The mind, from Bhagavad Gita point of view, the attributes of the mind were classified into tamas, sattva and rajas. So rajas are more externalizing, they are more impulsive, they can't sit still, they have to remain active, so workaholic, So there is rajas. Tamas find it difficult to initiate an action, and there is less flexibility, in the mind, where sattva is like driving a car. Rajas is the accelerator, tamas is the brake, and sattva is the clutch, which allows you the freedom to shift. So what we did was, trying to understand psychiatric disorders from this guna perspective, we applied Vedic personality inventory. You can go to this website, vedicpersonality.org, and you can analyze for yourself what is your sattva, rajas or tamas score. And we applied it on patients with depression, schizophrenia, OCD, anxiety, bipolar affective disorder. And what we observed was, sorry for the font, the sattva scores were highest in healthy subjects, but after that anxiety and OCD showed highest sattva score, whereas the psychotic conditions, the schizophrenia and bipolar affective disorder showed lowest sattva. Rajas scores were high in schizophrenia, bipolar affective disorder and anxiety disorder. Depression had lowest rajas score. And the tamas score was high in schizophrenia and bipolar affective disorder. When we applied this scale, this paper is under review on people with substance use disorder, we found high rajas score and high tamas score. So the highest score was rajas, followed by tamas, and low sattva. Now, why this is important to categorize people into this kind of personality traits is, the traditional texts also provide a lifestyle. How a person who is in a tamas mode can channelize to rajas mode, and from rajas to sattva and transcendental. So there are lifestyle practices that can be advised. There are dietary practices given in the 17th chapter of Bhagavad Gita, where you can modify their diet also based on that. And you can also, basically from tamas to rajas, you go by reinforcement through fear or reward. From rajas to sattva, you go by let go attitude and practicing the act of giving without your name or expectation. And then sattva to gunatita happens by surrendering the sense of doership. Similarly, we try to understand it from the Ayurveda point of view also. And through Ayusoft Prakriti diagnostic tool, when we analyze the Prakriti of people with different psychiatric disorders, we observed that highest kapha score was observed in depression. Anxiety and substance use disorder showed highest vata scores. Whereas in bipolar affective disorder and schizophrenia, the pitta scores were high. Now we have this Panchakosha model, in yoga, through which we try to understand several different kind of disorders. The layers here are from the physical layer, which is at the core, and the blue layer is the layer of bliss. So they say that in the core of every individual, he has bliss. Now, when I expose myself to any kind of a substance, I experience bliss. I experience euphoria, But that euphoria is not synthesized by that substance. It is being released somewhere from within me, So the pink layer is known as the layer of Manomaya Kosha, which is filled with emotions of attachment and aversion, Raga and Dvesha. The thicker is the layer, the lesser the access the individual has to the layer of bliss. Okay? What these substances do is, they temporarily open the gates for the Anandamaya Kosha, and the Anandamaya Kosha is able to reach the Annamaya Kosha, and the person experiences bliss. But after that, when the effect of the substance is gone, then there is a rebound tightening of this layer of Manomaya Kosha, and then therefore we see the phenomena of withdrawal, phenomena of tolerance, loss of control. All those things happen because the same dose of the substance is not able to give them that bliss, because now the layer closes even more tight every time you do it. So now people also say that if I do yoga, will I get addicted to yoga? So yoga is something which also is opening these doors, and probably after yoga session I will also again get into that. But it is not so. What I feel is that rather than opening this gate temporarily, yoga actually increases the thickness or manifestation of your last layer itself, and all the layer of the individual starts getting filled with bliss. So it is a different kind of a mechanism. You are not fighting with the nature, you are attuning yourself with the nature. So this is a very powerful figure. If you see in Katha Upanishad, Yama is talking to Nachiketa, and Nachiketa is asking him the question, regarding what is responsible for the downfall of an individual. And he says, please understand your body in the form of a chariot. The 5 horses are your 5 sense organs, and they are very powerful. We say horsepower. Horse can drag you anywhere, and there are not only one, there are 5 horses, and they are driving you into this life in all the directions. And the mind is the reins through which these horses are held by the buddhi, the intellect, the prefrontal cortex. Okay, whenever you take a substance, the PFC gets knocked out, and after that it is your lower brain, your amygdala, your limbic cortex, your animal instinct that take over. And you say, no, whenever one abuses a substance, whatever mood that is there, that gets aggravated. So, and then there is this fellow sitting behind, uninvolved, with his folded hands watching. He has nothing to do with what is going on there. The observer, so observer is not involved. But the whole journey of yoga is that the horses should not become the drivers of my life. My driver of my life should be this fellow sitting in the depth of my own heart, my own conscience. So yoga is a journey of closing down the sense organs and turning them inwards. So it is through this mechanism that yoga empowers the people, enhances the activation of PFCs. So why yoga for substance use disorder? Number of researchers show that yoga reduces the aggravating. So people, we know that in ADHD, people who are anxiety prone, they get into substances to relieve their anxiety. So yoga can be a better coping strategy.
Continue forever, because it's such a
I know.
one of the most interesting, and I think Dr. Akshay has chosen your session in the afternoon because of the way you speak. Okay, but I think we have very less time.
Yes. Yeah.
2-3 minutes.
Another 2 minutes. I'll just wind up. So what I mean to say is there are researches that show that yoga enhances endorphin levels. So if the endogenous endorphins are increasing, then the dependence on exogenous opioids will come down. Similarly, we have found that yoga is safe and feasible in this population. So this is an extensive literature review of what has been done and in what domains that yoga has been found useful. So not only improving quality of life or mood, there are core addiction outcomes such as abstinence and craving that yoga has been shown to reduce. And these review, we have done RCTs on alcohol use disorder at NIMHANS and found that yoga was better. It added a value in reducing cortisol levels. And we had done another trial on opioid use disorders and found that at 6 months there were significantly lesser number of people who were negative for opioid use. Similarly, in this research, I found that Kapalabhati practice activated bilateral prefrontal cortices, which are the decision makers, which give you that control over your impulses. So Kapalabhati can be a practice to enhance your willpower, and so yoga has to activate the stop switch and deactivate the go switch. So Kapalabhati and Om chanting deactivated the limbic cortex, Kapalabhati activated this. So this is the overall hypothetical model that we have published through which yoga can be useful in substance use disorders. And finally, I have recently got a Wellcome Trust DBT funded early career fellowship in collaboration with Harvard Medical School, and we are doing a 6-month long trial on opioid use disorder, people who are addicted to heroin, and trying to understand the effect of long-term yoga practice on them. And we have already developed and validated a module which is a acute withdrawal and maintenance phase kind of a module that has emerged. So in summary, I would like to say that yoga has neurobiological underpinnings. It can deactivate limbic cortex, enhance GABA, reduce cortisol, increase BDNF, increase brain volume, and enhance vagal tone. So the work that Nimans has done in the last 2 decades is summarized in this textbook, which is funded by CCRYN, and we have acknowledged CCRYN. So thank you, sir. The Science and Art of Yoga in Mental and Neurological Healthcare. Finally, I would like to say that there are doctors here from modern field and there are people from traditional systems. So we should all come like the football team. The people there on the back is the defense. People in the center forward are people who attack. So people who are aggressive, people who are defensive, both should come together, and probably then only we will be able to conquer over non-communicable disorders. So I had few feedback from the patients who had undergone yoga in our center, if it could be shown at the end. Thank you so much. Thank you so much.
ಬ್ಯಾಂಗ್ಳೂರಿಂದ ಬಂದಿದ್ದೀನಿ. ನನಗೆ 1 year ಇಂದ ನಿದ್ದೆ ಬರ್ತಾ ಇರಲಿಲ್ಲ, ತುಂಬ ಕೋಪ ಬರ್ತಾ ಇತ್ತು, ಜಗಳ ಮಾಡಬೇಕು, ಜನಗಳನ್ನ ನೋಡಿದ್ರೆ ಜಗಳ ಮಾಡಬೇಕು ಅನ್ನಿಸ್ತಾ ಇತ್ತು. ಸೊ ನಿಮ್ಯಾನ್ಸಿಗೆ ಸಜೆಸ್ಟ್ ಮಾಡಿದ್ರು ಡಾಕ್ಟ್ರು. ಡಿಪ್ರೆಷನ್ ಡಾಕ್ಟರ್ನ ಮೀಟ್ ಮಾಡಿದೆ ನಾನು. ಡಿಪ್ರೆಷನ್ ಡಾಕ್ಟರ್ ಮೀಟ್ ಮಾಡಿದಾಗ ಅವರು ನನಗೆ ಟ್ಯಾಬ್ಲೆಟ್ಸು ಪ್ಲಸ್ ಯೋಗ ಸಜೆಸ್ಟ್ ಮಾಡಿದ್ರು. ಯೋಗ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ಇವಾಗ 1 month ಇಂದ ಯೋಗ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ನಾನು. ಯೋಗದಲ್ಲಿ ನನಗೆ ಪವನ ಮುಕ್ತಾಸನ, ಸೂರ್ಯ ನಮಸ್ಕಾರ, ಮತ್ತು ಅರ್ಧಚಕ್ರಹಾಸನ, ಪ್ರಾಣಾಯಾಮ ಎಲ್ಲ ಹೇಳ್ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಇವಾಗ ನಿದ್ದೆ ಬರ್ತಾ ಇದೆ ಚೆನ್ನಾಗಿ, ಪ್ಲಸ್ ನನಗೆ ಕೋಪ ಕಮ್ಮಿ ಆಗಿದೆ, ಜನಗಳ ಜೊತೆ ಮಾತಾಡಬೇಕು ಅನ್ಸುತ್ತೆ, ಖುಷಿಯಾಗಿದ್ದೀನಿ, ಪ್ಲಸ್ ಟ್ಯಾಬ್ಲೆಟು ತಗೋತಾ ಇದ್ದೀನಿ, ಪ್ಲಸ್ ಯೋಗನೂ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. 1 month ಇಂದ ನಾನು ಯೋಗ ಮಾಡ್ತಾ ಇದ್ದೀನಿ, ನಂಗೆ ಆರಾಮಿದೆ.
नमस्ते, मेरा नाम निवेदिता चौधरी है। मैं ओसीडी पेशेंट हूँ, जिससे कि मेरे मन में बहुत सारे सुसाइड के थॉट्स आते हैं, मैं किसी के सामने हंस ना दूँ ये थॉट्स आते हैं। ये मुझे बीमारी 1 साल से है। तब हम निमंस में एडमिट हुए। वैसे हम महाराष्ट्र पुणे से है। निमंस आने के बाद में मुझे डॉक्टर ने टैबलेट्स भी लेने के लिए कहा और योगा जाने के लिए सजेस्ट किया। मैं योगा आने के बाद मुझे प्राणायाम करके मुझे अच्छा लगा, और ओमकारा करके मुझे मेरे मन को बहुत अच्छे से शांति मिली, मुझे अच्छा लगा, मेरा कॉन्फिडेंस लेवल बढ़ा, और मैं अभी अकेले भी बाहर जा सकती हूँ, मुझे डर नहीं लगता है। थैंक यू फॉर योगा, थैंक यू फॉर सर, thank you for yoga session.
He has depression, and when he came here, due to certain medicines, he was having a lot of speech difficulty, chewing difficulty, and he was anxious. He had gained weight, but with yoga and a lot of practice of yoga through this center in Nimhans, he has been able to reduce weight. His posture has become straighter. His confidence has built up. He has become more confident in speaking. His difficulty of chewing has almost gone.
I am Dayan Shankar. Amol is my son.
He's a cannabis
He had,
addiction.
Some mental health issues, and he was taking treatment from Nimhans, and it was suggested that he do his yoga also, and I find that starting with his yoga, he's improved a lot. He has moved from a state of hopelessness to a state of hopefulness, and it's I find him very promising after starting his yoga, and it goes a long way in the management of health issues. I feel it's a necessary adjunct to mental health treatment. Thank you.
Namaste, my name is Ral Shivapati. Before I came here, I had a problem like thoughts. Similarly, I had a different kind of mood triggers, such as I need to maintain the color in the wall. For example, in a white wall, if there is a black paint, I need to remove the black paint and arrange it in a white manner. Similarly, I have many kind of thought, negative obsessions, such as I need to remove the mold from my body, and many times I cut it with the blades and remove the molds, and I could not handle the obsession. It was like most difficult task for.
Sorry. Okay. Thank you. So thank you. So finally, I would like to say that yoga is a multifaceted, and it integrates the movement of body, breath, and mind, and therefore there is a neurobiological basis to yoga, and it is a useful adjunct in psychiatric illnesses and substance use. Thank you.
Thank you, Dr. for such an elaborative and impressive talk. So with this, I would like to invite now open questions. If you have, we will have just 2-3 short quick questions, because we are already running short of time.
So anybody would like to ask me?
Hello, good afternoon. I have one very straightforward question. Over so many talks from the morning, we know that there are a lot of studies already done, a lot of studies being done on the efficacy of yoga. As a professional, my question is very simple. How can we make it accessible for patients? Because one point that I would like to mention, even in the presentation you mentioned there are different natures, different prakriti, because of which a person will have different predominant way of functioning or thinking. So that in itself stands as an obstacle many a times to take any treatment ahead. So my simple question is, how can we make it as accessible and easy as possible for patients, both in terms of education and awareness, and then actually being able to follow?
So I feel, Professor Rich Fletcher is here, so technology can play a very important role. There can be apps which can have simple questionnaires, which you fill it up and you are a Vata Prakriti, Pitta Kapha Prakriti, you are Satvik, Rajasik, Tam. And then based on that, there can be specific modules of lifestyle that could be put into those apps. And then there could be specific yoga programs, yoga techniques that people can do. And we will have to use technology, I think, to make it more accessible.
गुड आफ्टरनून सर। सर मैं एक क्रॉस डिसेबिलिटी अर्ली इंटरवेंशन सेंटर में एज ए रिहैब साइकोलॉजिस्ट काम करता हूँ। वहाँ पर 8 साल तक के बच्चे आते हैं हमारे पास में, मोस्ट पॉपुलेशन ASD, ADHD और इंटेलेक्चुअल डिसेबिलिटी। तो उन बच्चों के लिए सर हम किस तरह के योगासन करवा सकते हैं उनसे? आप
ADHD के लिए हमने एक मॉड्यूल निमाज में डेवलप किया था। ADHD बहुत चैलेंजिंग है। हम लोगों ने देखा कि 120 सब्जेक्ट्स को हमने एनरोल किया था हमारे ट्रायल में, लेकिन 1 महीने के बाद हमारे पास सिर्फ 30 बच्चे बचे। सो उसमें भी मुझे लगता है कि शुरू में आपको हाई फंक्शनिंग ऑटिज़म या हाई फंक्शनिंग ADHD पे ही फोकस करना होगा। ज़्यादा सीवियर लोगों में या मॉडरेट टू सीवियर में हम कुछ नहीं कर पाएंगे। तो दिस ऑल्सो वी शुड बी वी शुड नॉट से दैट एवरीवेयर एवरीथिंग विल वर्क। सो आप माइल्ड और हाई फंक्शनिंग किड्स को सिलेक्ट कीजिए और उनके ऊपर स्पेशली जब ऑटिज़म की बात आती है तो राधा कृष्णा एट ऑल के 2-3 ट्रायल है जिसमें उन्होंने 9 मंथ तक जब बच्चों ने रेगुलर योगा किया तो उन्होंने सिग्निफिकेंट इंप्रूवमेंट उनके इमिटेशन स्किल में, उनके आई कांटेक्ट में और उनके बिहेवियर में उन्होंने इंप्रूवमेंट दिखाया है। और ADHD में भी जो शशांक आसन होता है, उसमें जो भ्रामरी होता है, ऐसे कुछ टेक्निक्स है जो कि उनको हेल्प कर सकते हैं। त्राटका एक बहुत अच्छा मेडिटेशन टेक्निक है जो ADHD में यूज़फुल हो सकता है। लेकिन ये टेक्नोलॉजी के थ्रू या ऑनलाइन योगा के थ्रू उनको कराना बहुत मुश्किल है। इनको 1-on-1 योगा सेशन से ही होता है। थैंक यू।
So already Dr. Hemant has mentioned what is the importance of yoga, not only in improving our quality of life, but when we talk about substance abuse, there are two main areas where yoga can help. One is detoxification, to maintain the detoxification period, and then to prevent the relapse. So yoga actually play a very important role when we talk about this. Yoga does not only connect you with other, but it connects us within ourselves. So it is a journey within yourself. Then we connect ourselves with the other people, and that's how we gain control on our emotional regulation or on our thoughts, on our actions, and that's how we improve our quality of life. At the end of the day, we work, we go to work, we talk to each other, but at the end of the day, we seek mental peace. And yoga is a kind of intervention along with all multidisciplinary and all with neurobiological, pharmacological treatment. It gives us that mental peace. It encourages us to explore within ourselves and get that mental peace which we are looking for. So already lot of researches are going on. You have done a remarkable researches.
Thank you.
We here in PGI CCR YN under the guidance of Dr. Akshay Nam is also doing a remarkable job. That's why we all are here today, and we are trying to being aware and spread that awareness among the community. So thank you, Dr. Manoj, with this.
Thank you, madam, for beautifully summarizing my talk. Thank you.
Thank you, sir. I would request the chairperson to join here and felicitate our speaker. I would request Dr. Raghvendra Rao to please felicitate our chairpersons. Moving next towards the next session, I welcome our next chairpersons for the session, Professor Rakesh Kapoor and Professor Nirja Bharti. Professor Rakesh Kapoor is a founder director of Tata Memorial Center at Mullapur and Saranpur, Punjab, Department of Atomic Energy, joint and additional medical superintendent at PGI. He is established intrabiliary radiation delivery practice in the bile duct cancer patients, various chemoradiation protocols among the gastrointestinal cancers. He has been awarded with many fellowships. He had worked under many reputed institutes in the USA. He has awarded with ICRO fellowship. He is editor of International Journal of Non-Communicable Diseases, delivered more than 150 talks and chaired scientific meetings in the international and national platforms. He had more than 200 publications. I welcome you, sir, to chair the next session. We have Professor Nirja Bharti. She's a professor in Department of Anesthesia and Intensive Care at PGI. She's a secretary Indian Society of Study of Pain at Chandigarh chapter, chairperson for SIG of Neuropathic Pain Management. Her clinical experience area is exploring safer therapeutic options for chronic pain relief and cancer pain management. Editorial board member and reviewer in many reputed international and national journals. She has been awarded with BMJ Award South Asia for Cancer Pain Management, Best Research Paper Award at International Pain Conference, Best Publication Award in 2013, 14, 16 and 2017. More than 100 publication. I welcome you, ma'am, for the session. I would request Professor Rakesh Kapoor to kindly introduce our next speaker for the session.
Thank you, Dr. Akshay and the team of CCRYM for giving us this opportunity that we have been in a position to interact with the faculty as well as the members who have come from abroad and practically speaking on the session on yoga. I invite Dr. Kashinath G. Mehtri, who is the assistant professor in the Department of Yoga, Central University of Rajasthan. Dr. Kashinath is, I think, going to speak on therapeutic and preventive role of yoga in lifestyle disorders, chronic health problems, and personality development. I think, Dr. Kashinath, this is something which is not only yoga, it is a psychological topic also.
Yes, sir. Thank you.
We are eager to hear from you.
Good afternoon to respected speakers and my dear audience. So in the next 30 minutes, hopefully within 30 minutes, so I will be talking on the role of yoga in the enhancement of cardiac autonomic function. So in this talk, we will be discussing about what is cardiac autonomic function and what are the very widely used autonomic function measures and some studies to highlight the role of yoga in the enhancement of cardiac autonomic function. Now, what is cardiac autonomic function? Now, autonomic nervous system is a part of our nervous system which works on its own, and the cardiac autonomic nervous system is related to the part of the nervous system which controls or which regulates the cardiac function, how our heart functions. So it actually does in two ways. So one part of the cardiac autonomic nervous system is sympathetic nervous system. The other is parasympathetic nervous system. So sympathetic nervous system upregulates or activate or increases the cardiac function. The other helps to relax the heart. Relax is not completely relax, but down regulate the cardiac function. So these two are very essential because now sympathetic activity, it helps to make our heart work hard when we are into a demanding situation, when we are in the stress. Stress is not necessarily only the psychological stress. It can be physical stress, it can be physiological stress, or it can be a psychological, even simple mental calculation. When we are doing, that is actually a stressful task for our nervous system, and that increases our heartbeat, our blood pressure, and so on. So opposite to that is the autonomic nervous system, which helps to relax the heart. So when we are sleeping, when we are listening to a very good music, or when we are doing pranayama, or when we are with our very near dear persons, what happens is heart relaxes. So this relaxation is brought into action by parasympathetic nervous system. Okay, so this is what is the simple brief explanation about the autonomic nervous system, cardiac autonomic nervous system. Now it comes to cardiac autonomic dysfunction. So what is cardiac autonomic dysfunction? It is nothing but it is an imbalance in how our autonomic nervous system handles the heart. Okay, so imbalance is essentially increased sympathetic activity. That means our brain believes that we are in the stress, we are in a demanding situation, and ask our heart to work hard. Okay, so when there is increased sympathetic activity and decreased parasympathetic activity, that means when the person is not in any very stressful situation, he is very relaxed, but still our parasympathetic nervous system fails to make our heart relax. Okay, so this is what is the imbalance. So this imbalance is called as cardiac autonomic dysfunction. So why it is important to study this is, now we are in the present times, non-communicable disorders have become the leading cause of the death. Okay, so World Health Organization recently reports that the 80% of the annual deaths are due to non-communicable disorders. Non-communicable disorders means like diabetes, hypertension, heart disease, cancer. All these are the major leading causes of the death. Among these, heart disease is the leading one, most leading one. Okay, now when it comes to cardiac disease, the cardiac autonomic function is a very important marker that determines that how healthy the person's heart is. Okay, now this cardiac imbalance is associated with increase in the blood pressure, increase in the heart rate, increase in the contractility of the heart muscles. So that makes our heart tired, or that makes our heart work harder. So opposite to that, our heart fails to relax or come to its baseline because there is an imbalance in the autonomic nervous system. That is why it is important to look at this particular. Not only the heart disease, there are many risk factors of heart disease. That means the conditions which actually precipitate the heart disease, like hypertension, like diabetes. That means people who have hypertension have a higher risk of developing heart attack or stroke. Similarly for diabetes, similarly for hypothyroidism, obesity, metabolic disorders. So, okay, all these conditions, they put us in the risk of developing heart disease. And in all these risk factors, in all these disease conditions, the common thing found was the autonomic dysfunction. So their autonomic nervous system controlling the heart is not balanced. So there is increased sympathetic activity and reduced parasympathetic activity. That is what is commonly found in these conditions. That is why these patients develop ultimately the heart disease or the stroke or cardiovascular disorders in the long term. Now there are many measures of cardiac autonomic function. We can measure it in many ways. So I am quoting here three functions or three tests or three ways to measure cardiac autonomic function. They are heart rate variability, baroreflex sensitivity, and cardiac reactivity to stress. I am quoting these here because in yoga these are the three cardiac autonomic measures which are very widely studied. Now comes to yoga. So we have been listening since morning that yoga is not just asana. So it is something it is something beyond that. Okay. So when we take the Ashtanga Yoga of Patanjali Yoga Sutra, it does not talk only about the asana or pranayama or meditation. So it talks about the yama, niyama, pratyahara. These are the very important aspect of yoga. So yoga not only tell us that you practice meditation or asana or pranayama, it also emphasizes a healthy behavior, isn't it? So how to follow truthfulness, how to be with how to communicate with the other person, how to respect others. So also spiritual practice is also related to the practice of yoga. So it is not just the asana, pranayama and meditation. However, not only it is a perception of the public, but even the researchers are more interested in inquiring the effects of asana, pranayama, meditation only, isn't it? So there are very rare researches which has essentially looked into the whole aspect of the yoga, isn't it? So here I am quoting, so all these studies, they are related to only asana, pranayama and meditation aspect of the yoga is being tested. So this is the these are the evidence based results which shows that yoga, it penetrates almost all systems of the body. So when we practice yoga, so somebody practice yoga just to benefit or reduce the blood pressure, but yoga not only reduces the blood pressure, it also helps to improve lot of chemicals which are there, which are produced in the endocrine glands. It is not only helpful into reducing the blood pressure, it also helps in improving the fertility. It also helps in the improvement in the functioning of the digestive system. So this is how yoga is effective on almost all systems of the body. Okay. Now cardiac autonomic function. So as I said that we are going to discuss three major tests. They are the heart rate variability, baroreflex sensitivity and cardiac reactivity. So on all these measures, yoga is effective in terms of improving these tests. By looking at that, we can say that the yoga helps to balance the autonomic imbalance what we generally observe. So this autonomic nervous system, so we say that it is the we in the modern times we understand through the medicine, but if you go back to our classical texts, so Sora Yoga is one of the tests which is very old yoga test, which is almost about around 5,000 years back. So this text says that the right nostril breathing and left nostril breathing. So in this text, when we have a right nostril breathing, we should perform the activities which are related to our physical activity, dynamic exercise, studying. Okay, so such activities should be done when there is a right nostril dominant. Now when there is a left nostril dominant, we should do the activities which are relaxing or leisure activities like eating or listening to music or just relaxing. All these activities should be done when there is a left nostril dominant. So a study is being done taking this concept into consideration, and what that study showed is, so when people practice only right nostril breathing for a long time, their sympathetic activity goes up. That means, so if you practice right nostril breathing, the sympathetic activity will be more. If you practice left nostril breathing, the parasympathetic activity will be more. So alternate nostril breathing, it is balancing. This is sympatho-vagal balance. Okay. So this is how our rishis, they knew these nervous system activities, but their language was different and their assessments were different. They did not have a laboratories or highly sophisticated equipments, but their bodies and minds are their laboratories. Now we'll discuss about the yoga and HRV. So HRV is one of the very widely studied cardiac autonomic marker. Okay, just like if you So what is heart rate variability? Heart rate variability is beat to beat variation in the heart rate. So our heart beats, isn't it? So we measure heart rate. Heart rate is like 70 to 80 beats per minute. Now we have this heart rate, but in that 1 minute, the variation in beat to beat heartbeat is different. So you can see here that this is R wave. R is one beat, you can say, isn't it? So one between these two beats, here the time duration is 828 milliseconds. Now next it is not 828 milliseconds, it is 845 milliseconds. Next it is different. So this is called as variation, isn't it? So beat to beat variation in the heart is called as heart rate variability. Now if this heart rate variability is more, that is good is the heart condition. If this heart rate variability is less, that means it is not good, it is not a healthy sign of the heart. So what this heart rate variability measures is there is something called high frequency and low frequency measure of heart rate variability. High frequency is there is more variability between the heart rate. Okay, so if it is high frequency, it indicates that there is parasympathetic activity going on. If it is low frequency, that means there is sympathetic activity going on. Okay, now in order to have a optimal efficient cardiac functioning, we should have high parasympathetic activity and low sympathetic activity. Okay, so similarly there are other algorithms which there is something called time domain. So we measure the heart rate variability in terms of time. Okay, so duration. So duration and its root mean square is taken, and this algorithmic calculation is being done. So that is what is the other measures. I will not go deep into that. Now, what is the role of yoga in cardiac autonomic function? Okay, so yoga helps to increase the high frequency heart rate variability, and it reduces low frequency heart rate variability. That means yoga helps to makes your heart relax and makes it less stressed. Okay, so this is a study we did it in the 19 Hatha Yoga practitioners. These Hatha Yoga practitioners were long-term Hatha Yoga practitioners around 10 years. So this average Hatha Yoga the duration of the yoga practice was 10 years. So we compared them with the age gender matched control groups. So those who did not do yoga, and these 19 Hatha Yoga practitioners, they were doing yoga since last 10 years. So what we found is the yoga practitioners, they had higher high frequency heart rate variability. That means there is parasympathetic dominance in long-term yoga practitioners compared to the non-yoga practitioners. Okay. Similarly, long-term Sudarshan Kriya. So this is another study which is Sudarshan Kriya. I know, many of us, we know that Sudarshan Kriya is a breathing practices associated with the chanting, isn't it? So one cycle of Sudarshan Kriya is the slow breathing, then medium frequency breathing, and there is fast frequency breathing. So long Sudarshan Kriya is several cycles of this is continued. So it goes around 1 hour to 2 hours. Okay, so long Sudarshan Kriya, when somebody practices, what happens is the high frequency heart rate variability increases and the low frequency heart rate variability comes down. So high frequency Sudarshan Kriya increases the heart rate variability. Okay, now this is the meta-analysis of 17 studies. So these studies, it is including both Tai Chi and yoga. So in the 17 studies, 11 studies were related to yoga studies. So what this meta-analysis study showed is, so concluded that high frequency HRV is more prominent in the yoga group compared to the control groups. So you can see here the analysis of this meta-analysis. This is Hedges score, which is 3.5, 0.3 to 0.5, which shows that the medium to the low to medium effect of the yoga practice. So yoga practice, it is not exclusively on the yoga, it is pooling the yoga plus tai chi, both interventions. So what it shows is, all these studies indicate that the yoga practice helps to increase high frequency heart rate variability and reduce low frequency heart rate variability. This is another systematic systematic review. So systematic review is the reviewing all the randomized control trials, clinical trials which have been conducted in this particular area. So there were 12 randomized control trials which included 2,358 participants. This systematic review concluded is, all these studies suggest that yoga has a positive effect. That means it helps to increase high frequency heart rate variability and decrease low frequency heart rate variability. That means it is having a positive impact on the cardiac autonomic function. Similarly, as we discussed, the hypertension is another risk factor for cardiac disease. Okay, and hypertension is characterized by, that means the patients with hypertension have low heart rate variability. That means their high frequency HRV is low and the low frequency HRV is high. Okay, so that makes them vulnerable for developing heart disease. So in the hypertensive patients, the study is done where 40 in the yoga group, 40 in the control group. The yoga group patients, they practiced yoga for 12 weeks, and after 12 weeks what they found is, the patients, the hypertensive patients who practiced yoga, their heart rate variability was better compared to those who did not practice yoga. Not only that, their blood pressure also came down and their medication score is also reduced. So if a patient with hypertension practice yoga, their blood pressure comes down and their cardiac autonomic dysfunction or imbalance get improved, that becomes balanced, and it helps to reduce the medication score. The amount of medicine they required to maintain their blood pressure normal will also come down. Okay. Then yoga in depression. So this is another randomized control trial. So depression is one of the other condition where there is a cardiac autonomic dysfunction is very prevalently found. Okay, so patient with depression, they have low high frequency HRV and high low frequency HRV. That means there is increased sympathetic activity and decreased parasympathetic activity in patients with depression. Now when such patients practice yoga, what happens is the cardiac autonomic function becomes balanced. Okay, so high frequency or HRV increases and low frequency HRV decreases. So this is how yoga helps to reduce the cardiovascular disease risk in a patient with depression. This is another study in diabetes patients. So diabetes is another disease. So diabetes patients are more prone to develop heart disease compared to non-diabetes patients. And in the diabetes patient, the autonomic cardiac dysfunction is very commonly found. So in these patients, there is a study being done among 250 patients. So among these 125 patients, they followed yoga, and 125 patients, they were just taking the regular medications. Of course, the patients who were practicing yoga, they were also taking medications. So medicine plus yoga, other group was only medication. And they followed up for 6 months. So after 6 months, the cardiac autonomic function of patients with diabetes who practiced yoga improved compared to those who did not practice yoga. That means if a diabetes patient practices yoga, their cardiac autonomic function improves and their chances of getting the heart disease or cardiovascular disease will drastically reduces. Yoga in post-MI. So MI is myocardial infarction, that is a heart attack, what we generally call. So this is a study of 12-week study, so in which the patients who got heart disease, they were divided into two groups. One group practiced yoga and the other group is standard care. So these patients who were under the standard care, they were divided into two group, and one group practiced yoga, other group did not practice yoga. So after 12 weeks, the patients in the yoga group had better cardiac autonomic function compared to the non-yoga group.
Dr. Betri, you have to slightly.
Yes, sir. This is a Brahmari pranayama. This is also called as a humming pranayama, so where we just touch our tongue to the palate and we produce more sound with our closed lip. Okay, so this pranayama, so this is done in the university students, and the students were divided into two groups. The yoga group or the pranayama group students, they practice Brahmari pranayama for 6 months, and other group they just followed their daily routine. What they found is the students who practiced Brahmari pranayama, they had better HRV, or they had more parasympathetic activity compared to those who did not practice pranayama. So this is another study on mindfulness based practices, that means the meditation. So this is the meta-analysis on 19 studies on meditation, okay, so which included 1465 subjects. So in that, those who did meditation, so what this study essentially concludes is there is no significant change in the HRV. So that shows that if we practice only meditation, that may not have a very strong impact on our cardiac function, or a strong impact on our cardiac autonomic function. But if we do additionally pranayama plus asana, that will have a better impact on our cardiac autonomic function. So this is, I will just, and another important marker is the cardiac reactivity. Cardiac reactivity is, so throughout the day we face many situations. So sometimes we are relaxed, sometimes we are stressed. So cardiac reactivity is how your heart reacts when you are into stress. Okay, so this is how actually this is PNS is the parasympathetic nervous system, and this is sympathetic nervous system. Now when the person is in a relaxed state, the sympathetic activity is less and parasympathetic activity is more. Okay, so when we anticipate a stress, so when you are going to do some stressful task, or when you are going to meet a person who is difficult to handle, so what happens is your sympathetic activity gradually comes up and parasympathetic activity gradually goes down. Okay, now when you are actually doing that task, or when you are actually talking to that person, or when you are actually into stress, what happens is your sympathetic activity is very high and parasympathetic activity is very less. Now when we come out of that situation, what should happen? It should happen otherwise. So your parasympathetic activity should go up and sympathetic activity should come down. Okay, now what yoga does, yoga particularly helps in this condition, which is called as a recovery. So when you face a stress and when you come out of it, how faster your heart comes back to the normal state is important. So more prolong your time to recover, that means more chances that we develop the heart disease. So yoga helps to recover that. So these are the meta-analysis. This is a systematic review on 21 randomized controlled trials, which shows that the acute effects of yoga. So simply practice of just 5 minutes of pranayama or 1 hour of yoga session helps to improve parasympathetic activity and reduce sympathetic activity. Okay, so even the small yoga doing for a small duration can also have positive impact on our cardiac function. Okay, so yoga improves the faster recovery. So this is the study we did it in students, among the students who are having the anxiety issue. So nowadays the anxiety among the student is very high. Okay, so we did it is a preliminary study, so it is still going on. So we took 10 students who are having elevated anxiety, and we tested them their cardiac autonomic function when they are into stress. Into stress is just we gave them a mental task, so they have to subtract 17 from 1000 continuously for 5 minutes. So it is very stressful task, isn't it, when we actually do it. So what happens is, when we do that, the heart rate goes up and our heart rate variability, that means the high frequency or parasympathetic activity, comes down and sympathetic activity goes up. Okay, so what we found is, so we gave that task before and after the practice of 1 hour of yoga. Okay, so what we found is, so after 1 hour, so these two, there were significant difference. That means, so initially when they are anticipating the task, their parasympathetic activity was much better compared to the before yoga. So after yoga, that recovery phase also improves. So another one is the baroreflex sensitivity. So baroreflex sensitivity is our major blood vessels like aorta or carotid arteries. They have a sensors, stretch sensors. What they do, they continuously sense the variation in the blood pressure. So whenever blood pressure goes up, they send signals to the brain, and reciprocally what brain does is, brain reduces the heart rate, reduces the contractility of the heart, and brings down the blood pressure. So this is how the communication between the heart and brain happens. This is called as a baroreflex sensitivity, how efficient your stretch receptors to sense the change in the blood pressure and sends that message to your brain. Okay, now what happens when we do, yes, when we do yoga, the baroreflex sensitivity improves. Okay, so when person does perform yoga, the communication between the heart and brain improves. Okay, and they are able to bring down their blood pressure efficiently. So this is a study we did it in hypertensive patients. So hypertensive patient, this is the issue. So in hypertensive patients, what happens, the baroreflex sensitivity is very low, so their communication with the brain, heart brain communication is very poor. So when they do 1 week of yoga, so their baroreflex sensitivity improved significantly. Okay, so they were able to communicate that. Similarly, the slow breathing. So yoga, so essentially yoga helps in the improving the baroreflex sensitivity, improving the heart rate variability, and it also improves the cardiac reactivity to stress. So whenever we are into stress, so we have a daily so many stressful tasks. So person who does yoga, he deal those situations very efficiently compared to those who don't do yoga. Okay, thank you for patient listening.
Hello. Thank you, Dr. Kashinath, for giving such an elaborative talk on autonomic nervous system. Actually, we read for a long time that hypertension and diabetes is associated with autonomic dysfunction. And we always check for them in all the patients having hypertension or diabetes. But I just want to ask you what yoga says. Autonomic dysfunction cause the hypertension or diabetes, or diabetes cause the dysfunction of autonomic nervous?
So this is still association is there. So there is an association, but what causes what, it is still a question of debate. So it's not clear whether the egg is first or the hen is first, but there is definitely association. So number of number of hypertensive patients having the autonomic dysfunction more compared to those who don't have hypertension. Yes.
Okay, thank you so much. The topic is open for discussion.
So I get back to the same question that there are so many meta-analysis and these yoga might be different yoga, right?
Yes.
So is it that all yoga work through the same mechanism, or you need to evolve specific yoga? Because then it gets into the danger of anybody practicing anything, right? And then when you are having a regulated one where you have trained yoga practitioners also giving, for a public it is very difficult to discriminate which one you should go to. For example, even if I'm doing Prakriti and all for 20 years, I've come at this point of time as to how will I know what is suitable for me? Because my age might differ, my health status might differ, my Prakriti might be different. I might be having hypertensive
Or not
medicine,
having
anti-hypertensive medicine,
medications.
which
Yes.
are also working on the same one. And along with that, I am doing something which another person is doing for their autonomic modulation. How do you calibrate it, or how do you develop a standard for it?
Yes. So one thing is, I would like to say that in this particular area, so there is a lot of work going on, that for every disease there is a standardized yoga protocol is being made. Even there is a standardized yoga protocol for hypertension also. So considering the disease condition, so what asanas, what type of pranayama, what type of meditation a person should do is standardized, involving lot of yoga expert and all that. So this yoga module validation should be there. And in addition to that, I endorse Dr. Hemant's suggestion that we should develop apps, and these validated yoga modules should be put. And if the person is having a certain condition, if the person is having a diabetes, obesity, as well as the hypertension, so model should be different. And in that case, so personalized medicine is the answer. So where we should have a patient and clinician interaction, and he should decide that what practices a person with certain conditions should avoid and what he should focus more. So essentially, in order to improve cardiac autonomic functions, we should follow a general rule of yoga performing, like it should be very slow postures, and these postures should be associated with slow breathing, and also the person should go inside. He has to feel where the stretch is happening, and he has to feel his breath, and all that should be involved. I think that is a safe yoga practice.
Because when you showed so many meta-analysis, so
Yes.
how we really don't know how many of them did it in an appropriate manner, and how many of them might not have followed.
Yes.
So when we are kind of abstracting it or from those information, I'm just curious.
Yes,
Because
I
it
got
could
it.
also work from a generic perspective, like Ayurveda medicine. So many of them have flavonoids. So many of them could be modulating. So a baseline level of yoga might be good across all yogic postures.
Definitely.
So maybe we should actually do one thing when, irrespective of what yoga you do, this definitely happens.
Definitely.
Right?
Oh, yeah.
So we really don't know, and then which one actually does a little bit more than that, so that it could be tuned to something, and the other one not to be done.
Yes. So in that case, I would say that yoga is a emerging field, and so purpose of this meta-analysis is to see that whether any type of yoga, or we call it as a yoga, is effective or not. That is the only answer they wanted to find. So when it comes to particular yoga, so what particular yoga should be given to hypertensive, to diabetes, that should be a different study should happen, and there should be a meta-analysis studies and all that should, but it's still a long way to go in future, and definitely we will do it in near future, I would say.
Thank you, Dr. Kashinath. I think we should not increase the stress level of the next speaker now. So I advise all of you to interact with him later on. So thank you so much.
Thank you, sir.
And I along with my co-chair,
Just
thank you.
to add on to the question, sir, I just finished a study in CCRYN on hypertensives and normotensives. They react differently to different types of relaxation techniques. when you use instant relaxation technique like progressive muscle relaxation, in hypertension patient, in fact, the sympathetic tone goes up. Whereas when you do a relaxation using the breath awareness, the parasympathetic tone goes up. So they react differently to different types of interventions. That is the answer.
Yes.
Thank you, sir. I would request the chairpersons to kindly come in the center and please felicitate our speakers for the day. I would request Dr. Pramod Avti to kindly felicitate our chairpersons. Thank you, sir. Moving to the next session, we have our next chairperson with us. I would request Professor Reena Das. She is a professor and head in Department of Hematology, Department of Translational and Regenerative Medicine at PGI. Her expertise in the laboratory, hematology and molecular diagnostics. She has researcher of national and international reputes in thalassemia and hemoglobinopathies, molecular genetics of non-malignant conditions, prenatal diagnosis of hematological conditions. She has more than 280 publications. She has been awarded with J.C. Patel Award, Rama Roy Oration Award, Young Scientist Fellowship Award by the European Union in 2001. Malti Sate Oration Award. I welcome you, ma'am, and I request you to kindly introduce our next speaker for the session.
Thank you so much. So apart from the speaker getting high blood pressure, I think the chairperson was also getting high blood pressure looking at the watch. So we are running a bit late in this session, and I know that Professor Rima is an excellent speaker, and I didn't know that she also has interest in lifestyle disorders, which I came to know now. And we look forward to your talk. She has multiple awards, and we are looking forward to a great session. Thank you so much.
Thank you, ma'am. And I've been told to keep it short, so I'll focus on the main slides. So I would be talking to you today on yoga and its role in complex lifestyle diseases. So a brief overview, what I would focus on. Firstly, why did I choose this topic to the lifestyle diseases? Because we have shifted from an era where we had infectious diseases, and now we are living longer lives but not healthier lives. And because there is increased burden of these lifestyle diseases, these are complex diseases because they occur due to a complex interaction of genes and environment. And thus it's important to understand that because environment and lifestyle and our social habits, basically stress, anxiety, depression, sedentary lifestyle, alcohol, smoking, all lead to these complex lifestyle diseases, and therefore they are best managed by a lifestyle intervention, which is a mind, body, energy, medicine intervention, that is yoga. And I would like to tell you that we have shifted from this paradigm that we used to believe that the genes determine our destiny and that what we inherit from our parents causes the particular disease. And now we know that it's the environment and our lifestyle which actually determine our health and disease states. And therefore, if we practice healthy lifestyle, like for example, like yoga, we can actually switch on gene programs which are beneficial for us. And thus I'll show you today how yoga can really be very beneficial in the management of these complex lifestyle diseases. And these diseases touch most of us. For example, someone in our family is affected by cardiovascular disease, hypertension, stroke, Alzheimer's, unexplained male factor infertility, polycystic ovarian syndrome, or depression. And I'll talk of each of those disorders that we are working on. So I would just like to tell you that be it any complex lifestyle disease, they have some common underlying factors. These are like stress, anxiety, depression, inflammation, oxidative stress, accelerated aging, shorter telomeres, or there is an enhanced apoptosis, there is a dysregulated epigenome, there is hypothalamo-pituitary adrenal axis overactivity, and no modality in modern medicine can target each of those factors. And I'll show you during the course of this talk that be it any of these diseases, all these factors play a role, and how yoga is actually a polypill which targets each of these underlying factors. So why have these diseases increased? Because we have shifted from largely a hunter-gatherer society to a society which is largely sedentary. We are actually stimulated daily by media to have more, buy food from outside, which is highly processed, calorie-dense, nutritionally depleted food. And we are largely leading a totally sedentary lifestyle. And though we have several guidelines telling us that we should have less salt, be more physically active, yet we find that a large population, merely basically less than 2.5% Indians actually follow the WHO guidelines for maintaining physical activity about 150 minutes per week. And also we are as a nation moving towards a non-veg diet, which is very, very surprising, because WHO has actually shown us that red meat kills and processed meat kills faster. And still, despite those guidelines, we find a large population has actually shifted to a diet which is so unhealthy. So just giving you an example, because cancer is on the increase, we always blame our genes, but it's been shown clearly that a diet has a major role. So though we have some genes which are highly penetrant and mutation in those genes does cause the disease, but majority of the factors which are prevalent, which are the main drivers, are our unhealthy lifestyle. So it has been shown that spending on health to maintain health actually pushes such a large chunk of our population below the poverty line, and actually the pharma industry actually thrives on this, and therefore our whole system is actually dependent on managing disease rather than promoting health. And there's this landmark paper which actually shows you that healthy living is the best revenge. And therefore today I talk on yoga, which is actually the art of living. It's just not what we practice on the mat, but a whole lifestyle. For example, it's not only the asanas which we consider yoga to be synonymous with, but pranayam, dhyan, but also compassion, our day-to-day ethics, and how we behave with others and towards ourselves, our personal integrity. All these actually determine a yogic lifestyle. So the first thing that I would touch upon is male factor infertility, a problem which is really on the increase. It's been classified now as a lifestyle disease, and I would be talking on the male factor, which is largely ignored. So there are many causes of male factor infertility, but I touch upon unexplained male factor infertility, which is due to a host of lifestyle factors: exposure to endocrine disrupting chemicals like plasticizers, smoking, alcohol consumption, stress, psychological stress, then especially intake of non-veg food, which has so many anti-androgenic chemicals built into them, and also high levels of psychological stress. And this has led to a large chunk of our male population, and especially infertile couples, going in for test tube babies. And it's important to understand that the more we resort to this to have babies, the more the next generation is going to be dependent on this technique. And though God made us infertile, those couples infertile, because it did not want them to transmit such sperm with poor quality DNA, through these techniques, if there is a poor quality sperm with poor quality DNA, we are transmitting to the next generation. And it's been now shown beyond doubt that the sperm is the only cell in the body which is not able to correct the DNA damage that it accumulates over time. And as we delay the age of marriage and delay the age of having children, we are also increasing the level of oxidative DNA damage, and which is believed to be one of the root causes of increase in neuropsychiatric disorders and childhood cancers. So this is a study where we showed a huge number of factors actually leads to DNA damage, which is oxidative in nature. This oxidative DNA damage is not cleared by the sperm. The sperm's DNA repair mechanisms are silent. It depends upon the oocyte to clear the damage, but when the damage is extensive and you've delayed the age of marriage and delayed the age of having a child, the oocyte's quality to repair the damage is also suboptimal. And therefore, when the damage is extensive, it goes unchecked to the child. This has resulted in the concept of paternal origin of health and disease, in which you find that congenital malformations, childhood cancers, complex neuropsychiatric disorders, dominant genetic diseases, and imprinting defects majorly arise from the father. And our studies have shown that you can actually quantify the level of damage, and you can also quantify the type of damage. And here each dot represents the sperm DNA, and the ones towards the x-axis are the ones with the damaged DNA. You can see that they are high in cases of the infertile cases. And we've also quantified what is the cause of DNA damage, and this is one of the oxidative DNA adducts. Now, this oxidative DNA adduct, which is 8-hydroxy-2-deoxyguanosine, results in oxidative DNA damage. And this adduct actually induces de novo germline mutations and epimutations, and its levels build up with an unhealthy lifestyle like psychological stress, smoking, alcohol consumption. And so we find that there are fathers who have poor quality DNA, they have higher number of children with these cancers. And so we've seen that an unhealthy lifestyle leads to a buildup of this DNA, this oxidative DNA adduct. And this DNA adduct actually results in de novo germline mutations. And though for certain childhood cancers like retinoblastoma, which is one of the most common childhood cancers, we look for mutations in the retinoblastoma gene, which is a tumor suppressor gene. But it's been seen that there are a large number of children who do not have these mutations in this gene, and we found that in the fathers who had high levels of these oxidative DNA adducts, we did this targeted exome sequencing, and we find that in these children, when we got their retinal tissue, when the eye was enucleated, we find that there were mutations beyond the RB gene, that is the retinoblastoma gene. In addition to that, oxidative stress and oxidative DNA damage also not only damages the DNA, but it also dysregulates the epigenome. And therefore, it's been seen that the sperm, which is transmitting not only DNA, but also RNA at the time of fertilization, these dysregulated transcripts could actually result in impaired embryogenesis. So what does a doctor do when you have cases with sperm DNA damage? They prescribe to you antioxidants. And this is a double-blind randomized placebo-controlled trial that we did, and we've done it with a number of antioxidants, and we find that when you give antioxidants, majority of them at therapeutic doses do not have any effect on the sperm DNA because it's so tight, it's a crystalline toroid, it just improves the motility and morphology. So what is going to happen again when you use such poor quality sperm? It will result in having if their child is born, it may have many genetic and epigenetic defects. So now I would just focus on the impact of yoga on the sperm genome and epigenome. So these are some of the findings. We find that post-practice of yoga, in the group that practice yoga, there's a significant upregulation, increase in the total antioxidant capacity post-practice of yoga, whereas in the group that did not do, you find no change in the total antioxidant capacity. In addition to that, we also find that post-practice of yoga, there's a significant increase in the telomerase activity. It's been seen that sperm which are exposed to high levels of oxidative stress, they tend to age faster. They have shorter telomeres, and when those sperms are used for fertilization, they have impaired cleavage and blastocyst development. So you can see that when there's increased telomerase activity, increased total antioxidant capacity, so they have reduced oxidative stress exposure and therefore longer telomeres. We also find that there's a significant decline in the level of oxidative DNA adduct, showing that the damage experienced by the sperm is much lower, the oxidative DNA damage. In addition to that, by ELISA, we've also seen the global levels of 5-methylcytosine. We find that post-practice of yoga, there is an increase. So it's been seen that when there is oxidative stress, there is global hypomethylation, and the sperm genome is hypermutable because of exposure to the repetitive elements. And we also find a significant decline in the levels of 5-hydroxymethylcytosine. We also did this pilot study with Dr. Rakesh Mishra of CCMB, where we studied a large number of these markers, and we saw that yoga helped in the re-establishment of methylation marks, and especially there was hypomethylation of genes which promoted the formation of the cytoskeleton, which helped in spermatogenesis and spermiogenesis, and also increased expression of certain DNA repair genes. And so you can see that in these pictures, we have shown that if you practice yoga, even for 30 minutes on a regular basis, you can actually improve the quality of the sperm DNA. And no modern medicine drug can actually do it, except 1 or 2 now they have found, but majority of the drugs do not reach the DNA at therapeutic doses. And you can see that the number of sperms towards the x-axis have decreased, showing that there's an improvement in the sperm quality. In addition to that, we find that these people have such high levels of of stress comorbid depression, which declines with the practice of yoga. In addition to that, we've recently started the study on using yoga prime serum and studying the effect on cancer cell lines, because we've been seen that infertile couples have a heightened risk of developing cancers. And we find that the post practice of yoga, there's an enhanced apoptosis, and the other studies are still ongoing. So now I would just change gears and talk of one of the most common complex endocrine disorders affecting women. Approximately 1 in 4 girls and women are having polycystic ovarian syndrome. Now, it's a complex endocrinopathy, and though ovarian defect is said to be the main disorder, but there are several extra ovarian factors which are responsible for its pathogenesis. The most important thing is this is a disorder which is associated with moderate to severe depression. There is menstrual irregularities, infertility, there is anovulation or irregular menstrual cycles or oligovulation. And it's been seen that though the main treatment modality again in this is either to give anti-androgenic drugs to decrease the hyperandrogenism for hirsutism, or they give oral contraceptives to some to treat the infertility, and other drugs, or they give insulin sensitizing drugs. But as I told you, there are various extra ovarian factors which are neglected while management of this syndrome. For example, it's been shown that a heightened inflammatory response actually results in lower levels of certain steroid hormone binding globulins, because of which there is free circulating testosterone is higher. So even if you give anti-androgenic drugs, but the levels of steroid hormone binding globulin is lower, there would still be hirsutism because the free testosterone is higher. In addition to that, these people have also experienced oxidative stress, which is not managed in the current treatment. They have mitochondrial defects, and also they have there is hyperinsulinemia. So these are the results of our study, where we've shown that post-practice of yoga, there is a decrease in the oxidative stress, oxidative DNA damage, a significant decrease in the level of the inflammatory markers, an increase in the telomere length, an increase in mitochondrial copy number. In addition to that, we also studied a large number of genes which are key players whose expression is dysregulated post-practice of yoga, and we found that the levels of this insulin receptor levels expression goes up. Because of this, because it is low, you find there is hyperinsulinemia. The level of this insulin sensitizing PPAR by gamma also increases. We see again inflammatory genes, the expression goes down. In addition to that, we also studied a large number of microRNA which are regulating various genes. For example, the microRNA 128 actually regulates the expression of the granulosa cells, which are helping to maintain the quality of the oocyte. And we find that its expression actually is downregulated, because increased levels of this actually causes apoptosis of the granulosa cells. So post-practice of yoga, there is a downregulation. And similarly, for example, you find that 21 actually causes increase in TNF-alpha expression. Its expression goes down. So we also find that post-practice of yoga, there's a decrease in the severity of depression, and it's been directly correlated with the levels of testosterone. In addition to that, there's an improvement in the quality of life. We have also got metabolomics and lipidomics done in all these cases, but the data is awaited. So now I would just touch on the severe autoimmune disease, which is rheumatoid arthritis. Now, this is a severe crippling disorder because it not only targets your joints, but it also targets various other organs like the skin, the brain, the lungs, and the heart. And again, these are findings of a randomized controlled trial, which have shown that the disease activity score actually goes down post-practice of yoga. And why does that happen? It occurs because the levels of various interleukins, for example, interleukin 17, which is increased, actually goes down post-practice of yoga. And interleukin 17 is the one which actually targets your joints. Interleukin 6, which is responsible for the systemic effects, its expression levels also you can find they go down. The level of TNF-alpha goes down. And we've seen that even when there are insertion deletion polymorphisms in the HLA-G gene, because of which the HLA-G levels are lower, post-practice of yoga, the levels go up because of the hypomethylation of its promoter. In addition to that, the expression of anti-inflammatory gene goes up. So this is very important, that it is showing you that even when you have a heightened, dysregulated, exaggerated immune response, if you practice yoga, you can actually result in getting back to molecular remission and re-establishing immunological tolerance. In addition to that, as I told you, it could be any lifestyle disease. You have some common factors. So again, oxidative stress goes down, the total antioxidant capacity increases, and the level of oxidative DNA damage goes down. In addition to that, you can see that the subset of cells which are responsible for this immune response, dysregulated immune response, that is the helper 17 cells, their number goes down, whereas the regulatory cell number goes up. So we also found that in these cases there is oxidative stress. So we also studied the quality of the DNA, and we find that a large number of genes which are helping to maintain the mitochondrial integrity, their level goes up. In addition to that, the quality of life of these individuals increases post practice of yoga. So we also found that yoga, as I showed you, not only is targeting your nuclear DNA, but is also improving the mitochondrial DNA health, which is very important because this is the source and target of both free radicals. And when the mitochondrial integrity improves, it's going to result in fewer free radical productions and more ATP production, and thus will reduce the functional decline of various tissues. So now I would just talk of glaucoma, which is also known as Kala Motia. And you can see that in this disorder, it was initially believed that the only thing that they needed to reduce was the intraocular pressure. So most of the drugs were targeted at reducing the intraocular pressure, but recent studies showed that there were various risk factors which were modifiable and which could be treated. One was oxidative stress, inflammation, there were reduced levels of various neurotrophins, and a dysregulated blood flow to the retina. And post-practice of yoga, there was a decrease in the expression of the genes which were causing inflammation, upregulation of the anti-inflammatory genes, various levels of neurotrophic factors and antioxidant genes went up post practice of yoga. But again, I would like to highlight, in our study we have clearly shown that certain asanas should not be practiced when you have high intraocular pressure, like Kapalbhati, because they would increase your pressure, or do it very gently. So we have said that in this, when you have glaucoma or high blood pressure, you should just be doing nasal breathing very gently. We have also shown, there were studies which show that there is a decrease in the blood flow to the visual cortex in those cases with glaucoma, and our studies have shown that there is increase in brain oxygenation and BDNF level post practice of yoga. So now I would talk on depression, which is one, so in India has a large number of people with depression, and it's also been said there's been a 25% increase in the number of people suffering from depression post the epidemic. So this was a randomized controlled trial, and we've seen that post practice of yoga, there was a decline in the severity of depression in the group that practiced yoga. And the reason for that was that there was an increase in the expression of various factors which promote neuroplasticity, which builds emotional resilience. For example, the brain-derived neurotrophic factor. The most commonly sold drugs in the market are serotonin analogs, selective serotonin reuptake inhibitors. And it's been seen that if you practice yoga, the level of serotonin goes up. Melatonin, which is a key molecule to maintain your sleep-wake cycle, and also a potent antioxidant, its levels go up post-practice of yoga. So yoga is not only helping you to, it's not only useful for people with depression. I think each one of us should practice it, because not only is it going to help deal with stress better, but it will increase our concentration, attention, learning, and memory. And you can see that people with depression, they tend to age faster. They have 3 times faster rate of aging. So it's been seen that if you practice yoga, again, you can slow down your rate of aging, and there are some, again, common factors. And therefore, people with depression, they have an increased incidence of, higher incidence of lifestyle diseases, as well as earlier death. So you can prevent that if you practice yoga. And we've seen, whatever may be the genotype, the number of people experiencing remission post-practice of yoga was much higher than the group which was just on drugs alone. And there was improvement in all 4 domains of quality of life. So I would just like to sum up by telling you that yoga is an art of living, and it modulates the internal pharmacy by switching on gene programs which are beneficial for us. And it has tremendous transformative power because the changes in gene expression are very dynamic. They don't take long to occur. But the most important thing to remember is that yoga should be practiced on a daily basis, right? And how it brings about these changes is by influencing the epigenome. And not only is yoga beneficial for us because it's a way of living, it's beneficial for our planet's health equally. Because if we shift to a plant-based, whole plant-based diet, that will also help conserve water, reduce greenhouse emissions. And I think yoga is helpful for everything, not only for our health, but for the health of our planet. So it's our choice whether we adopt yoga or whether we, continue with the same way of life. But I think since now we are facing an epidemic of complex lifestyle diseases, and yoga is thus the answer. Thank you.
Thank you. This was an excellent talk. I think you covered so many different aspects and very beautifully so. I'll ask the audience to hold on to their questions because we'll have the questions at the time of the discussion that we're going to have in a little while. So
Sure.
thank you so much.
Thank you, ma'am.
Thank you, ma'am. I would request you to stay back. Kindly felicitate our speaker. I would request Dr. Aruna to kindly felicitate our chairperson. Thank you, ma'am. So we have come to the end. We have a last talk for the day. We have Dr. Raghavendra Rao here for the last session. I would request Dr. Akshay to kindly introduce the Rao sir.
Dr. Raghavendra doesn't need any introduction. He's not only a very good human being, but an active academician. He is the director of CCRYN, which is overseeing ministry's yoga wing in the Ministry of Ayush in Government of India. He's a graduate, I call him as a graduate of S. Vyasa, although he's also trained in SDM. He has his basic degree in BNYS, this is Bachelor of Naturopathy in Yogic Sciences, which provides a lot of clinical based training to a person that can combine clinical acumen with the yogic techniques and yoga philosophy, theory and research. He has also served HCG, one of the preeminent organization overseeing cancer therapy and cancer research in the country. And he's been involved in many activities in the country. And one more thing I want to say about you is that we were almost not certain that he will join us. He was supposed to be the plenary talk and to give it in the morning last evening. In fact, one day back, he was suddenly commissioned by the Ministry of Ayush to rush to Kerala to start a new center, and he was trying to troubleshoot that, and we were not sure he will join us. But in the evening, suddenly he probably found some early morning flight, 4:45 a.m. And thank you very much for making it. Allow me, Dr. Raghavendra, one more minute to let Dr. Sonu Goel and Dr. Kapil Goel to join my place so that they can we can introduce them briefly. And because they've been involved in many lifestyle related and community based services, I'm sorry to keep you waiting. Just a pause. Dr. Sonu Goel and Dr. Kapil Goel can join my place. Thank you.
So thank you, Dr. Akshay.
So we have chairperson for the session, Dr. Sonu Goyal and Dr. Kapil Goyal. Dr. Sonu Goyal is an associate, he's a professor in a community medicine and School of Public Health at PGI. He has been associate clinical professor in School of Medicine, Faculty of Education and Health Sciences, University of Limerick, Ireland. Honorary professor for Human and Health Sciences, Swenia University, UK. Technical support he has been providing for NRHM planning and implementation, state government advocacy, public health issues, translating research into policy and practice. He has been awarded with Young Researcher Award, IAPSM Ford Foundation, Harcharan Singh Oration Award, Vasudeva Oration Award, J.E. Park Oration Award, and had more than 260 publications. I welcome you, sir. We have Dr. Kapil Goyal. He's a former he's also an assistant professor in community medicine and School of Public Health at PGI. Former epidemic intelligence service officer at National Center for Disease Control, Delhi. He was former medical epidemiologist, senior medical consultant for Clean Cook Stove and Non-Communicable Disease Center for Disease Control and Prevention, New Delhi. Former medical epidemiologist, senior medical consultant and antimicrobial resistance, Public Health Institute, New Delhi. Public health professional for last 20 years, have many technical expertise and experience in the public health field, more than 70 publications. I welcome you, sir.
So thank you for the introduction. I think Professor Raghavendra has already been introduced, and I had an opportunity to meet him once 3 years back. I don't know whether sir remembers or not, but I think he's a great figure, and everybody here in this crowd recognizes him. So without taking much of the time, I invite him for the presentation.
Thank you, sir. And thank you, everybody. And I think it's been a very long day for you, so I won't take much time. So I'll try to keep it as short as possible. I'm going to skip some slides because I don't want to reiterate the same points which my previous speakers did. But I want to throw some light on some important points which are very important for taking yoga forward. So very importantly, we want to talk about health and definition. I will not go into all these things. I'm going to just talk about some aspects about evidence for yoga as a therapy. So this is a small story I want to talk about. How did yoga evolve as a therapy? It's very interesting, because yoga was used for maintaining fitness, to calm the mind, to develop the start of sadhana or spirituality for higher spiritual pursuits. But how did it start as a therapy? And thanks to this particular gentleman, Sri Madhav Das ji. He was a great saint, emerged from West Bengal, traveled all over India and spread the message of yoga. And there he started talking about yoga, how can yoga be used to maintain health and maintain longevity. He himself was a very great yogi. And he inspired many great yogis who are his disciples who founded the yoga institutions. And this great man settled down in Thane, and while doing so, he had a very good disciple called Swami Yogendra ji, who founded the Yoga Institute at Santa Cruz in Mumbai. Okay, and this is a pioneering yoga institute, the first yoga institute to start yoga as a therapy. Okay, it was very early in the 1910s and 1920s. And from here, there were two disciples of Madhav Das ji. One was Sri Yogendra ji, and the second one was I don't know what's happening to this. Okay, Swami Kovalananda ji in 1883 and 1966. I don't know why my pictures are not shown here. Okay. What's gone wrong with this PPT? Somebody can just check it out. Yeah, I can see the. No, I think there's some problem in your computer here. And the one which got loaded, I think there's some problem. I didn't bring my pen drive. Internet is working? Can you just take it out from the mail, please, if possible? Just check all the. I think there's no figures in any of these slides. I don't know. I think. Just check the mail directly, can play from the mail, I think, so from the drive. I'm sorry about the small glitch. Okay, come here, but afterwards it's not showing. I think this convert this PPT into PDF, it becomes easier. I think you can do without slides also, okay? Fine? So, doesn't matter with the pictures, you can imagine people there, okay? So I'll go ahead, let's not waste time. So, the first research institute was established in 1924, which is also all of you know as a popular institute called Kaivila Dham in Lonavala in Pune. And there the first experiments was done by Swami Kolyananda by using a drum chymograph, a spirometer, just like a spirometers. We didn't have spirometers during those times. So he did a lot of work about respiratory pattern during different types of Kumbhaka pranayama. Okay, so different types of Kumbhaka pranayama he did use, and he did a lot of work on the respiratory patterns of this. And he also brought out the first yoga journal called Yoga Vimamsa in 1924. The first journal was brought about during this time. And if you look at this very important insight which happened during those times in the 1920s were, we had a lot of siddhis. We had a lot of yoga saints who had a lot of psychic powers, you know. They could bend a spoon, they could move objects, okay, they could levitate, okay, and they could even change the temperature among the digits in different fingers. A lot of things they could do. And one such yogi was Swami Satyamurti, Yogi Satyamurti, and he was able to go under samadhi. So what they did was, it happened with Dr. B.K. Anand, who was there in All India Institute of Medical Sciences in New Delhi. So what he did was, he put this yogi under a pit. He dug a pit about 8 feet deep. He put that yogi in that box, completely contained blocks, which has. Yeah, you have this. This is a different one. Not this slide. This is another. This is not this slide. So one more thing which I sent over.
It is in the pen drive.
I don't know if you're loaded in the pen drive or not.
If it is in this pen drive.
I don't know, some problem.
If it is from the pen drive, the image might not be seen. If you transfer it to desktop, then you will be able to maybe see.
You're playing it from pen drive only, yeah?
HP वाला. If it is this pen drive, तो देना ना.
नहीं ये है पेन ड्राइव कौन सा स्मॉल
नहीं,
पेन ड्राइव
कहाँ पे है?
ये वाला pen drive मुझे दे दीजिए आप निकाल के ना इसमें.
हमें सही जगह कॉपी
तो पेन ड्राइव नहीं कर दिया
पेन ड्राइव ही कर दिया ना, इसलिए हो गया, इसलिए कॉपी
नहीं सर डेस्कटॉप पे
डेस्कटॉप पे डालते हैं
वही पेन ड्राइव से चल रहा था ना सर
कम डाल
No, mine was this one, copy करो.
Scan it.
सर अब तो ये ड्राइव इसमें है ना डेस्कटॉप पे आपको जाएगा
Scan. PowerPoint can't do.
Don't repair. Don't repair. It will go away. That's what happened now. Go down. नीचे जाओ. इसको PDF में कन्वर्ट करो यार, इजी हो जाएगा. देखो यही बोल रहा है. इसको ओपन करके ऐसे PDF में कन्वर्ट करो. हाँ, बेटर. Don't worry.
मेल किया क्या सर? We have to download it sir again and then do it.
Yeah,
नेट चलेगा?
नेट है क्या इसमें?
इसमें कनेक्ट करो ना, हॉटस्पॉट कनेक्ट करो.
अब दे दो, एक्सेप्ट मैं करता हूँ अभी. शेयर कर दिया मैंने आपको, देखिए. एविडेंस है.
Everyone, please note, till we get done with this, there are few announcements to be done. There is no tea session will be held. We'll have a high tea at the end directly. So before that, we have a brighter mind activity. Please keep your phone silent. Will be followed by with panel discussion and inauguration directly before the chief guest arrives. So please keep your phones in the silent mode.
Sir, I think you are going very good extempore.
I think I'll do that, sir.
Yeah.
I'll go ahead with that. Don't worry. Can I just put it on? Yeah, I know the sequence of the slides. Repair करो. Okay. Now, wait. There is a problem in the original file. Okay, doesn't matter. So this what has happened was in this the Yogi Satyamurti was put in a box, closed box, no oxygen, nothing. Okay, with ECG leads connected to his chest, and he was put in that pit for about 5 days. 5th day, his heart rate went up to 360 per minute, and suddenly it stopped for 5 minutes almost, and again resurfaced back once again. Okay, then they decided to remove him from there, and this is what happened. So this is a very important thing. This came published in American Heart Journal, a very big journal during those times in 1970s. This is one of the first instances of this, and this was followed by various other yogis who started doing a lot of things. I think all the pictures have gone. I don't know what's the reason. Okay, the main yogis were that because of this particular thing, scientists started coming to India. There was one Bakshi and Wenger, Elmer and Green, Alice Green. So these people, they all came, they toured all of India, they met various Swamijis, various yogis, and did a lot of neurophysiological tests on them, looking at EEG, looking at heart rate variability, looking at atrial flutters. There are some yogis who could create atrial flutters up to 360 beats per minute at will, and bring down the pulse rate to 40 per minute at will. People who could perspire at minus 30 degrees centigrade. Okay, at minus degree centigrade in the middle of snow, Swami Rama could perspire on his forehead. He could create 10-degree difference between 2 digits of his fingers. All this was possible during that time. So they thought yoga can do a lot of things and change somebody's physiology. You can have superhuman powers with yoga. Okay, and that started gaining a lot of interest in yoga as a therapy that time. It can be used for changing somebody's diseases or curing some illness as well. But Maheshwari Yogi also went down to US. He changed the concept of yoga there. He brought in the transcendental meditation. He said that yoga is not just for the great yogis or sannyasis here, it is also for the common man. So he started showing, okay, yeah, this is working out fine. Good, thank you. So these are my slides. Okay, this is what you can see about Swami Rama doing in minus 30 degrees, you can see him perspiring, and you can see the change in the temperature about 10 degrees centigrade, creating an atrial flutter about 360 per minute, okay, and then bringing down the pulse at will, okay, and this is Maheshwari Yogi who tried talking about transcendental meditation. He said even for the common man you can use yoga. So he started devising the TM technique, which became very famous in the 1970s, and that's also the reason why yoga is different, meditation is different. He propounded meditation, meditative traditions in the Western countries, and that's why though in the yoga philosophical texts, Patanjali Yoga Sutras, we say meditation is a part of yoga, it's the 7th limb of yoga, dhyana, right? But in Western countries, meditation became very popular during those times. That's why yoga and meditation we call it as, okay? They looked at yoga as only a part of asana or whatever it is, but meditation was more popular during those times. And a lot of work was done on children, on laypersons, where it can improve skin conductance, reduce anxiety, improve sleep patterns, improve attention span, improve memory. A lot of neuropsychological tests were done on children and laypersons using meditation during that times. On the first trial on yoga as a therapy, the first landmark trial was by Chandra Patel et al. Was published in Lancet on hypertension in 1975 in UK from NHS. This is the first trial which they showed very conclusively that yoga can be used in managing primary hypertension.
Okay, it's RCT published in Lancet. And a lot of meta-analysis came later on, and they showed that 107 studies are there now on RCTs, 17 RCTs are there on this thing, meditation, which shows very, very useful effect of yoga, especially in managing, meditation, transcendental meditation, managing hypertension. Okay, so this got a lot of steam in 1970s, and this is what I said, Chandra Patil, the Lancet was there, followed by another study by Dr. Narada et al., which was published in BMJ in 1985 on yoga for bronchial asthma. Okay, after this, a lot of studies started coming up in diabetes, in metabolic syndrome, arthritis, hypertension, etc., and you started getting meta-analysis as well. Okay, and some of these studies were done in studies were done in SUASA, were done in JIPMER, was done in NIMHANS, was done in AIMS in Delhi. Okay, and a little bit of, and also in Kaviladam. Apart from that, we never had those many centers during those times in 1980s or 90s to do studies. So yoga was done in small silos, and later on you could see that a lot of studies have been happening up, and a lot of studies are now happening in the Western countries compared to India. Okay, and you see the 49 clinical trials on heart disease, and you can see yoga meditation is now a part of the guideline document in patients with bypass surgeries. Okay, or patients following angioplasty. Okay, and it's going to improve cardiorespiratory effort in people with atrial fibrillation as well. So why I'm saying this is very important is, doing a research, getting a result is not just important. You need to have the right kind of result with the right level 1 evidence, which can get into a guideline document where patients can be benefited. The research can translate into practice. This is what is required. Okay, and to do that, you require to have robust clinical trials and good level 1 evidence from there. And you can see with respect to RCTs in cancer, 141 clinical trials are there to date, and they already gone. The cancer is one popular area which has gone into the guideline documents than any other specialty. I started my work in 1998 on oncology, and I still remember those days. People used to laugh when I say do yoga for cancer patients. My patients can't do yoga. Their perception of yoga was a headstand poster for them. You know, doing a Shirshasana is what is yoga for them, for most of the doctors during those times. And they said, I won't allow my patient to do yoga. They are very sick, you can't do yoga with them, you are playing with them. And some people used to also make joke. They should send me to ICU and took me to a patient who was in sepsis and coma and asked them to do yoga. So I told the same anesthetist who was there that day, who was making fun of me, you make her talk or speak to me, I'll teach her yoga, I told her. Okay, so these are the kind of things which is going on. But later on, if you see today, maximum number of research evidence, level 1 evidence is there in the sector of oncology, be it with management of nausea, vomiting, be it with the management of fatigue, anxiety or sleep disorders or distress in patients. So all these have found into their guideline documents in NCCN, ASCO, SIO. I've been also part of one of the guideline documents where our studies have been quoted in them. Trials on yoga for low back pain, you can see 58 clinical trials are there. Reduction in back pain, disability from back pain, improve muscle strength, improve flexibility. Unfortunately, if you look at Cochrane review, evidence is not conclusive. Okay, so when you look at again from publication in India for only 2 clinical trials, especially on PCOS, landmark trials for ascetics in yoga. There are 40 clinical trials in pregnancy and antenatal care, on 6 clinical trials on epilepsy, and there are about 234 clinical trials on depression, the highest one, the largest number of trials you can see on them. It can reduce depressive symptoms in comparison to antidepressants, and improves neurotrophic effects with yoga, but still it's not found its way into the guideline document. Still, if you look at Cochrane review, it just tells you a mild maybe possibility is there, that's all. Okay, and landmark outcomes, again, if you look at diabetes, 49 clinical trials, supposed to bring good glycemic control, better adherence to healthy and lifestyle behaviors is what is found with respect to diabetes. But again, it's not come into a guideline document. Okay, traditional clinical trials on obesity here. Again, regular yoga increases BMR, helps with weight loss, improves fitness, and reduces eating disorders in obese population. But again, if you look at Cochrane review, you don't get pretty conclusive evidence on this. So what is happening with all these publications? You look at only RCTs here. Today, if you see 0 to 2 impact factor about yoga, you have 59 of studies, 161 of them in meditation. 2 to 4 impact factor, 377 in meditation, 524 in yoga. 5 to 6, 140 and 188. So as you grow with higher impact factor, above 8, high impact factor is any impact factor, any publication in a journal with impact factor above 8 is considered to be high impact factor. The number of articles will just come down. Okay, indicating the nature of your studies. Very, very small studies, small sample sizes, mostly hypothesis generating studies, not hypothesis proving studies. So these are the problems with respect to the yoga research today. So what you see in current trends of yoga research, we know all these areas. I want to reiterate this. In all these areas, you find papers on yoga and meditation. Okay, basically it is to do with inactivity, sedentary lifestyle, it is to do with stress, it is to do with hypernutrition. These three are important aspects of any of these lifestyle disorders, and yoga or yoga interventions help in correcting those. So what is important, if you see the number of evidence here, number of publications on yoga and meditation on PubMed, 8,070 articles are there on you use the keyword yoga. About 9,911 articles are there when you use the keyword meditation, and both of them are increasing. You can see them, right? They're just going up, right? But if you see the number of level 1 evidence here, it is very, very less. Okay, and here you look at total publications up to 2014 what happened, and after 2014 what happened. Why I'm saying 2014? Anybody has idea why I'm taking cutoff as 20? Exactly, International Day of Yoga was commemorated in 2014 by UN declaration in November, and 2015 onwards we had the first IDY, and since then yoga has become very, very popular and globally, right? So till that time, if you see number of articles, publications on PubMed was 2,934, but for the last 8 years, 5,177, huge number, double, right? Same in meditation as well, 4,051 till 2014, means these publications date back to 1948 to 2014 I'm talking about. So much publication, but now you see almost double the same thing in the last 8 years. Very huge, right? And if you look at research publications in yoga and you break them down, see what is happening here, number of clinical trials, what is happening up to 2014, and after 2014 what is happening, randomized controlled trials, what is happening, systematic reviews are increased more, so you have more number of systematic reviews, more meta-analysis in the last 8 years, right? The same way with respect to meditation also. So I broke them down to both yoga and meditation separately, and this is what you're seeing. These are figures you're seeing that these are improving over time. Okay, and total increase in percentage of publications in yoga, if you see, total increase in yoga publications is 76% increase after 2014, 39% increase in clinical trials, 77% increase in RCTs, 21% increase in systematic reviews, 300% increase in meta-analysis. So a lot of systematic reviews and meta-analysis are coming out in the last decade or so. The same thing with meditation also, similar trend you can see in meditation as well. Okay, but here is a catch. When you start slicing and dicing the data here and then looking at it, so up to 2014, percentage of the clinical trials among all the publications was just 12% in yoga, and 2015 to 2023 again it was just 12.25% only, no change. So to say only 12 publications out of every 100 publications are RCTs, remaining all are crap. I mean use this word crap. The reason means you have opinion pieces, editorials, you have observational studies, you have everything, but they're not leading anywhere. Because when you want to consider RCTs as a gold standard, when you want to consider RCTs to have a level 1 evidence, and when you're only doing less of those and more of other things, it doesn't make sense, right? This is what is happening today. Even today, if you see, between 2015 to 2023 or up to 2014, it doesn't change at all. It is same thing. Same thing with meditation also, only 9%. RCTs are just only 11%. But you see, meta-analysis has increased, systematic reviews have increased. Okay, so but they're not. There's no meaning, because these are done on the studies which are already published earlier, right? They're not adding to the knowledge at all. You're just trying to see whether they're really useful or not. Rather than doing that, we need to do something else. Okay. So if you look at country-wise in India with respect to trials on yoga, we have about 49% is from India, followed by 27% from USA. Okay, and if you look at meditation, it's different. 6% from India, but 40% from USA. Okay, it is more in USA. Meditative traditions are more caught up in US as compared to India here. Here we talk more of yoga here. There they talk more of meditation. And if you look at trials in Cochrane Library, 20 or 50 on yoga, 26 on meditation. Protocols, 7 on yoga, 1 on meditation. Library, if you see, look at registered trials, 3965 are there. Health system evidence, 6 of them are there, and 9 of them are there for meditation. So they are very, very less. Okay. So what is summary here is lack of RCTs, only 12%. Okay, so 1 in every 10 publications are RCTs. So multicentric RCTs for level 1 evidence is even lesser. Hardly you get multicentric trials. If I put multicentric among RCT, it will come 1/10 of the RCT again. Okay. So repetitive meta-analysis and reviews. And if you see meta-analysis and reviews, there is no end to it. If you look at low back pain, you have 16 meta-analysis. You look at heart disease, hypertension, you have about 33 meta-analysis. Why everybody is doing meta-analysis here? What is the use of it? The same study, slicing and dicing the data, putting some opinion, you're giving your own angle to the data, your own conclusion to the data. It's of no use. Why waste your time on meta-analysis and systematic reviews? Okay, all these meta-analysis contain small pilot studies. And at the end of the meta-analysis, you say more evidence is needed. You look at all the meta-analysis. However, more evidence is needed to just tell that why you want to publish a paper, right? You're not adding any knowledge at all. So rather than spending more, and also you have more journals now. So initially when I started the yoga study research in 1990s, you didn't even have any yoga journal. Okay, today we have over 16 yoga journals, right? So more of them want to publish papers, you write systematic reviews because you don't have money or funds for doing RCTs. So a researcher wants to do some study, first thing they do when they go to a particular center is write review, write a meta-analysis, write an opinion piece, write an editorial. Okay, but that doesn't add anything or any value to the science of yoga. So only way if you do this is to collaborate between yoga institutes and the scientific institutes like PGI, Chandigarh, AIMS, or whatnot, and all other medical teaching hospitals, etc. You don't do things in silos. Medical teaching institute want to do yoga, they don't know whether they are doing right yoga or not. They bring up their own data, right? And sometimes this data is refuted by the yoga institutions. So it's important that both of them come together, harness the knowledge of yoga from the yoga institutes, harness the science from the medical institutes, and do a very good research study. That's where that's when the clinical protocol can translate into practice. That's important. Then you have BMS and MD in yoga, and people are there, clinical part of clinical training in yoga is already there. And sadly, many of them are not using them. So you have people from diverse backgrounds, from BCom, arts, political science, coming and doing yoga. When you already have clinical doctors in yoga who are already specialized in this, who can do the work better here in the yoga sector. RCTs and large multicentric studies have to be done, and clinical outcome studies have to be carried out, not opinion pieces. Center like CMBI here, we have started this in PGI, we have started one in AIMS Raipur and AIMS Rishikesh, and very good trials are going on. And we are very happy with these trials which is going on in this. And the reason for doing this is to bring the synergy of that interaction and the integration of yoga into cancer or onto any care for that matter. So we brought out a book on handbook for managing frozen shoulder in the AIMS Rishikesh. The team did this work, and the study is going on frozen shoulder for using a yoga module, particular yoga module. Similarly, we are doing some yoga module for BMTs. We are doing something for tinnitus. We are doing for heart disease. Okay, so a lot of work is going on in different sectors, and that clinical specialty and that kind of patient population is only in this particular thing. You will not have a patient with heart failure. Patient will not go to a yoga institute. They will go to a cardiologist. So you will have to work with a cardiologist to see whether your yoga module is going to work or not. And this is what is very, very important. Meeting of minds is important, collaboration is important, networking is important, and large multicentric studies. These are the ones which can clinch. Unfortunately, in our country, all the funding agencies give grants up to 30 to 40 lakh or 60 lakhs maximum. It's not enough to do even a single center study also. Not enough at all. You look at NCI grants. I am a recipient of several NCI awards, 2 R21 grants, each $4 million. One R1 grant is around $10 million. That's a big, huge kind of money which is there, and this R1 grant was done among 17 centers, 17 CCOP centers of MD Anderson Cancer Center across US. So that's a big kind of money which has been put, and that gave level 1 evidence for using the first phase 3 trial on yoga for breast cancer survivors, especially those undergoing adjuvant radiotherapy. Okay, that's the kind of money which has to go into yoga research. If we don't put money into multicentric studies, and if different institutions don't come together, everybody has got their own idea, right? Many of them are doing, I see depression, when I start reviewing some of the grant funding agents from the funding agencies like in DST Satyam or even for that matter in Ayush, we see 3 or 4 institutions putting a similar kind of proposal on the same topic. Why can't they come together? Do it as a multicentric study. So you divide the amount among them and do it as a larger study, multicentric study. Why to do it in silos? Okay, we are doing in silos, but these silos need to be networked now. So if we can do that, and if funding agencies also change their policy and come together in supporting these multicentric trials, then we'll become number one in the country. Today, 40% of the research publications are in US, from US. We just give around 21% of the research publications are from India, half of it. Okay, and those 40% which is there from US, most of them also are in high impact journals, but very few from India are in high impact journals. So this has to change. Okay, and for that to happen, the environment, the policy, the thinking process has to change. And I hope I did a little bit of justice, and sorry for the bad slides. Thank you so much.
You have very beautifully described the various evidence-based therapy in different areas like cardiology, neurology, and all. Thank you.
Thank you, sir.
So, thank you, Professor Rao, for such a insightful presentation. I think my co-chair has rightly pointed out that we have shown the evidence which is there, but we have also shown that there are some lacunas in the current research environment in the country and overall, which are inhibiting factors for conducting the research. So I think there are few points which we can take forward from here, your presentation. One thing is, like, you have systematic reviews and meta-analysis, but I have not seen any umbrella review. If here all those systematic review can be compiled in form of an umbrella review, that can form one good piece of evidence from all the systematic reviews and meta-analysis which have been there, and that doesn't require much funding. So second point is, I think you have rightly pointed out about the collaboration, because when we talk about various yoga centers in different big institute, and if we collaborate, we have a larger sample size and the chance of publications are quite higher. So I think it's the right time to collaborate with people. I know that Dr. Akshay and the team has been collaborating, but collaborating in a big way, in big sample size, big research on one or two topics, which will generate evidence and which will help us in publication in good impact factor journal, which you are talking about, and especially on the randomized control trial. And very rightly pointed out that just 12% in randomized control trial, I think we need to increase those to convince the policymakers to do more on the yoga. So I think it's a continuous spiral which we can work upon. So thank you for your insightful talk, and in case any burning question is there from anyone in the panel discussion. Okay, we'll be having a panel discussion, so we'll be asking the questions there. So thank you, Professor Rao, for an excellent presentation.
Thank you, sir. I would request the chairpersons to kindly come to the stage and felicitate our speaker. I would request Dr. Akshay to please kindly felicitate our chairpersons. Thank you, sir. So we have an activity by the Brighter Minds, which is it's an organized by Shahina Gupta. She's an cognitive coach and trainer. A unique whole brain wellness program, which is developed by the experts of neuroscience, child health and development, public health, technology, marketing, media, and communication. The objectives of this Brighter Minds are passion for learning, search for the balance in developing the mind, body, and spirit, explore the science behind it, share it with the next generation. She is representing the Chandigarh Center, Brighter Mind Learning Center in Panchkula. I welcome you, ma'am.
Thank you. Thank you. Can you play the folder? No, up. Yeah, that's it. I'll just change it. Good evening, esteemed brothers and sisters, and a heartful welcome to the experts in science, yoga, and medicine. I am deeply grateful for this opportunity to introduce Brighter Minds, a program dedicated to nurturing young minds. Brighter Mind is an educational initiative crafted to cultivate children's observational skills and cognitive abilities. Based on the science of neuroplasticity, this 30-hour program utilizes a suite of interventions like breathing exercises, brain gym, and certain breathing and eyeball exercises. Yeah. Oh, thank you. So the goal is to create an engaging and a joyous learning atmosphere, enhancing the brain cognitive function. Throughout this interactive session, I, Shahina, a facilitator at Brighter Minds, together with my young, soulful children, come, Harshita, Arahi, Anika, and little Parth. Come. They're joining us for an interactive session today. So I request everyone with an open mind and an open heart together to explore how these methods can empower and enrich the young minds of our future generations. So please get ready for this experience where you are going to experience an unexpected and unlock incredible potentials. So can we have a round of applause for our little angels? So I would love the audience to participate with us in this session and encourage our young minds. So in this first exercise, we are going to do a simple breathing exercise wherein we will inhale and exhale. So let's correct our postures first. Thank you. So we will inhale slowly and deeply and exhale. One more time. Inhale and exhale. Now we'll come to a little challenging exercises which we call the brain gym. And I want audience participation here again. So we'll start with the first exercise. The children, we show you the exercises. We'll start with both our hands. Can we have the audience? I want an active audience. We've been sitting on the chairs all day. So we'll join our hands as if we are holding a ball. We'll join all the fingers together, and one by one, we will rotate. We'll rotate the thumb first in clockwise and then anti-clockwise. Parth, you can keep checking the audience if they're doing it right. Second, the index finger, we rotate it in clockwise and anti-clockwise. We have a beautiful audience and they know the exercise so well. I'm so happy. And the third, the middle finger, we again rotate it clockwise and anti-clockwise. Wonderful. Audience, you can smile. You're doing a wonderful job. I don't need to check anyone. And then we go to the difficult finger, which is the anamika finger or the ring finger. We rotate. You might find it a little difficult. This is where, so you can touch it and do. You can touch the fingers and clockwise and anti-clockwise. Part check. Yes, ma'am is doing it beautifully. Sir is doing it wonderfully. Oh, he's doing the anamika finger so well. That's a challenge. And now at last, the little finger. Clockwise and anti-clockwise. Can we have a round of applause for a wonderful audience? So you don't need any training. You're doing it so well already. So we'll go to the next challenging exercise. Since you can do the first exercise so well, we'll give you a little difficult one. In this, we'll stretch our hands outside. And we'll start with the right hand. In the right hand, we'll use the index and the middle finger. Yes. And in the left hand, we will close the thumb, the index finger. The other two fingers remain open. In the other hand, sir. So, in the left hand, you close your thumb, your index finger, stays up, the ring finger stays up, and the last little finger closes. And we switch. Come on, audience. We can do it. Let's do it slowly. Yes, we switch it. We switch on bulbs and lights. So can you do it, Anika? Fast, Anika. Thank you so much. So the audience is so sweet, we cannot leave them like this, right? Audience is wonderful. So we'll give you one very easy one. So we'll stretch, we'll open both our hands. This is a little exercise. All day we've been sitting. Breathe in, breathe out. First hand, just the pointing finger. The other hand, all 5 fingers. And we'll simply switch. This is easy. See, here my audience is going well. We can do that fast. First. Close your thumb. First. See, you just stretch. Sir, this. Sir, 1. You close your thumb also, sir. Sir, look at your fingers. And then this. Wonderful audience. I hope you'll be doing the next activity in a few days' time. So the kids are going to now demonstrate a few blindfold exercises which will show you cognition at the next level. So through stimulation and sensory augmentation, these activities happen. So these children will be tying these blindfolds and will be doing certain activities. So I request 3 people from the audience to come and help us volunteer. I already see a few hands raised. So for the front benches also, I want a few hands raised. Please, sister, please come. Sister, you. And one brother. Thank you. Please come on the stage. Sister, can we have your names once?
Alyssa.
Can you give us
Alyssa.
Alyssa, sister, you come with Anika.
Kavita.
Kavita, sister, you come with sister Harshita.
Hemant.
Brother Hemant, you come with us with the little angel, Arahi.
She's trying the blindfold.
So you can check, sister, if the blindfolds are perfectly okay, if they are opaque or transparent. Anything from the down, sister? Anything when you lift your nose up, any light? We have a foam in the blindfold as well. And sister, when you tie the blindfold, please ask if it's too tight or too loose. And the foam part comes on the lower part. So brother, by that time you can just check the balls if they are marked or if there are any textures in the balls. Brother already is aware about the... So sister here is checking the cards. Sister, can you check these cards are marked or anything, any texture on it? So these kids will be using 5 sensory augmentations, the 5 senses, the touch, the smell, the hearing power, the intuition, and the sense of smell. So all these will help them and guide them to recognize the colors, the numbers. So
this is the card.
can you face it towards the audience, Anika?
Should I flip it?
Yes. So quiet audience, quiet, okay? So she's doing the first step. Brother, you can hand over 1 ball each to the child. So this is the first step wherein she's touching, the sense of touch. Now she's going to the second step, which is the step of sense of smell. And third step, Anika is really fast. She's already reached third step. And fourth. So these are the tickle spots also, we can say that, where we feel and perceive things.
This is a card with a red background and a number 7.
Can we have a round? Arahi, if you're ready, you can raise your hand. So we can have the mic towards Arahi.
It is a blue color of ball.
Arahi is just 5.5 years old. So I'll request the audience to write a 3-letter word for Anika and fold the paper. I'll just give the things to you. And also, I'll give it to you. I have it.
Is it green?
Can we have a round of applause? Sister, you give it to Anika. Come, Harshita, come down. You can stay there. You can check the blindfolds. So there are a set of intervention that we use, and blindfold is a very scientific instrument that with the children do. There's nothing magic or anything like that in this. We use the science of neuroplasticity here, and secondly, there is a joy of the environment, which we also say epigenetics, which works with these kids. And there is a research music which we during the training play with the children, which helps in the brain wave and ECG.
This word is a sun in the color green.
Wow. Can you show it, sister? Can you open it? Give it to Auntie Anika.
He's showing. Okay, show. He's also put it in the right direction.
It is green color.
Very nice. Do you feel anything else, Arahi? Do you feel?
Yes.
What do you feel, darling? So they feel it, they don't see it. So she can take a little time more. Stage can give fear to anyone, and she's just a 5-year-old. What do you feel, darling?
It is alphabet.
Can we do the steps one more time, Arahi? So we'll give a little moment, till then I'll explain you what just the kids went through. So we use 5 interventions in the Brighter Minds. We work on the neuroplasticity, wherein we believe that neurons that fire together, they wire together. And if you don't use it, you lose it. So the child was trained last year in the month of June, Arahi. And Anika was trained like 5-6 years ago. Brother, do you remember? 3 years. 3 years back, online. She did during the COVID, so Anika had done the course online. Can you open it? So sometimes the child sees 9 as... So the child could not recognize whether it is P, or 9. So that is why she was getting the alphabet. She's 5 years, so she could not understand it is a P, B if we flip it, and number 9. Thank you so much. Now to conclude, we'll call our star child with a small sloka.
योगास्थ कुरु कर्माणि संगं त्यक्त्वा धनञ्जयः सिद्धसिद्ध्यो समो भूत्वा समत्वं योग उच्यते. The meaning of this verse is: perform your duties in yoga, renouncing attachment, be even-minded or balanced. Inner balance or poise is called yoga. Thank you.
So if you have any questions, I'm there at the backstage. I'll be very happy to satisfy your curious minds. Thank you so much. Thank you for being so patient.
Thank you, ma'am. So we are starting with the panel discussion.
टेबल लाने को बोला सर ने। पैनल डिस्कशन है, टेबल पे बैठ के थोड़ी ना करेंगे। चेयर कहाँ से लगाओगे? 3 उधर पड़ी है ना, वो तो लगाओ अभी। फिर गुरुजी और मंजुनाथ सर आएंगे, 2 और चाहिए। कितने टोटल चेयर? 5। तो 2 और बाहर से लाना ना। स्टेज वाली कमेटी कहाँ है? कौन लगाएगा टेबल? चार ही चेयर है तो एक और लाओ।
बता दो ना 5 ये 5 है, 3 से स्टार्ट कर रहे हैं। गुरुजी इज जस्ट अराइविंग, ही इज ऑन हिज वे।
सर सर ये वाली चेयर 4 है ना। वायर्स है।
चार में एक खत्म कर दो और कोई इनको खत्म कर दो। नहीं नहीं इनको खत्म कर दो।
सिर्फ 2 से 2
बाकी लोग कहाँ पे है? 3 तो है, किस किस को लगाना है?
कौन वो तो इनॉग्रेशन के हैं, अभी
सब कुछ लगाना?
अभी
I request everybody to please settle down fast.
He's here.
Our guest for the evening has arrived. I welcome our beloved Guruji, Dr. H.R. Nagendra, who is the chief guest for the evening. I welcome you, sir, on behalf of our team. Starting with our panel discussion, we have 5 members for the panel. First, we have our beloved Guruji, Dr. H.R. Nagendra ji. We have Dr. N.K. Manjunath. We have Dr. Susan, Dr. Raghvendra Rao, and Dr. Mithali Mukherjee. It's an open discussion where public can ask their yoga-related questions to all of them. They all are from 5 different fields. Though they are related to yoga, but representing 5 different concepts of yoga, which you can clear out all your doubts. Since the morning you might be listening to too many talks. So now it's your time to ask the questions. I request the panel to please join us. Sir, we can start. We can start.
Good evening, everyone.
Yes.
We are here.
So, good evening, everyone. I welcome you all to this panel discussion. Throughout the day, we have had discussions on mind-body interventions on several, problems. So today, now we are lucky enough. We have the stalwarts in the field here. We have Mithali Mukherjee ma'am, who we have listened to her in the morning. She is from IIT Jodhpur. We have Professor Manjunath Sharma, who heads the research department. He is also the Pro Vice Chancellor of the Swami Vivekananda Yoga University, Bangalore. We have the Chancellor of SVSI University, Dr. H.R. Nagendra. Dr. H.R. Nagendra is also recognized as the top 2% scientist in the world who have worked in the area of complementary and traditional medicines. And we have Professor Raghvendra Rao, who is also a renowned yoga researcher and heads the CCRYN, Central Council for Yoga Research in Yoga and Naturopathy in the Ministry of Ayush. And we also have Madam from IAYT, IYAT, so International Yoga Association of Yoga Therapists from USA. So this is the panel here, and now you may contemplate on the talks that you have listened from morning, and the panel is open for discussion. So as an opening remark, I would like to just ask one question to the experts here. So when we see that the yoga research has grown in the last 2 decades, currently what is the need, what is the direction that yoga research should take? So this is a question for all of you. What do you think? Yes.
Yeah, good evening everyone. So we feel proud that we have a little over 9,000 publications in yoga as on today maybe, which are indexed in PubMed. We still consider yoga research as it is in still a nascent stage. We have a long way to go. If you look back 100 years plus, 1920s, somewhere yoga research has started. 1960s, good publications have started. And 2000 onwards, yoga research has seen that acceleration. And you don't believe, 2010 onwards, it has almost doubled the publications. So, having said that, research is in a very good upward direction, but still, the applications of yoga are too many. When you want to pick any one of them, certainly we need more evidence, more research to be done. So, we are looking at excellent global trends to progress further. At the same time, conclusively, we cannot say that yes, for some areas we might have some good evidence, maybe non-communicable diseases, particularly diabetes, then pain management and cardiovascular health, and wherever lifestyle medicine plays an important role, we have little confidence in saying that yes, yoga therapy has decent amount of evidence. But when you talk of several other conditions as application and bringing technology into yoga therapy, and looking at specified, or if you want to call it as personalized medicine, we have a little more steps to cover. Okay, so that's what I feel.
Thank you. Guruji, what direction should yoga research take? What is your opinion? What should be the direction for yoga research?
But dear brothers and sisters, it's very interesting that yoga has to take a big leap. The central question is, can mind exist without the brain, without the body? How many of you say it's not possible? Mind cannot exist without the body and the brain. How many of you say yet it is possible mind can exist without the body or the brain? How many of you want to say? How many of you say we don't know? That's where we stand today. According to Yoga Shastra, mind can exist without the body or the brain. So is it possible to prove this? That is where we have to have a very big leap in fundamental research about yoga. According to Patanjali, yoga is the control, mastery over the mind. Yoga chitta vritti nirodha. To gain mastery over the mind. Then what is that which you call as mind? Is it just functioning of the brain cells, or is it something beyond? If mind can exist without the brain or the body, physical body, what is it? Because it is a chitta vritti, conglomeration of thoughts. Thoughts can be there, and that is the whole of the creation. It is said the pure consciousness creates itself, and we have from the Anandamaya Kosha to Vijnanamaya Kosha, Manomaya Kosha, Pranamaya Kosha. Finally, it comes to the Annamaya Kosha. Our paradigm in modern science is the body is primary, it is the matter-based prime, and it is from here, whether the prana or the mind or the emotions or intellect, all emerge. It's called as upward causation. And Amit Goswami wrote the book in which he says it is downward causation that we have to look at. So can we think in this direction, find out ways by which we can establish the existence of mind or intellect or emotion without the existence of the brain itself. So this is a very big challenge that we have. What type of research can we do this? This is one aspect. The second thing is that we have done a lot of research in meditation. Maharishi Mahesh Yogi has published a lot of research in transcendental meditation, and many meditation techniques have been put forth. And also some of the Siddhi programs also was able to work on. But systematically, can Samadhi, which is the third limb of the Antaranga Yoga, Dharana, Dhyana, Samadhi, super consciousness, can we establish standardization for super consciousness? That is Samadhi. So just like our car, each signals are more or less established in meditation, in jhana. Can we say that there is some other dimension which can be the manifestation of Samadhi? But what is it that we call as Samadhi? Patanjali has brought it very clear. Tadeva Arthamarthane Pasa Swarupa Shunyameva Samadhi. In simple terms, in all our transactions, there are trifold process. Seer, seen, and the process of seeing. Any action we do. You take food, you are there, the food is there, and you are taking the food. Subject, object, and interaction. Even in meditation, the meditator, meditated, and the process of meditation is there. When the three things merge together, then it is called as Samadhi. So the seer becomes one with the seen. Then you jump from one level of consciousness to the higher level of consciousness. One layer of mind to the subtler layer of the mind. We have a similar phenomenon in physics, called as the quantum jump. And the electron sending around the nucleus, you put certain amount of energy. When it absorbs certain amount of energy, then it jumps into the next orbit. It vanishes here, comes into a bigger orbit. It's called the quantum jump. Similarly, in Samadhi, our mind jumps from one level to the higher level of certainty. So there are various levels of certainty. So Patanjali talks about 8 types of Samadhi and others. So can we direct our attention to understand Samadhi and bring standardization and see what are the benefits? According to yoga, a tremendous amount of bliss and new powers are emerging. Maybe extrasensory perception, telepathy, and many other dimensions. It all come into the region of parapsychology. And lot of knowledge. Most of the time when you get a totally new knowledge, you have had a little touch into that Samadhi. So people get totally new ideas, new thoughts, and you are searching and searching. Eureka of Archimedes, what happened? So all thinking how that's possible, how to find out how much of gold is there, how much is adulterated. And suddenly when he was in somewhat, then he got surprised. Jumps, Eureka, Eureka, and then he found it. So that type of aha is going to come up in the thing in which you have a new solution, a breakthrough solution that start coming up. So bliss, wonders amount of bliss, and extrasensory powers, and the dimensions of total knowledge. And this is the thing that happens and can bring tremendous amount of curative effect. Many of you know quantum healing by Deepak Chopra. He brought out some of the cancer patients who are all almost dead. 3 months, 6 months, a few days, they were declared. They had all dimensions of chemotherapy, radiotherapy, and others. They all have done that. And they were declared no more, they can't do anything, they are going to die. And suddenly something happens and become completely normal, absolutely normal, known as spontaneous regression of cancer. How did this happen? Is it only a magic? It's only an occurrence? Is there a science behind it? This is what the Chopra talked about in quantum healing. It is that when the mind gets into the higher dimension, the powers will come and then it's going to be completely bring tremendous amount of healing effect, exponentially increased healing effect. and it can devastate even cancer like dreaded disease. So these are the applicational values of the samadhi. So can we get into this fundamental research to decipher, standardize, and see that it? Because we all know the tremendous amount of the benefits that we get through meditation, various types of meditation. So the next step that we have to go into this direction. This is the fundamental research and applications, of course, that Manjana said, various dimensions and technology to see how best it can help. In the research we have been doing on immediate effect of yoga. Modern medical world has become so effective and has become swing throughout the worldwide because it gives you immediate benefit. Your sugar level is going up, and then you give the anti sugar levels, like you give insulin, and the sugar level comes down. Hypertension, anti-hypertension. Because of this immediate effect, pain relief and other, that it became so popular around the globe. Can we bring that type of immediate effect of yoga? So we did something about bronchial asthma. When a person is almost having this asthma attack, we developed a technique called yoga chair breathing to see that immediately it comes down. The person has been breathing. Similarly, during COVID, you will see what are the special techniques of breathing practices or the pranayama which can bring immediate benefit. So this area, if you do that, then yoga is going to have a tremendous effect and it will become most popular. Then the long-term effect. Sustainability and complete reversibility of the diseases. That's what we are doing now. A 5-year study at diabetes in which you see whether the yoga practices is sustainable, whether we are going to do the practice, what are the barriers in this thing, why they don't practice. And when we did our long study on bronchial asthma, published in American Journal of Medicine, there we are shown 3 groups emerged in that. People who practice regularly, that is 24 days in a week, 1 hour. That's called regular group. Another group they practice from club, then left it, irregular group. Again they did. Third group is discontinued. Of some practice they discontinued. 3 groups emerged. And what we found in all these groups, there were continued benefits. How did this happen? All the things that we discussed in that paper. So long term rehabilitation, lifestyle change is the important thing that emerges. So this is the long-term effect of yoga research has come up in this direction. So this is some of the thought for you to think about and probably can move in this direction. Thank you.
Thank you so much, Guruji, for enlightening us. Because of the paucity of time, now I would like to request audience, do you have any question that you would like to ask? Yes, please. Please introduce yourself in one line and then ask.
Okay.
Yeah.
So basically, sir, I'm an engineer turned into a yoga practitioner doing PhD final year in University of Patanjali. So, sir, this is my burning question, which I've already had, which I often debate with my father regarding this. Can we have a complete medicine-free life with soul yoga or not? Personally, I have been practicing for me for the past 5 years since I've been in yoga fraternity. So I have not been taking any single medicine, but my father, he himself being a yoga teacher, he still tells me that we need some supplements. We need something to complement with our routine with respect to like B12, विटामिन डी जैसे परम पूज्य स्वामी जी कहते हैं कि हम सब कुछ हमारे अंदर है, हमारे अंदर की अगर हम पाचन शक्ति इंप्रूव करते हैं, हमारे अंदर की प्राण शक्ति इंप्रूव करते हैं, then we have that capability of getting the nutrients out of the food and getting it assimilated in the body. So my question to you, sir, because you have been living a very fruitful life all these years with yoga, what is your take on it? Do you take any medicine or something like, do you consider yoga as the only solution to have a complete holistic life? Thank you, sir.
Guruji.
again a very important question you're asking. I'll give you an example of cancer. I get patients who say, I'm a very devout Hindu, I pray to God every day, I don't eat non-vegetarian food, I'm a strict vegan, no smoking, no alcohol, I do my exercise, I take very less amount of food, I'm physically very active. Why I got cancer? Okay, you should understand that aging is a process. We start growing old. As you keep growing old, there are genes within your body which also fail to act. Okay? The hormone, for example, the growth hormone is very high in the early ages of life, starts coming down. Stress hormone is lower in the early ages of life, starts going up. Okay? And the metabolic turnover, the proliferation of cells also starts going up. So when this is all happening, the amount of damaging, amount of food we eat, now there is pollution in the environment, right? So there is pollution in the environment. For example, there is lead in the plastic pipe. Lead in the plastic pipe can get into water, can get into the plant, can get into food. Now there is pollution coming without your knowledge inside your body, damaging organs and systems inside your body. So when there is already some toxins which are there causing the problem, so how can you escape from that? So medicine may also be required to neutralize those toxins, because these toxins can get detoxified only when you have antioxidants. Well, liver is a very important detoxifying organ. When you have antioxidants in good amount of quantities, then these can be broken down into simpler substances that can go through your urine or feces, whatever it is. Right? So that is right amounts are also required. So nutrition is also very, very important, no doubt. But sometimes nutrition, you will not get the same kind of nutrition in all the plant products. You may have to resort to some chemical means as well. That's why sometimes medicine may also be important in some situations. So it's not that we are completely a medicine-free world, because we are living with such kind of diseases. But if you see when in this cancer is coming, because mutation is happening in one gene. Okay. Once the P53 gene gets mutated, then you get cancer. Elephants don't get cancer, you know why? Everybody knows this story of elephants. Why elephants don't get cancer?
Mitali madam knows.
So this is a very interesting thing. Elephants live longer, have babies till longer time. They age very slowly. Still, they have the most number of cells, so they would be dividing so much. And anything which divides will have mutations accumulated, but still they don't. If they did, then they would not have lived so longer, right? So this was one of the things called Peto's paradox, and it turns out that it actually has a very efficient machinery called P53, which is a tumor suppressor gene. Humans have one, they have 10 copies, and it also any damaged DNA, it actually removes it out most effectively, because it also has a dead gene, pseudogene, which has become functional, and it doesn't allow any mutations to accumulate. These are the answers I know, but maybe there are other answers you might be able to tell.
No, is that gene related to the epigenetics or the lifestyle of elephant?
These are genes which are the most impacted genes in cancer. So P53 accumulates
So
mutations.
why only elephant? Is lifestyle of elephant has something to do with it? Vegetarian, complete.
So it's a
Always in the forest. They are always in the forest.
So it's a perfectly designed, meaning the genome has got a lot of time to optimize itself. So I think that's why it is that, and because it's huge and the number of cells it has. So this is very paradoxical, because people who are of bigger sizes in humans, they are more prone to having cancerous condition. Per person more chances, but elephants do not have. People have done the study. So this is really, these are, so natural systems are some places where we should also look for answers for these, and maybe try to adopt them, because mostly we think that humans are the most intelligent and what we are doing are the most brainy things in the world. But many microorganisms have evolved such beautiful systems, and maybe we need to do yoga really to get to that system.
Thank you, Mitali ji.
You wanted Guruji to answer that, but for a good match for you is Guruji, because he is an engineer turned into whatever you are saying. Okay, so you are an engineer turned into yoga. So he is an engineer, scientist turned into yoga. Quickly, we are running short of time. Okay, Guruji will give a short answer.
I know that Guruji has never taken any medicine. Even if he goes to Europe in winter, he is always into this white dress. I have never seen him wearing any sweater. There was a photo, from the Harvard area, Boston. It was winter. It was snowfall everywhere, and Guruji is sitting there in the photograph in this white dress. So this is the power of mind that Guruji bestows.
Depends on what sanchita karma you have accumulated with the prarabdha karma. You have certain lifestyle, so that you will be able to use that and develop the balance to a certain extent. But there is interaction. If your hereditary tendencies are very, very strong, it comes because of the prarabdha karma, as we say. If it is very strong, your equivalent yoga practices, if you have to do, should be as strong to bring the balance. So one side you have the negative thing, another side is the positive thing. Yoga brings the positive aspect. Another thing is the negative aspects which are born with you and your lifestyle which you have done wrongly and other things will come. So these are the two things. So you may be doing good yoga practices. I know a lot of people who come and say that they are doing yoga for 15 years but they got a heart attack. They were doing yoga for 25 years and they got a high diabetes. And one person who was telling that I have been practicing naturopathy completely 100%, but he had a massive heart attack and died. I know many people like this. So it's a balance. Natural way of life, normal way of life can bring certain level of balance in your system. But if your internal hereditary manifestations, which you call as because of the prarabdha karma, is very strong, then it goes to override you and then cause problems. So according to medical astrology, you say that the particular grahas which show your basic tendencies and basic hereditary conditions. The prarabdha karma is all manifested in your graha position. And if you are able to diagnose that and give the suitable parihara, you can improve that. That's the medical astrology. I know some of the astrologers who gave a very interesting thing. I had one person who said he met a lady of 14 years and he looked at the entire horoscope. And he said at the age of 21, you are going to have very strong cancer, breast cancer, and immediately have to go for the surgery. This is going to happen to you. The probability is about 80 to 90%. But there is a parihara for that according to astrology. If you do this thing particularly, Satanvrata, Tema, Puja, and Havans and others, probably you will be able to reduce the probability and it can become mild cancer and it can normal also. I don't believe in all these things or Mumbo Jumbo. Astrology has no scientific basis. But exactly in the 21st year, he got massive cancer thing and she had to go immediately for the surgery. He said like that he has 100 cases. So I said that let us put all these things and bring scientific evidence to that. Therefore, we have taken up a big project on this thing to find out the usefulness of this. We say that we have got a hereditary tendency. Your father and mother both have diabetes. You are also likely to become diabetic. Your probability is much high. But how this hereditary tendency comes to you? What is the basis? According to Shastra, it is because of your own karma we have done. It is there in the form of the karma which shows up. Sanchita karma is accumulation of all the karmas. Whatever action we do, that's the opposite reaction. If you do some good thing, good way of life, then you have good balance that comes. If you have some wrong way of life, you have got wrong imbalance. This all gets accumulated and gets stored in the subtler layers of the mind. So this is called as the Sanchita karma. That is accumulated results of our karma. And when it comes up when we are born, some portion of that shows up. That's called as the prarabdha karma. That is the one that shows up as the hereditary tendency. Therefore, if we can diagnose this using this medical astrology, probably we do that in a scientific way, probably we can diagnose cancer even 10 years, 15 years, 20 years before it happens. So then we have got a greater possibility of complete normalization. So these are some of the things
Thank
that
you.
are very subtle, which we don't have yet a total understanding. Though it is there in our Shastras, such as the Yoga Shastra, in Upanishads, and various things. Varahamira, for example, he had done huge amount of research in this. 15 huge granthas he has written. Patni has written only 196 sutras and given principle. But Varahamira has written such shastras, big books, and has brought this thing. He gives the whole dimension about the astrology, astronomy, and also mathematics. He's such a great seer, but hardly we know anything about him. We have not brought into this thing. So we have to unravel the mysteries that have been done in our country by great seers, great Maharshis. And if we can bring out this thing and bring it to our practice to see how we can deal with this modern NCDs and all the dreaded diseases, then it's going to be a new dimension altogether. This is the project now we have recently launched in our university, because we have been doing all these things from Adhi to Vyadhi. How we can remove the Adhi by using various the mental techniques and others we have done. Now we have to go deeper to understand the deeper dimensions in the subtler layers and also have to correct. This is how I look at the whole thing. So if you can make your life full of good balance, there's all the possibility that you can be disease free for your whole life. For example, my grandfather never took one medicine. He was completely normal. The last days, he just left his body. So like that it's possible. There are many people. I know hundreds of people who have lived without one single medicine also for their life. At the same time, to maintain a very nice, balance way of life, good lifestyle you can do. At the same time, if the prarabdha karmas are very strong, even if you maintain this thing, you may have the challenge. That's my opinion.
Thank you, Guruji. Dr. Tab, I would like to, take the same question. How would you respond, if the patient comes to you and tell you that I am doing yoga, and because I am doing yoga, I would like to stop my medications or reduce my medications or whatever I am taking?
Well, I'm sitting here next to this colleague that said that we need to get out of our silos and work together. So that was a very important piece to me. So in regards to medication, again, it's the teamwork, and it also makes the patient the center of that team, and that we need to be able to work together with all our expertise, our yoga expertise, our Ayurveda expertise, all of that together, coming together out of those silos. And I think that's so important, and that's one of the things that I heard today. It's very similar in the United States, is that we live and work in what our expert area is, and we're good at that. But that does not help that whole person that we're wanting to have and help, like we've been talking about, and that lovely yogic lifestyle where we have that mental and the social and the physical and the spiritual coming together. So I think if we can find ways to help people come out of those silos and work together in organizations, I think then we can then live the yogic life that we want. But I also, this is my own personal thing. Yes, we hope that we don't have disease, but there are lots of things that we don't have control over, as you mentioned. The water that we drink, we don't always have control. The air that we breathe, we don't always have control personally. So it's those things too, and you don't want to end up blaming someone because they get cancer, because they might have lived the life that some of we've discussed here on this table, where they've been able to do everything that we thought was the right way of living, but they still get it. And so it's not blaming, but helping them find ways to then go on and find a way to heal so that they can live in the life that they have.
Thank you so much, Dr. Tab. We are coming towards the last 5 minutes of this panel discussion. So very quick question. Yeah, yes, ma'am. Okay, first then this man. Yeah.
Alright, I'll try to keep it very quick. I have a question related to application, like the topic came up that research is giving us a lot of information, and I would like to personalize that question to myself. I'm a counseling psychologist, and as a result of my work, there are some restrictions, like the patients or the clients I'm working with, I don't have them for a longer period of time. I might not have as much control over them as I might have in an institutional setting. So my question is just around application in that sense, where we meet for sessions. The frequency can differ, but in that space, how can we bring in yoga? Because I personally also am a huge believer in yoga, and I've seen the transition from a traditional sports journey and exercise to now coming to yoga. So that is definitely something I believe in myself, and I want to incorporate that into my therapeutic approach as well. So my question is just around application in that sense.
So, yoga in psychotherapeutic settings, how it can be incorporated. Dr. Teb, would you like to take that?
That's a hard one, isn't it, when it's short term? But I think you give suggestions, and then it's really up to them, and also help them find resources that will be able to help them follow through. And I think it's, to be very open about it from yourself, to explain that the practices that you use and the benefits that you use. We often teach in psychological studies not to share our own, but I think I don't believe in that personally. So I think that we do share what we do and how it's helped us. And then we give people the choice and the way to then find resources outside when they do leave us in the work that we work.
Just to add to your question, basically accessibility to yoga intervention is a big problem. They come to your clinic, you teach them some yoga, then they disappear. You need to make collaboration with people around you and in the areas that the patient needs. So they can go to the nearest yoga person, yoga intervention person, and continue the yoga program. This is what we have done in CMBI. We have got yoga spokes across Chandigarh. So patients who come to that particular area can go and meet that particular spoke there and take the intervention. So the continuity of care will be maintained.
Okay, so thank you very much, sir. Now, the experts for the next session are already there, and there is we have to end the session now. Okay, madam. Okay, then so.
Can we diagnose with yoga that the person or child who is coming be good in that field, or some it can help in counseling also? Add this question.
Okay.
Can yoga help in this?
Can yoga help in what, madam? Diagnosis of what?
The child which is coming for counseling can better in life in this field.
Okay, educational counseling. Can yoga help?
Professional counseling.
You cannot use it for diagnosis. You can use
The
it
service.
for much better
Yeah, matlab,
cognitive skills
can
and
give
yeah.
direction. The diagnosis can give the direction of the child or something. If you will go in this field, you will be better.
Rather than saying that you go in this field or that field, it's for the child to pursue what is good for them.
Swadharma, yeah, the child has to realize from within where he is going to go.
Sometimes they come for the counseling.
Acha.
Okay, in which field we have to go, or we will do better. So in that field, yoga can work.
Certain things which are there. For example, some people may be right-handed and left-handed. Some people are more creative thinking. They have more artistic skills. They have. Some people have more mathematical abilities. So you have to work on their strengths. Some people have more compassion. I just give an example of my own friend. He wanted to be a very good engineer and a very academic person. He scored the top 2 ranks in the CET, the state CET, during my days. He impressed well. His father forced him to go into medicine, and within a matter of 6 months, he attempted suicide.
I recently, yeah.
So you were forcing somebody to go into an area which is not their forte, is not right. So even we can't really predetermine what is there in each person. So we have to see what strengths that person has. If somebody has got a lot of compassion, I'll just give you an example of suggestion of compassion. This is a patient of cancer. Her daughter, she's very compassionate, she likes animals. And she was having, her dilemma was during cancer treatment was she has so much of pain. And same question she has come up with, asking what my daughter is going to do. I don't know. I may live for a very short time. I have metastatic breast cancer. I'm going to live a very short time. I don't know what my daughter is going to do. So whenever she comes to the clinic, she used to get her dog along in the car. Okay. So when I went to drop her off, I saw the dog there. And I asked that girl, how come you brought a dog? So nobody's there to take care of it. So I take the dog wherever I go. And I love animals. I told her there was a solution in that she can become a veterinarian. Okay. And she became a veterinary doctor. So that lady there also came down very fast. So there are certain things which, some of the traits which you need to really find in people and then counsel them accordingly.
Because new generation is very much confused about
Yes.
that also. Na?
Okay. So thank you very much, madam. And I once again thank all the panelists for guiding us. Thank you very much. With this, we conclude the session.
Thank you, Dr. Bhagar, for moderating the session. I thank the panel once again to join us.
Yoga performance.
After a long day now, it's a time where we need some relaxation. So we have a yoga performance by our team. I welcome Mr. Kalyan, Manish and Jyoti for the yoga performance.
Sir, yoga performance.
जलं प्रवाह पावितस्थले कलेवलम्ब्यलम्बितां भुजङ्गभङ्गमालिकान्तवड्डमड्डमड्डमन्निनादवड्डमर्वयं चकार चण्डताण्डवं तनोतु नः शिवं जटाकटाह सम्भ्रम भ्रमन्निलिम्ब निर्झरी विलोलवीचि वल्लरी विराजमानमूर्धनि धगद्धगद्धगज्ज्वलल्ललाटपट्टपावके किशोर चन्द्रशेखरे रति प्रशिक्षणम् धराधरेन्द्र नन्दिनी विलास बन्धु बन्धुरस्फुरद्दिगन्त सन्तति प्रमोदमान मानसे कृपा कटाक्ष धोरणी निरुद्ध दुर्धरापरि क्वचिद्दिगम्बरे मनो विनोद मेतु वस्तुनि जटाभुजंग पिंगल स्फुरत्फणामणि प्रभा कदम्ब कुङ्कुमद्रव प्रलिप्त दिग्वधूमुखे मदान्त सिन्धुरस्फुरत्वगुत्तरीय मेदुरे मनो विनोदमद्भुतं बिभर्तु भूतभर्तरि ॐ नमः शिवाय सदा शिवं भजाम्यहं सदा शिवं भजाम्यहम् ॐ नमः शिवाय सहस्रलोचनं प्रभृत्य शेषलेखशेखरं प्रसूनधूलिधोरणी विधूसराङ्घ्रिपीठभूभुजङ्गराजमालया निबद्धजातजूतकर्णिचिराय जायतान्तकोरबन्धुशेखरः ललाटचत्वरज्ज्वलद्धनञ्जय स्फुलिङ्गवाणि पीतपञ्चसायकं नमन्निलिम्पनायकं सुधामयूखलेखया विराजमान शेखरं महाकपालि सम्पदे शिरोजटालनास्तुनः कराल भाल पट्टिका धगद्धगद्धगज्ज्वलद्धनञ्जयाहुतीकृत प्रचण्ड पञ्चसायके धराधरेन्द्र नन्दिनी कुचाग्र चित्रपत्रक प्रकल्पनैक शिल्पिनी त्रिलोचने रतिर्मम नवीन मेघमण्डली निरुद्ध दुर्धर स्फुर कुहूनि शीथिनी तमः प्रबन्ध बद्ध कन्धरः निलिम्प निर्झरीधरस्तनोतु कृत्ति सिन्धुरः कलानिधान बन्धुरः श्रियं जगद्धुरन्धरः प्रपञ्चकालिम प्रभावलम्बि कण्ठकन्दली रुचिप्रबद्धकन्धरं स्मरच्छिदं पुरच्छिदं भवच्छिदं मथच्छिदं गजच्छिदान्धकच्छिदं तमन्तकच्छिदं भजे अखल्व सर्वमङ्गलाकलाकदम्ब मञ्जरी रसप्रवाह माधुरी विजृम्भणा मधुव्रतं स्मरान्तकं पुरान्तकं भवान्तकं मखान्तकं गजान्तकान्धकान्तकं तमन्तकान्तकं भजे विनिर्गमत्क्रमस्फुरत्करालभालहव्यवाद्धिमिद्धिमिद्धिमिध्वनं मृदङ्गतुङ्गमङ्गलध्वनिक्रम प्रवर्तित प्रचण्ड ताण्डवः शिव विचित्रतल्पयोर्भुजङ्गमौक्तिकत्रयो गरिष्ठरत्नलोष्टयो गुरुद्विपक्षपक्षयो कृशारविन्दचक्षुषो प्रजामहि महेन्द्रयो समप्रवृत्तिकर्कदा सदा शिवं भजाम्यहम्
योग केंद्र द्वारा योग पर उनकी परियोजनाओं के लिए धन सहायता प्रदान की गई। हम इस कार्य के लिए बहुत आभारी हैं, जिसने इसे वास्तव में विशेष और यादगार अवसर बना दिया। उद्घाटन करते हुए निदेशक प्रोफेसर लाल और धन्यवाद ज्ञापन पीजीआई के निदेशक प्रोफेसर विवेक लाल द्वारा दिया गया। CCMBIY विशेष कार्यशाला वार्ता और व्याख्यान जैसे विश्व योग दिवस पर योग निद्रा, योग और उसके दर्शन, योग संरक्षण पर व्याख्यान डॉक्टर लक्ष्मी नारायण जोशी का रहा और भारतीय आयुर्वेदिक कांग्रेस AIAC द्वारा 12 तारीख को धन्वंतरी आयुर्वेदिक कॉलेज सेक्टर 46 चंडीगढ़ में आयुर्वेद पर्व का आयोजन किया गया। पाइटेक्स मेला अमृतसर धन्वंतरी कॉलेज में आयुर्वेद पर्व का उत्सव, एम्स ऋषिकेश कार्यशाला में CCRYM PGIMER केंद्र के कर्मचारी। PGIMER फेसबुक पेज पर हमारे योग विद्वान द्वारा कोविड-19 के दौरान निरंतर और सहज व्याख्यान श्रृंखला में विज्ञान आधारित समग्र चिकित्सा पर केंद्रित अकादमिक और वैज्ञानिक चर्चा, वहां 225 से अधिक वैज्ञानिक और अकादमिक व्याख्यान उपलब्ध है। संघ को अनुसंधान प्रयोगशालाओं के अनुपालन, अच्छी योग प्रथाओं और गुणवत्ता प्रशिक्षण स्थापित करने के लिए विभिन्न अनुसंधान उपकरणों के साथ 5 परियोजनाओं और 1 MD फेलोशिप के साथ मंजूरी दी गई थी। योग केंद्र में अनुसंधान की स्थापना कोलैबोरेटिव सेंटर फॉर माइंड बॉडी इंटरवेंशन में विभिन्न व्यक्तिगत साक्ष्य आधारित योग प्रोटोकॉल ने योग को अपनी उपचार योजनाओं में शामिल करने के बाद उनके जीवन की गुणवत्ता में महत्वपूर्ण सुधार की सूचना दी है, जैसे चिंता में कमी, नींद के पैटर्न में सुधार, ऊर्जा के स्तर में वृद्धि और बढ़ी हुई मानसिक स्पष्टता का अनुभव करते हैं। इसके अलावा योग एक निवारक उपाय के रूप में कार्य करता है, एक स्वस्थ जीवन शैली को बढ़ावा देता है और विभिन्न पुरानी बीमारियों के जोखिम को कम करता है। ये शोध प्री डायबिटीज रोगियों पर किया गया है और इसमें योग के माध्यम से प्री डायबिटीज को डायबिटीज में बदलने से रोकने के पुख्ता सबूत मिले हैं। ये सभी उम्र और फिटनेस स्तर के लोगों के लिए एक सुरक्षित और प्रभावी अभ्यास है। सेंटर स्टाफ को सिस्टमिक रिव्यू और मेटा एनालिसिस जैसी विभिन्न कार्यशालाओं और सम्मेलनों में भाग लेने के लिए सम्मानित किया गया। CCRYM नई दिल्ली आंत स्वास्थ्य पर एकीकृत दृष्टिकोण, षटकर्म और सात्विक आहार का प्रदर्शन, चिकित्सा प्रौद्योगिकियों के लिए सत्र, प्रोफेसर अक्षय आनंद ने व्याख्यान दिया और चौथे राष्ट्रीय प्रकृति चिकित्सा दिवस दिल्ली में योग चिकित्सकों ने प्रदर्शन किया। योग केंद्र के कर्मचारियों ने भारत अकादमी ऑफ न्यूरोसाइंस सम्मेलन में भाग लिया। विश्वव्यापी योग आधारित शोध एक सहकर्मी समीक्षा पत्रिका में प्रकाशित हुआ है। CCRYM पीयर रिव्यूड जर्नल में प्रामाणिक डेटा और साक्ष्य आधारित शोध प्रकाशित करने के लिए योग और चिकित्सा विज्ञान को भी एक साथ जोड़ता है। एकीकृत चिकित्सा मामले की रिपोर्ट विभिन्न समाचार पत्रों में CCRYN, CCMBIY की उपलब्धियों के बारे में बात करते हुए समाचार बुलेटिन भी प्रकाशित किए गए हैं। इस यात्रा को पूरा करने और कार्यशाला की सफलता के लिए हम हमारी टीम के अथक प्रयासों और दृढ़ समर्पण के लिए आभारी हैं। अंत में PGIMER चंडीगढ़ में योग हमारी स्वास्थ्य संबंधी देखभाल प्रणाली में एक महत्वपूर्ण भूमिका निभाता है। चिकित्सा उपचार में योग को एकीकृत करके हमारा लक्ष्य रोगी के स्वास्थ्य में सुधार और समग्र कल्याण को बढ़ावा देना है। इस प्राचीन पद्धति को अपनाने और PGIMER में योग की काया पलट शक्ति का अनुभव करने में हमारे साथ जुड़े। डॉक्टर विवेक लाल का साक्षात्कार और न्यूज।
Yoga is a power, it's a superpower. It's a superpower. You ask yourself. It is well known that those who start doing yoga have their sugar controlled with the same amount of medicines, and then to the extent that they have to reduce their medicines once yoga gets into their system. I know of patients who have, I'm telling you, my own father, he started doing these 90, he started doing simple, very straightforward yoga. His blood pressure medicines have come down significantly.
पीजी चंडीगढ़ में आज सुबह 850 से अधिक HCW उनके परिवार और दोस्तों की भागीदारी में 9वां अंतर्राष्ट्रीय योग दिवस मनाया गया। PGI निदेशक डॉक्टर विवेक लाल ने दीप प्रज्वलित कर कार्यक्रम का शुभारंभ किया। इस दौरान उन्होंने कहा कि योग लोगों को एक साथ लाता है।
Lightning. Dr. Akhil, please join us on the stage.
कुन्देन्दु तुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारसारपरमा आद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीम् अभयदा जाड्यान्धकारापहा हस्ते स्फाटिकमालिकां विदधतीम्.
Thank you, sir. I would request Dr. Vivek Lal, Director PGI, to felicitate our chief guest for the evening, beloved Guruji, Dr. H.R. Nagendra ji, with a memento and a shawl. I would request Dr. Akshay to kindly felicitate Dr. Vivek Lal. I would request Dr. Akshay and Dr. Vivek Lal to please stay back and felicitate few more people who have helped us to succeed this workshop. I would first request Mr. Akhil Kumar, Additional Health Secretary, Director Ayush, UT Chandigarh, to join us for the felicitation on the stage. मोमेंटो सर को दे दो, मोमेंटो सर को दो. Mr. Nirmohi, former anchor of DD News, we have just heard his voice in a documentary which he gave us. Thank you, sir, for your contribution. I request Dr. Vivek Lal and Professor Akshay Anand to felicitate him. Dr. Vipin Kaushal, Medical Superintendent, PGI. Mr. Sushil Kumar, HE, PGI, to join us for felicitation. Thank you, sir. I would request Professor Akshay Anand to please stay back. And we have 3 best paintings out of 14. We had asked students to make paintings regarding yoga. So we have 3 students who have very, very good artwork. First is Mr. Ahem, Government Model High School. Give him a big round of applause. Mr. Arman, Sector 16, Government Model School. Prasanjit, Government Model High School, Sector 11. Thank you, sir. I would like to invite Professor Akshay Anand to introduce the agenda and welcome the dignitaries for the evening. Dr. Akshay Anand, please.
Sorry, I got engrossed with Guruji and my director. Thank you very much for coming. This has been a really great day, especially with the august presence of Guruji Dr. H.R. Nagendra. I would like to start thanking CSIR, CCRYN, our directors ready to go, always ready nod, and his permission to not only make it a success, but also we got a waiver for this hall to be used without any fee because it's an academic and a welfare activity and science to it. So really thank him. The discussions across the day were very good. Thanks to all of you that you stayed back throughout the day. It's almost 9 hours now. And the tea after the lunch also they missed, but they pulled along. Thank you to the international guests, Eliza, Sue, Molly, Rich from MIT, and you 3 from International Association of Yoga Therapy, Vinod Srivastava from Kansas University, and all the Indian delegates from all the way from the AIIMS New Delhi, Dr. Rima, I can't name all, Sanjeev Patra, Kashinath, and all others. I can see many people who are here, and thank you for making this meeting a success. We plan to take the thoughts which we discussed here through our yoga center into action, and we have made notes of this, Guruji, and these notes that we have made today, we are going to take it to further discussion tomorrow in the expert committee meeting at the UT Guest House. I'm sorry that this is not open to everybody. This is open to only the experts and the faculty of PGI also. Although those who have registered online can get access to the discussions because we have the consents for that. Our website, which is visible, and if you can Google that, you will find all the PowerPoint presentations. You will find all the consensus paper which we are trying to evolve into policy action, which we plan to give to our director, which we will request will forward to through the proper channel to the ministry and the PMO for action with the blessings of Guruji. And all these deliberations are not going to stop here. It is not one of V2 meetings. It's a meeting where we have an agenda in place that today, as you saw, included regulatory practices, accreditation systems, science of yoga. We talked about evidence-based ayurgenomic approach from Dr. Mitali, and all these studies and all these evidence and discussions and even the question answers we have made note of. We will discuss them more intensively and immersively tomorrow in the expert meeting, and day after. Day after, Guruji, we are having a review of the 5 funded projects that you saw in the documentary. Our director, Professor Lal, was giving those 5 applications, grant applications, successful grant applications, award money to do research in 5 areas, including 1 MD thesis. We will be reviewing their progress, and we'll also submit that report through our director to the Ministry of Ayush. So I'm very happy to note that you're all here and you have continue to participate in our meeting. Please look at some of the launches that we are going to be doing. Pay attention to that. That includes this new documentary that you saw. There's going to be a book launch. This particular book that you see, we are going to let you take away, courtesy Mr. Rakesh Mittalji, who's seated here while the book is launched. It's a very good commentary on the way one can achieve dhyan, dharana and samadhi, and maybe thoughtlessness in a manner that is invokes compassion in you, that invokes peace and resilience in you. What are the processes? How does a meditator feel? We would like to for you to take a look at that. We will also be releasing Guruji and Sir, Director Sir, yoga abstract books that we have compiled, and that is going to be a supplementary issue of the Journal of Integrative Medicine case reports, which we just showed you in the documentary. We are also having a center booklet, which we will be requesting you to release. We'll have the activities of all the center in this booklet, in addition to what I just mentioned. So with that, I would like to end my small short speech and not be in between what the director has to say and of course what Revered Guruji has to say. Thank you very much for your attention. And again, I would like you to continue being live on the live streaming that we are doing in today's meeting as well as tomorrow's meeting. Thank you very much. I would like to now invite Professor Vivek Lal, the director of our institute, to please come and say a few words.
Shri Shri Nagendra ji, Rameshwar Rao, Ramakrishna, I'm sorry, and everyone else sitting in this hall. I'm actually very privileged to be in this audience. It's my habit that I always speak without a piece of paper. I've never kept a paper while speaking because I always speak from my heart. Which means that if I go down after speaking and you call me back, the speech will be totally different from the one I gave 5 minutes before. I have 2 important assertions to make. A, yoga, and I mean it, I'm looking into the future, is the medicine of the future. Let me tell you that. It is the medicine of the future. We will soon realize that what we lost was gold, and what we gained was something that glitters like gold, right? But it is not gold. That is assertion number 1. Assertion number 2 on a lighter note, the person who needs yoga the maximum is Akshay Anand. He is so impatient. I think you got anything, which can be done tomorrow, according to him, should have been done yesterday. So I think to make him patient, he needs the most maximum yoga to keep him patient, right? And I request yoginis here and yogis here to please make him patient. Please, please do. Otherwise soon he'll end up burning himself for a good cause. So whenever he comes to me with anything concerning this very pious piece of science, I call it an academic, scientific, altruistic activity. It is for the society. I am saying yoga is for the society. look back at our past heritage. Look at Swami Ramakrishna. Look at Vivekananda ji. Look at the colossal impact they had on world civilization. The sad thing is, Indians forgot their message. If you read about Swami Ramakrishna, you read about Swami Vivekananda, the legendary English historian Arnold Toynbee said, amongst all the philosophers that have serenaded across history, these two are iconic. They are colossal. Swami Vivekananda gave his iconic 9/11 speech in the Parliament of Religions in Chicago in the year 1893. Exactly 100 years before 9/11 took place. And that 9/11 took place because what Swamiji talked of 100 years ago was forgotten. The patience, the discovery of inner self, the piety which is associated with our heritage and yoga. Yoga is just one component of our heritage. हमारी civilization बहुत बलवान है, बहुत बलवान है. If you read Indian civilization, you think you don't need one life to understand it, you need 7 lives to understand Indian civilization. It is so deep. It is so deep. It is fathomless. Yoga to me has always been as I said, it's a super science. The journey of self, through self, to self. It's a journey of self, through self, to self. Yoga is not stretching, as we all assume it is. No, it is not stretching. It's not stretching. If we practice the super science of yoga, the way our sages practiced it, now that is not going to be easy. Those sages are not going to come back again. Those times are not going to come back again. That learning is not going to come back again. That gravitas is not going to come back again. But if we try and follow their trajectory of thinking, if we try and follow what they were trying to teach us, Maharishi Dattatreya, you were talking of Dhanvantari, Maharishi Agastya, Shankaracharya, legendary yogis, and of more modern times, Shri Ramakrishna ji, Ghanananda ji, Swami Vivekananda ji. You will reach a stage where you will definitely make an altruistic impact on the society. Today, what is the toughest, the single toughest enemy that the society faces, that the single toughest challenge that our society faces? Can anyone guess what is the single toughest challenge that the society faces? It is society itself. It is society itself. Society has lost its moorings. This is not the society which our sages in the past had thought of. It's getting crazier day by day. And an epitome of craziness to me is Elon Musk, if I'm allowed to use that word. Many think that he's God. To me, he's a crazy guy. He removed that beautiful image of a sparrow, which is so indelibly linked in our hearts because we grew up with that, and he crossed it. Crazy guy. And he's considered an iconic colossus. To me, the removal of that sparrow itself tells me that there is something missing in that man's heart. All of us grew up with those lovely little birds, waiting for them to chirp while going to school, while coming back from school, and he says X, and that's it. So the biggest threat to society is society itself, because society is not recognizing what is right, what is wrong for its future, and its future are our children. You made a very loaded statement. Yoga can be used as a therapeutic antidote to fight drug addiction. I tell you, you could not be nearer to truth than that statement. I am telling you, today we are seeing our generation being plundered by drug addiction, being decimated quietly by drug addiction, and being completely destroyed by drug addiction. And why does it occur? Peer pressure. Why does it occur? Because of an inherent unhappiness that makes a child drift towards addiction. And that inherent unhappiness has a very good antidote in yoga. The point I am trying to make, Shri Nagendra ji, is use your good offices to start yoga in school. A child's brain is like wet cement. Anything that falls on it makes an impression. Remember that. You teach these children yoga in schools, you will have a beautiful society later on. There is no point starting yoga in college. By that time, that cement has solidified. महात्मा गांधी जी कहते थे पक्के घड़े पे मिट्टी नहीं चढ़ती. So if you want to have and extract the maximum out of yoga, catch them young, as Fakhruddin Ali Ahmad said, catch them young. We talk of prayers, we talk of good thoughts. To me, genuine yoga, the one that is devoid of all glitter and glamour, is the true science of the future. Because that is that science, it is that science that probably the only science which recognizes the relation between mind, body and soul. Science does not recognize the soul, the science as we understand it. The science does not understand the mind, the science only talks of the body. So that's what we call science, the science that is taught in LT1, right? Yoga is the only science which recognizes both the mind and the body and the soul. And that is why I consider it a science of the future. The sooner we popularize it, the better it is for our nation. We need to do that. We have lost valuable time. We have lost valuable time. We drifted towards the West. There are some Western iconic faces here, excuse me for saying so. They are coming towards us. They are coming towards us. Look at that. And we are going in that direction. We are going in that direction. Yoga will help us prevent that wrong drift. Our heritage is a very powerful story. If you get time, read about it. Read about India's contribution to world thought and culture. And you will realize just how shallow we are as compared to our peers. Just how superficial we are. And that is when you will take pride in the fact that yoga began in India and now it is India's duty to disseminate it across the world. The only way we can do it is by being convinced ourselves that it is effective, which it is. Which it is, provided you understand what it means. You understand it holistically. You imbibe it holistically. You breathe it. That's yoga. You breathe it. वो प्राणायाम जो हम करते थे, आज today they are called cardiac coherence exercises by the University of Harvard. Boy, my God knows our sages had been doing it before the dinosaurs were born, yeah? Right? So, and now they're called cardiac coherence exercises. Right? They've been there. That's yoga. That's yoga. Because those sages were head, body, torso, head of any scientist today. I remember this famous phrase, I think it was by Albert Einstein. Religion is blind without science, and science is lame without religion. I think it was Albert Einstein who said that, right? Keep that in mind. Yoga is a combination of both. Yoga, I said, is the future of medicine, and if mankind has to salvage itself from the mess that we have got ourselves into, we need to get these concepts of yoga into our children before it is too late. Namaskar, Jai Hind.
Thank you, sir, for your all encouragements and the inspiring word. Now we are eagerly waiting for this moment for the formal launches of few books we have. So we are starting with our launches. We have a first book, abstract book, and I would request Dr. Raghvendra Rao to please join on the stage for the launch of abstract book, and Dr. Aruna to please accompany him.
मैम को भी
The next book we have is Center Booklet. I would request Dr. Lal to please launch the book and Dr. Pramod to please accompany him. Next we have Center Publication book. I would request Dr. Akshay Anand to please launch the book and Dr. Krishan please accompany him. Last but not the least, the book launch of the day is Prakriti book by Mr. Rakesh Mittal, and I would request him to please join on the stage. I would request Guruji and all the dignitaries to please stay back for the launch. We congrats all the authors for the launches of their books. Thank you, sir. Thank you, dignitaries. Please take your seats. Last but not the least, this is the time where we get the blessing of our beloved Guruji and the chief guest for the evening. I request our Guruji to say few words and address the gathering and give his blessings to all of us.
My dear brothers and sisters, I'm a little confused whom I should congratulate. Whether Akshay Anand for organizing this wonderful 3 days program, or our director for supporting him so aptly to make this such a grand event, or our Dr. Raghavendra Rao, who brought this center here for the PGI Chandigarh, or the whole team of Akshay Anand for making this such a wonderful organization, or for all of you who have joined this to participate and enrich this entire society. I congratulate all of you for making this such a memorable event. As rightly pointed out by our director, yoga has to go into the schools. This is what we started doing in 1975. We went into Arunachal Pradesh, where we had the biggest challenge. In every 15 kilometers there were new dialectics, and people had their own languages, and they were almost like cannibal cultures. Such a person, how we can bring them to the highest heights? That was the challenge given by the then Commissioner K. Raja. And he told our Eknathji Ranade, who was the president of Vivekananda Kendra, to see whether this is possible. Then we took up our challenge, and we had our people to go there, set up the schools and train them and bring the children to the mainstream. So what yoga did we teach? That was the challenge. If we just give some asanas, they will practice for a while and they get completely lost after everything. What is the real purpose of education? That is, education is the manifestation of perfection already in man, as Swami Vivekananda said. The whole goal is to raise the people from their normal level to become great, super divine human beings. And how do we do that? For total personality development, physical, mental, emotional, intellectual, with a spiritual basis. That was the goal. So we had a team of child psychiatrists, scientists, educationalists, and 9 of us. We all sat together to see how we can bring yoga to the forefront to make this possible. Then we evolved the entire protocol from class 1 to class 10. Class 1, eyesight improvement. Then voice culture and hearing development, memory development, creativity development, team spirit development, ego management, stress management. Like 10 different modules we evolved, and we started bringing this to the school level. And the children blossomed wonderfully well. And we did research to show how this is really possible. Published many papers. And then the government came forward and said, this is wonderful, we want to go into the regular government schools in the entire Northeast. And for that, what is needed is teacher training. We started doing teacher training for 1 month for the training of the teachers. And slowly it spread over the 20-25 years. We spread throughout the country. In 65,000 teachers we trained under the Vivekananda Kendra movement, and it started spreading. But it happens always, the whole thing slowly deteriorates, and sakalaina muhata yoga parantapa, as it is said, that slowly the whole thing came back. And therefore there is a rejuvenation that was needed. Therefore, thanks to our Honorable Prime Minister, he brought the whole thing back to the fore in a very big way throughout the world by International Day of Yoga. And then he said, it should not be a one-day affair. It should go into education system. So we all, the Ministry of Education, that MHRD, that you should bring this. So NCERT took up the whole thing during the primary, middle and high school things. But the pre-primary thing, NCERT, they also started bringing this, and we started developing the syllabus for them. Then UGC did not lag behind, said that we should go into the PG also. The whole thing has been done, and the syllabus has been created based on the scientific evidence. Therefore, it has been set. The government has done its best, but it's a state subject. Every state have to take up these things and see that it is incorporated. And some states have started doing that. I remember we did it in Karnataka in about 3,000 schools, and it started developing. Therefore, everything is ready. Now, the entire government came forward and said we must have the complete thing well documented and do this thing. So AICT helped us, and we developed what is called the Swayam. Under the Swayam scheme, we have the complete thing well documented. It's all available in the form of video and the PowerPoints and the complete write-ups. Everything is available, and it's freely available in the AICT channel, the Swayam channel, people can take these things and do these things. And the result of that is Arunachal Pradesh children blossom like wonderful flowers. And throughout the country, the children are first wanted, whether it is a law or doctorate, doctor, medical profession or engineer or IT. Oh, you are coming from Arunachal Pradesh? Okay, we'll take. And slowly we have set the schools of Vivekananda Kendra Vidyalaya throughout Northeast and Andaman Nicobar and other places, 65 residential schools. And this is how it has started growing. So what you said is 100% correct unless we bring it right from the school level, even from the pre-primary level. Then the whole thing is not going to come up in a big way. That's how the whole transformation should take place. Earlier it used to be like that in our country. Our Gurukula system used to have complete dimension, But when the Western education system came, the whole thing got distorted. What is the distortion? The most important thing, control of the mind. As he rightly said, mind-body interaction, mind neglected. They said that when children were sitting there in deep meditation, Macaulay, he came there and said, hey, come on, get out. Don't be lazy, don't be lethargic, and be active, And he completely removed this dimension of meditation in the whole thing. And as a result, what happened? People started growing in this direction. Not only in India, all over the world. And we have developed this aspect of mind to speed up the mind, faster mind, quicker mind, brilliant mind, creative mind. But the second dimension of calming down the mind, silencing the mind, going to deeper and deeper level of silence has been grossly neglected. I was thinking, why did this happen? Because Macaulay thought of only two levels of the mind. One, a lazy mind, lethargic mind, sleepy mind, drowsy mind, calm mind, silent mind, peaceful mind. Another he thought is very active mind, brilliant mind, creative mind, and this thing. He thought of only two things. Therefore, when people sat in meditation and other things, he thought they are very lazy, lethargic, and drowsy and sleepy. First time in the history, Maharishi Mahesh Yogi, we should give the credit to bring this dimension that the calming down of the mind, the meditation is not a lazy mind, it is not a lethargic mind, it is not a mental retardation, it is a science which is much beyond your so-called active mind, And by number of publications, in collaboration with Harvard University, with Dr. Manson and others, he was able to show, published nearly 600, 700 page research papers in which he showed that meditation can bring total personality, not only the memory, IQ, creativity, much higher than the Rajasic mind. So he said, Tamas, Rajas and Sattva are the three dimensions. So don't think that Tamas and Sattva are same. It may appear same, calm, silent, and they are also lazy, but there is a world of difference. And that is what he was able to show. Therefore, this has to be brought forth in our education system. All of us are groomed in this dimension of sharper mind, brilliant mind, calm, the creative mind. And you ask whether I can sit calmly, quietly, without any thoughts. We cannot sit even for 2 minutes, 5 minutes. Why? We are not actually trained right from our child. The whole system of education has to be changed. Whereas in our earlier times in the Gurukula system, they were made to sit calmly, quietly. And this is what started doing that in our entire Arunachal and other schools and started bringing. This is the dimension that we have to add. So Patanjali says, Chitta Vritti Nirodha, gaining mastery over the mind, has the two dimensions. What is to speed up the mind, faster mind, quicker, brilliant, this thing is necessary. I don't say it is not necessary. But the second dimension of calming the mind, silencing the mind, tranquilizing the mind, going to deeper and deeper levels of peace, silence, calmness, and to deeper and deeper levels of samadhi. These are the dimensions that have to be brought forth. So, if you bring this, then there is a harmonious and well-balanced development. Otherwise, you have big imbalance. One side we are gigantic, other side we are pygma, and this big imbalance brings tremendous imbalance in the pranamaya kosha, into the physical body, causing all imbalances. Initially, the left and the right brain imbalances, autonomic imbalances, endocrine imbalances, percolates down to each and every organ and system in the body, causing big imbalance. And that is what you should call as stress. And stress has to be dealt at the mind level itself. And that's the major thing that we have to do. This has been beautifully incorporated in all our syllabus. Therefore, when we develop this common protocol of the International Day of Yoga, we had this challenge, what practice we have to do. We brought all these 4 streams of yoga which Swami Vivekananda has given, Jnana Yoga, Raj Yoga, Bhakti Yoga, Karma Yoga. So those of you who have been now very familiar with the IDY yoga protocol that we practice in IDY, you should be able to decipher how this thing has been subtly incorporated in the 35 minutes protocol. We have incorporated the dimensions of proper knowledge, Jnana Yoga, then Raj Yoga and Bhakti Yoga and Karma Yoga. All these 4 dimensions have been intelligently, subtly incorporated into the IDY. And therefore we want that more and more people should practice. And thanks to Ministry of Ayush and Raghavendra and Rajesh Kotecha and all that, each year we are trying to increase the people who practice this IDY protocol, very simple protocol. And last year the target was 20 crores of people in the country should practice. And this year, 23, it was 25 crores. And Raghavendra and all these people collected the data from all over and to see whether we have been able to reach that. Similarly, Ministry of External Affairs were told that in every country we should have the IDY protocol practice. And it has started spreading like the whole thing with the exponential growth. And our Honorable Prime Minister has been pushing it in all ministries. It should be not only in the general public, in every ministry it has to come. And that's how we want to spread yoga in a very generalized way throughout the world, one side. Similarly, education system. Similarly, it also has to come into the health scenario. As you rightly say, yoga has a great contribution. What has happened in the Western mindset, we think that allopathy is total and there is nothing else that is needed. But we have started realizing the importance of the adding Ayush system because we have the biggest challenge of NCDs. Cancer has become a big boon, I will say, because it has started shattering our understanding of matter-based paradigm. And we have to know that we have to go beyond. And that's how we started adding. We know that all NCDs have no cure. Once a diabetic, ever a diabetic. Once hypertension, ever a hypertensive. And once you get cancer, days are numbered. Why? Because of our limited knowledge in modern science, which is essentially at the physical level. Over 400 years, Newton and Descartes has started the ball rolling. We understood everything about the physical world. We know that everything is made out of energy. Molecules, protons, neutrons, electrons, fundamental particles, finally energy, E equals mc square. We also understood the laws that govern them. That is classical mechanics, quantum mechanics, special theory of relativity. And therefore, anything physical, we have been a big success. Putting man on the moon, building skyscrapers, underwater tunnels, powerful pharmacological intervention, 5,000 types of surgeries, everything we have been able to do. Now what is happening to science? Science is going beyond the physical. To understand, is there something like prana? What is it that we call as mind? I ask the question, can mind exist without the brain and the body? Into this region of subtlety and causality, the science is moving. And for this to proceed, NCDs have been the biggest challenge. And all infectious and contagious diseases essentially are physical, therefore we have been able to deal with our vaccines and then antibiotics and all these things, and surgeries to deal with that thing. But these NCDs have become the biggest challenge, and such large number of people suffering from NCDs and the dreaded diseases like cancer and others. So now the whole science has to move and the whole medical world has to move towards the combination of yoga and our systems. And it's here, as you rightly said, yoga is very, very necessary today in the modern time. How to do that? So our Honorable Harshvardhan ji, who was the health minister, he said, okay, we will set up separate Ayush building in everything, in every AIMS, allopathic thing and these things. And therefore, in many Ayush things this had been done. Then in AIMS Delhi, we started, Advanced Center of Integrative Medical Research about 12 years back. And we started the research. Dr. Gautam was the cardiologist, and then he was made the chief, and then slowly started percolating. Thanks again to Raghavendra Rao and our CCR when we started funding these people and started doing the research. Today, for 10 years, they have produced wonderful papers, 35 research papers of high impact fact journals also. And similarly, we are spreading this through these centers like what we have here and other places also and do this. But what is happening today in the other dimension? So when people come in big numbers to mainstream things, then they say, sir, there are some big Ayush buildings that there is Ayurveda, yoga, everything. Should we go there also? Doctors will say, no, we cannot assure you. If something happens, we are not responsible. Therefore, here 5,000 people come, there is 5 people will not go. Therefore, the mindset has to change. Therefore, in Imhans, Dr. Gangadhar, who have been the director, we all started working and started this course, some certificate course in integrative medicine. So in the first batch, we had nearly 35 people, all doctors, specialists, super specialists, even some people from abroad. And we gave them 6 months thing and 1 week of training in Imhans, 1 week in our Prashanti Kutaram campus where we had the integrative medical system. And people were extremely happy. It started opening. They said, we never knew the tremendous width and breadth of the Ayush system. Yoga, Ayurveda, Siddha, Unani, homeopathy, everything. And they got. On the second batch, now we got nearly 100 applications. We selected 35 people. And this is how it's coming. So AIMS Delhi is going to start the CCIM. Then the AIMS Jodhpur and Rishikesh, and then Madhya Pradesh, everywhere they are going to start. Similarly, I request that here also we should have the CCIM. I appeal to our director here that we should start the CCIM, that is certificate course in integrative medicine, 6 months online, and 1 week here they should get. And there are 2 streams. One, Ayush people will be exposed to the entire allopathic system. They will go into different ways. Similarly, the modern medical experts will get exposed to the entire Ayush system. Therefore, the mind will get opened in the both. Just like allopathic systems have got the mindset, even Ayurveda has the same thing.
Swamiji, can I make a request? I just want to clarify it straight away because I'm very keen on that. So as I said, I think from my heart, not from my brain. There's nothing here, everything is here. If I start this system, so can I do it for students who are already pursuing a course? Say I'm doing MD medicine or neurology or XYZ. So can I simultaneously do this system, or do you feel I should start it separately? Because starting it separately will be difficult. PGI is a postgraduate institute of medical education and research, as we understand it. So won't it be better if I have a integrated course integrated with modern science?
Yes.
Is that okay?
Correct. That's exactly the thing, integrated system.
So I'll start and integrate it with MD medicine. So during their MD medicine, they're allowed to attend these classes also.
Correct. Sure.
It will be done.
That's right.
Right.
Thank you very much. That's why we take it forward. Adhiwad, thank you all very much.
Sorry I stopped you in between because I was very keen on this system. I'm very keen because I think, as I said, it's the science of the future, sir. Thank you, sir. Yes.
Thank you, Guruji. Thank you, everyone. I would request Dr. Pramod Avti to please come and give a vote of thanks to everyone.
So that they open up. Yes, I think this is wonderful. Yes, so I have done that.
Good evening, everyone.
It has to be done. There's no, I'm seeing it. I said
At the onset,
nothing is here.
I'm very honored, happy, and privileged to express my gratitude to all the dignitaries on the stage and off the stage for attending this international workshop on mind-body intervention, emerging status, and making it a very grand success. I would like to thank our chief guest, Sri Dr. H.R. Nagendarji, Padma Shri awardee, as well as the Chancellor of S. Vyasa University, who has graced his presence and enlightened us with his wisdom and knowledge of this field. And I would like to again express my sincere thanks for making us understand how, with his emphasis on the subject, trying to connect us with the external environment with the internal self, which is very important. And I would like to extend my sincere gratitude to our director, Professor Vivek Lal, who has basically given us important aspects connecting with our earlier history and how it is important and what we have lost and what is the need of the hour, which is very, very important. Thank you, sir, once again. And I would like to extend my thanks to CCR1 Director, Dr. Raghavendra Rao, as well as CCR1 for supporting this event financially as well as otherwise. And I would like to again extend my thanks to the UT Secretary, Health, who has given us an opportunity to make the guests take care of their hospitality, sorry. And I would like to extend my thanks to Mr. Akhil Kumar, Ajay Chakti, who are part of this hospitality, and thank you once again for making our guests more comfortable. I'd like to again thank Dr. Vipin Kaushal and his team for supporting this entire program from the beginning and making it a grand success. I take this opportunity to extend our most sincere thanks to all the faculty guests, including our chairpersons who have made it from their busy schedule to attend this event and make it a grand success. And I would like to thank all the speakers who have made it far from as well as into the from the nation and abroad, who are very well into their expertise into their respective fields and contributing their aspects to our present day system, so that most of us can be benefited and try to understand the bridge which can be minimized so that everybody can be on the same platform. Thank you once again. I'm thankful to Dr. Mithali Mukherjee from IIT Jodhpur, who has emphasized on development of evidence-based practices of the traditional medicines, including Ayurveda and yoga. Thank you, ma'am. Thank you once again. And Dr. Sanjeev Patra from the Central University of Rajasthan, who has joined us for this meeting and briefed all the participants on neurobiological aspects of sleep and consciousness. I would like to once again thank Dr. Kashinath from Central University of Rajasthan for highlighting the effect of yoga in improving the cardiac functions. I humbly thank Dr. Hemant Bhargav from NIMANS, who talked about the role of yoga in individuals with substance abuse and their disorders. I'd once again thank Dr. Rima Dada from AIIMS for sharing her insights on the role of yoga on lifestyle diseases, and would like to extend my sincere gratitude to Dr. Rich, who had mentioned that how the present day yoga can be percolated to the different places from one place using the modern tools of AI as well as ML. And I would like to, and who has again made us aware of new insights and perspectives of yoga involving emerging new technologies which can be used as an added tools and can support and can reach to various places, okay, that would have far-reaching impact on the use and the practice of yoga. I'm very pleased and to mention my deep appreciation to Elisa Wassel, Molly, as well as Susan from International Association of Yoga Therapies for joining us and making this event a wonderful and successful one. I would like to again thank our entire team of the CCRY and CMBI, as well as the entire institute, who has basically involved so much, grossly involved themselves to make this event a grand success. I would like to once again thank Mr. Nirmohi ji, who was a former anchor DD News, for giving a good rendition of our yoga center as a documentary. the one which was just before inauguration. And I would like to, in the end, but not the least, I would like to mention that it has been a very tough challenge within the shortest time possible to organize this event, and I would like to thank the entire organizing team with the support of our director, CCRYN, CSIR, who has given us funding in the shortest time possible and made this a grand success. And again, without the support of the army is the entire staff of the PGI as well as the center staff, CCR1, CMBI center staff, who had day in and day out been into this activities and made it a grand success. Thank you once again, all of you making your presence here, and I would like to basically attribute this success to all of you, without whose presence this might not have been a great success. Thank you once again.
Thank you, sir. I would request everybody to please stand for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you, everyone. Everybody is requested to join for the high tea in the ground floor. I would request the